Hello, good morning again, everyone.
Good morning, sir.
Good morning, sir.
Good
Good
morning,
morning,
sir.
sir.
Good
Good
morning,
morning,
sir.
sir.
Good morning, sir.
Good morning,
Good
sir.
morning.
Good morning, sir.
Good morning, sir.
Morning, sir.
Good morning, sir.
Good morning,
Good
sir.
morning. So, hi, everyone. Welcome you all to this pre- presentation competition today on the eve of World Pharmacist Day. So, team, we all are celebrating today 10th World Pharmacist Day that we have. So, let me give you a background about the World Pharmacist Day. Well, it is celebrated every year on 25th September, and this World Pharmacist Day was implemented at International Pharmaceutical Federation, that is FIP, Council in 2009. It was suggested to be celebrated every year, and the date 26th September was decided because on 25th September the FIP, that is International Pharmaceutical Federation, was established on 25th September into 1912. That's why the 25th September was decided as the day to be celebrated as World Pharmacist Day. And the aim of this celebration every year is basically to encourage the activities that promote and advocate the role of the pharmacist in improving the health in all corners of the world. That's why the World Pharmacist Day is celebrated every year, and it was suggested in 2009. Then in 2010, it was approved. So from 2011, we all started celebrating this World Pharmacist Day, and today we are celebrating the 10th World Pharmacist Day that we have. And as we can see, that if we compare the pharmacist role previously, like historical and current role of pharmacist, it has changed and evolved immensely. Previously, it was only related to the medicines, dispensing and manufacturing and all. But nowadays, it is more of different roles and responsibilities we have in our job profile of as a pharmacist. Like we have in research, in drug development, in pharmacovigilance, clinical research, and all. And also, more of the technical work is coming up to pharmacist, and the job profile of pharmacist is now not only uh, limited to dispensing or to the medicines companies and all. It is now to the corporates. Pharmacists are there, and also in the research department we have an immense role in the drug development process. So overall, in future also, there will be different profiles, different the evaluation, evaluation of the pharmacist will be there, and we will have more job roles and other responsibilities coming our way. So with this, I request Amit sir to uh, provide his thoughts on it. Amit sir, please.
Yeah. Thank you, Kuldeep. Yeah. Good morning, everyone. All of you. Are you with me? Again,
Yes, sir.
a different dialogue
Good
today,
morning,
apart
sir.
from what we can generally meet in a
Good
part of
morning,
a
sir.
Good morning,
session.
sir.
Good morning. Good
Yes,
morning.
sir.
Good. First of all, I appreciate all of you. Okay. The energy, the enthusiasm which you are carrying, the moment I see all of the people who are joining, and I can see there is a solid enthusiasm, and the the rigor behind this activity itself is loud enough that the day which we are going to celebrate is full of the pride which we are with on this account of this world's pharmacist day, because we are contributing in a different manner in a different sections, and with this energy and enthusiasm. So on account of this activity, through this platform, in this entire maybe through the on behalf of Cliniminds as an academics team, on behalf of faculties, every single member of this family, I uh, I wish a very happy World Pharmacist Day. We are going to celebrate it. How it's an interesting thing. So we have an opportunity, you people, to talk about different topics, and definitely that will create an energy. And this is how you can portray what is the contribution till now, what they have done. Of course, definitely what is happening today is the situation where we can see the pandemic situation which we are going through, and lot of things which we are already doing too, and to the full of capacity is what we have. And the most important thing, lot more things to do, and what is the future what we have. And this is why we are constantly a part of some education process. We are constantly be a part of some kind of learning development, gaining experience again and again. Even if you whatever the experience you have, the learning is a never ending story for us, including whatever the years of experience we have today. Even if I'm being so far, okay, this is a good opportunity for which I will just introduce myself, because I may be some of the students from my which I have conducted the batches, I might they are knowing to me, they are known to me. But these people, there might some candidates may not be knowing me. Myself, my name is Amit Nakhe. I'm faculty with Cliniminds since year to 2019 here, and I'm pharmacist by profession, and that's why uh, this is a proud day for me. Okay, and of course, lot many people, and like me, there are plenty of pharmacists around in this, maybe within at a national, international, all these are celebrating. This is a good opportunity for looking at where are we in terms of the profession, how are we servicing to the society, and plenty of aspects right now. Yes, so my name is Amit Nakhe. By qualification, I'm a pharmacy graduate, and I have total 16 years of experience, among which first 4 years I was with the bioequivalence and bioavailability studies. Then latter 10 year I was with Tata Consultancy Services, with the end-to-end pharmacovigilance practices. So, basically, and 2 years with the Cliniminds, that I'm training students from all the backgrounds like medicals. We have different and students like biotechnology, MBBS, so many. So likewise, all the spectrum of the students, what we can get an opportunity. It's an opportunity for us. Okay, and we try to learn and interact with you people, because of which we at the time of learning also we are learning that way. So it's a dual process. While teaching, while it rather than teaching, I say it's a conversation, because we constantly deal with you in context some other way, and we also learn at times something. So I'm sharing you something quickly. I will not take your much time, because I'm sure, because I'm very much sure that I'm today, unlike what daily you are curious about listening to my voice, or maybe my presentation, or maybe my sessions. Today is opportunity to hear all of you. So I will not take much of time, because almost Kuldeep has addressed what opportunity today we are gathered here, and for why we are gathering, what is the reason behind gathering together. And I will just share you quickly the maybe presentation around, and maybe you can get an opportunity to look at that fact. What are these? So Kuldeep, can you just allow me to allow me to share the presentation here? Hello, Kuldeep, are you able to hear me?
Yes, Amit, I've given you the co-host right. Now you will be able
Okay,
to share.
perfect. Thanks a lot, Kuldeep.
You are welcome, Amit.
Yeah. Okay, so let's quickly start. I'm not taking your much of time. I'm quickly taking through this what the today's day is all about, and almost Kuldeep has given a short idea about it. So quick glance at it. So what we are here is because we have a wonderful time to celebrate the 10th World Pharmacist Day, and that is being uh, on the date when we are going to celebrate is the 25th of September of each year. So today, that's why we are gathering here. And the theme what this year they have suggested is the transforming global health. So an interesting topic that they have suggested also. So we are having some thought process here how we look at it also in a quick time that we can go through. So we are associated with a plenty of pharmaceutical practices. As a pharmacist, we are specifically because it's a specific contribution. What we are trying to look at is by the pharmacist in the entire pharmaceutical world here. So plenty of practices the pharmacist is involved till now. I think those who are from a pharmacy background they can recollect. Otherwise, also those who are not from a pharmacy background they can have a just idea about what the conceptual discipline and what allows them to get into certain act of a practice, how they can be a part of the coachings, how they can be part of advocacy and services, how can they be part of the research. So plenty of aspects to look at. It cannot be in one slide you can think he can play a role of academic pharmacist, care home pharmacist, community pharmacist, a hospital pharmacist, then he can military pharmacist, a critical care pharmacist. Then there are plenty of roles like research and development, medical information perspective, handling the patient queries. Then there are medical. So as of now, we are into different aspects. So in within that R&D also you have pharmacology, toxicology, preclinical, clinical research. Within that we have in certain regulatory affairs. Then we have pharmacovigilance, clinical data management. Plenty of areas we are opening, and every single place. Again, not only limiting to this drugs or something. We are not only with drugs which are in. We are into the veterinary medicines. We are able to do the. Specifically, we are able to have participate, and we could contribute into the bringing the cheaper medicines which we have, and under the we are bringing able to contribute to the generic medicine development. Like we are part of the bioequivalence, bioavailability studies. So lot of places again we have plenty of places like the moment we have now right now also there are so many activities which are happening, the constant support which is still today also in this pandemic time. What we can see is by the retailer they are constantly able to provide 24 by 7 service around you for emergency treatments. Again we have retailers, wholesalers who are wonderful part of the distribution channel, supply chain management, because of which central storage of the medicines is possible, by which any person today if they want to have a quick access they can reach out to the medicine and on a given time. Also I can understand there are a lot of challenges which we are facing right now, maybe specifically if you can see around the situations like pandemic. But yes, whatever possible extent we can do that effort, we are trying to bring that effort. Might be maybe into manufacturing section, might be into the distribution, might be into resale, as well as into the regulation part of it, bringing the new moieties, bringing the new chemical structures, devising the analytical techniques, bringing the new techniques into the pharmaceutical analysis, bringing new types of the so different pharmacogenomics is opening for the pharmacoeconomics, so bioinformatics. So lot many areas are constantly in, because there is a constant need that we are having plenty of such open areas where we have areas of improvisation in terms of our health, and which is at times for last 6 months I can no need to no need to little explain also on that. Everyone today I can see, although we are celebrating today on this account, but I can see I can make a note that somehow if you recall maybe in last 6 months some of your friends, some of your family members, some of your neighbors, some of your maybe colleague, they're affected, maybe with some that is extending from a morbidity to might be a mortality kind of a condition. So we have this affecting, we are having lot of not only so lot of cost around the hospitalization which we are causing, and it is literally, that's why we are in lockdown for lot many months here, and we are compromising with lot many things. We are affecting with the jobs, we are affecting with the lifestyle, we are affecting with so many things, maybe lack accessing to the right treatment in the right time, because lot many things are happening around because of this kind of a pandemic spread of COVID-19. So yes, this is where, but constantly the healthcare section, it's constantly working, and where our role of a pharmacist, we are constantly able to play it with full of discipline, and that is where there is an opportunity. Are we doing full of our capacity? Yes, but is it sufficient? It's a question. Is it sufficient? Yes, there are, it is sufficient, but it demands, the demand is more, and we are still not able to supply that provision of the capacities to fulfill the requirements which we can see right now. So always there is a huge scope in developing or maybe betterment into this particular situation by contributing to the social administrative science, community pharmacy, clinical pharmacy, pharmaceutical science, definitely. Now this is why we are here. So International Pharmaceutical Federation, FIP, the global body who is representing, comprising of the departments of pharmacy, pharmaceutical scientists and educators, they have this kind of an thought here, and they representing over the 4 million members around the world who are a part of the comprising would be like so across the 146 national organizations, academic institutional members, individual member, pharmacists, pharmaceutical scientists, pharmaceutical educator. They are having a non-organizational body. Basically, it's a non-government organization which found in 1912. Then head office is in Netherlands. The aim of this particular non-organizational, or the body which we are having a title at the screen here, FIP, they are to support the development of pharmacy profession through the practice and emerging scientific innovations, and through the developing the pharmacy workforce in order to meet the world's healthcare needs expectations. So the FIB president Dominic Jordan, what he says, everyone benefits from access to what? Safe, effective, quality, and affordable medicines and health technologies, as well as from the pharmaceutical care services. And that is why we are able to remember their contribution here today. And this is what the great date that we can see on the screen, the title World Pharmacist Day. So as designated by in 2009 by FIC, Council in Istanbul, Turkey, 25th September marks the annual World Pharmacist Day. And FIP encourages pharmacists to use this day to organize activities that promote and advocate for the role of pharmacists in improving health in every corner of the world. Then what are we doing here as a pharmacist? You are playing a huge vital role, because you are a bridge between healthcare professionals and patients. So medicine and pharmaceutical world, they are we have to not compare, they are going very hand to hand, they are completely working in hand to hand. So medicinal practice, or maybe medicine practice and what pharmaceutical practice, they are very much going hand in hand. We are all proud of our profession contribution to the patient healthcare. Yes, and I take an opportunity, all of you, because some other way you, your friend, your maybe so all of your friends maybe within this section of healthcare, all pharmacists, definitely physicians, surgeons, medical staff, paramedical staff, so many other staff which is supporting this particular activities, all citizens who are showing patient support to the discipline what expected against or suggested by the regulations WHO. So they are all, we are all acting as a COVID warrior at the moment. But yes, this today's day, the pharmacist, a special thanks to pharmacist in playing a warrior role here in COVID-19, and that is going to be continued till this situation may be resolved, and definitely with all possible in all other possible ways, and in all other possible areas where we can contribute. So the job is not ending here. The job is constantly to keep on addressing these challenges. This is one of the challenge. We have lot many such challenges which we have, and where we are going to understand is what it is. It is your global health as a term which we have to understand. So what are the factors? Many factors there, like our health, safety, economy, including infectious disease, bioterrorist threats, natural or man-made disasters, then growing burden of the non-communicable disease. Is it not important in global health? All of you agree, correct? So WHO says on this, at a time when the world faces many new and recurring threats, the ambitious aim of this year's World Health Report is to show how collective international public health action on the build a safe future of the humanity. So there are WHO reports which can allow you to understand what are the exact statistics around it. So I've captured, thought it would be important in regard when you are looking at the report or something around it, this statement might add value to your reading. So for the purpose of this report, global public health security is defined as the activities required, both proactive and reactive, to minimize vulnerability to acute public health events that endanger the collective path of populations living across the geographic regions and international boundaries. So global health security is the existence of strong and resilient public health system that can prevent, detect, and respond to infectious disease threats and wherever they occur in the world. So CDC has a kind of statement on. So I would not take much of time because I'm sure you must be visiting WHO for the World Health Statistics for a lot many times. For your reference, when I share this presentation, might be with you, have a wonderful report of a World Health Statistics which allows you to look at every single comparison. Okay, maybe a high income country versus a low income countries with a middle income country. So all the geographic continent wise, disease wise, the severity wise, mortality wise, morbidity wise, all comparison table you can have. I will not take much of your time because I can see lot many participants are there today in order to conduct our competition also. I would not take much of your time. For your ease, I have just added a one single hyperlink to you. Might be after session, might be today's competition activity. You can have a look at it. Have a look at the statistics. I'm sure you must have a chance to look at it before also. But I'm trying to pull a snapshot of it, what we are looking at it. So also we are having some important topic which we can understand here is the urgent health challenges for the next decade. And this is where you have a future in contributing in that areas, and that is what we are going to look at, small snapshot around it. So these are challenges which I'm starting right now. What are these? Elevating health in the climate debate, delivering, this is by WHO. So I just pull down that particular report or maybe the pointers here. Delivering the health in conflict and crisis, making the healthcare fairer, then expanding access to the medicines, stopping infectious diseases, preparing for epidemics, protecting people from dangerous products, investigating in the people who defend our health, keeping adolescents safe, earning the public trust, harnessing the new technologies, protecting the medicines that protect us. So keeping healthcare clean. So these are plenty of challenges. Some of them are very explanatory, although they can be discussed and in a great length, maybe for an entire day. But I will not take much of your time here. I would try to address those challenges, maybe how they can be addressed through a maybe responsibilities within this framework of the responsibility of pharmacists. So rest of the matter, there is a wonderful write-up where you can find the activities which are being against to addressing these challenges by again in that hyperlink you can find it. But yes, today on account of pharmacist day, World Pharmacist Day, I will take an opportunities area where possible areas of transformation that are essential to address the challenges in view of role of the pharmacist. Now how they can contribute here, we have to understand what is today's behavior of a patient. We need a coaching. We can educate them in behavior manner. The moment we bring little discipline in plenty of the discipline practice, there can be the spread of the disease can be minimized. It cannot be totally prevented, but it can be minimized. Definitely the patient education and consultation can be more rigorous. Then active participation in the chronic disease management campaigns. We have to actively participate. It can be even strengthened. The patient-centric approach in ensuring the medication error remain continuously updated in terms of the new rules and regulations, because constantly there is an update, because of which there is a constant background which is changing in behind us on the front of our rules and regulations. So we have to constantly, so we must have a training system, a training infrastructure well in place, so we can improvise on that front also to stay updated with the information on available new drug therapy every single day. We have to be aware what is the existing best available treatment right now for the existing diseases. Develop knowledge on non-drug therapies as well as the traditional drug therapies. They can also an important value, can add value. Then could develop the knowledge on laboratory and diagnostic testing, development of patient monitoring techniques and skills. We can do it even better. So what other technology support we can take up here? Upskilled with the pharmacovigilance domain. We have to understand, we were till now there are, we are knowing what are the things, what we can see, but still there is a lot many things which we have to do in terms of encouraging every single segment of the healthcare to activate and to generate a rigor about whatever the observation around any adverse event they come across. They need to report it immediately and with a full detail, and they should support on the follow-up things. So they at we should absolutely spreading the knowledge about what is the requirement of the pharmacovigilance as an activity. Yes, definitely applying rigorous follow-up mechanism, remain updated with the, of course we have to constantly remain, because the reference safety information which allows the optimum use of a drug. So we need to be constantly updated about the indications, effectiveness, safety, compliance aspects with regard to the medication usage awareness. Then communicate and educate around public health program. There are constantly immunization program. There are lot many constant programs which are again launch again different authorizations, organizations. So we have to have a active participant leading the activities, so we can be a part of an important playing a role of a communicator here. Increase the awareness around the possible ways to diagnose the disease. We can, if we have any thought process, any observations that we can have, might be through the reading or maybe additional observations which we have. So create awareness on of course there are ways where we can sensitize on what are the techniques which are available for the pregnancy testing. There are certain counseling required in certain areas, advancing the communication around immunization, patient counseling with regards to the risk factors within the certain set of population, educating on associated risk with the cigarette smoking, programs for cessation of cigarette smoking, ensuring the best practices and guidances for again clinical data collection, handling, transfer, exchange, analysis, report, to remain updated on the global data exchange standards in order to smoothen the data exchange within the clinical and healthcare industry, which is at the moment a certain degree challenge. Use of updated and advanced technologies for documenting the patient record. We have a wonderful electronic health record as a system which we have to deploy. With certain areas there is a resistance because of the small scale or maybe a budget limitations or constraints to develop capabilities to cope up with the constantly challenging environment by upskilling in all possible healthcare skills and attributes, to keep demonstrating compliance with regards to the patient safety, data privacy, and data confidentiality. Contribute to dynamic and challenging clinical research field by constant education, learning, experience through many emerging fields such as clinical trial operations, patient safety, of course, pharmacovigilance, then that clinical data management, medical writing, medical coding, and many associated tasks. It would take even a good kind of list we can extend here. So my sincere request to all of you, be performing and be contributing as you are doing, as you were doing in the past, as you are doing today, and be with a more and more energy, with like more and more enthusiasm, and keep contributing yourself in the terms of global health to address the challenges, as we have to ensure there is a need of transformation. And this is what the theme which are we are trying to we are trying to understand and implement through the presentation. So I would expect you to take this message with this presentation, all effort what I try to do in this discussion here, and looking forward for your contribution. And a small journey of it might be we can start in short of time with a kind of a competitive competition which we're going to start. So thank you all of you, and have a wonderful day ahead with the our rest of the activities. So thank you, Kuldeep. Thank you, team, everyone. I hope you have had an idea about the World Pharmacist Day as a and the theme about this particular day and the facts around it. So I hope we are good enough with this discussion. Thank you, Kuldeep.
Thank you, Amit sir. Thank you very much for
Yeah,
this insightful session,
yeah.
insightful presentation. So,
Thank you, Kuldeep. Yeah.
thank you. Mm. So, everyone, now we can start with our competition. And first, I would like Yogita to start with the presentation, the competition. Yogita, please confirm, are you on the session? Are you on the call?
Yes,
I'm,
sir.
okay, thank you, Yogita. So I'm Yogita, I'm giving you the rights to present. Okay, you can present your presentation and then start. Yogita, you can present your presentation now.
Yes, sir. Okay,
Okay.
sir. So this is visible.
Yes, it is visible and you are all audible also. You can start with your presentation. Thank you.
Thank you, sir. Thank you, Kuldeep, sir. Thank you, Amit, sir. As you all know, we are here to celebrate World Pharmacist Day. It's 10th World Pharmacist Day. As Kuldeep, sir, and Amit, sir already explained why we are celebrating 5th, 25th on this World Pharmacist Day on 25th. So I would repeat this. The International Pharmaceutical Federation, the Global Federation of National Association of Pharmacists and Pharmaceutical Scientists, came into existence on 25th September 1912. So we are celebrating World Pharmacist Day on 25th September. It's a good morning to all of you. A very warm welcome. I would like to inform all of you for your, I would like to thank you for your esteemed presence. Myself, Yogita Joshi Bavari, and I'm here to present my views and topic, role of pharmacists in healthcare system. So first of all, we have to know what is health. So health is a word, it's very known, but it carries a lot of complications and troubles. According to the WHO, health is a state of complete physical, mental, and social well-being, and not merely absence of any illness. When we are talking about health, so healthcare system is also there. So it depends upon a healthcare team. And a healthcare team is a group of community who contribute to a common health goal and common objectives determined by community needs. Then why what healthcare team includes? Healthcare team includes doctors, nurses, lab technicians, dentists, pharmacists, and many more. So it's our day, it's pharmacist day. So we have to know about who is pharmacist. So in general, you all know pharmacists are also known as chemists or druggists, as healthcare professionals who practice in pharmacy, the field of science, health science focusing on safe and effective medication use. Apart from this, pharmacist is the one who deals with the field related to the medicine. But as we all know, we are not related, we are not in the field now only with the dispensing and prescribing the drug, giving the drug. But now we are cultivation of medicinal plants, extraction, synthesis, clinical and non-clinical experiments, dispensing, monitoring, and pharmacovigilance. Then in India, it's a general ratio. In India, there are around more than 10 lakh pharmacists working in various positions. They apply their unique knowledge and skills contributing to the health of nations. Pharmacists are involved in scientific procurement and distributions of medicines. They help in achieving the goal of rational uses of medicine. They have through knowledge about their medicine and their use are in a better position to educate other health professionals about the rational use of medicine. Now, what are the roles? The, why, from how they are contributing? So, pharmacists can effectively contribute to public health by they are doing patient counseling, they are participating in national health programs, they are participating and ensure the health promotions, the de-addiction services, professional dispensing, screening services, community awareness, medicine management. Apart from this, pharmacists Apart from this, role of pharmacist in healthcare system is many more. He plays an important role in healthcare system, or you can say pharmacist is a front line of healthcare. It means it is a bridge between general physician, nurses, and other professionals and public. He works in a community as a community pharmacist where he advises the public on the treatment of minor ailments like cough, cold, fungal infections, headaches, etc. He worked in hospitals where he maintained medical records, influenced the selection of drugs and the dosage regimen. He also worked in the field of research. He plays various roles from designing and implementing protocols to conducting a trials to study or compare effectiveness and safety of new medicines before it's launched into the market. He's also performing and doing his best in academics. He plays a pivotal role in educating future generations. He produces the skilled pharmacists to fulfill the future demands of the market. He also moving in the part is participating in the field of pharmaceutical industry where he ensured the implementation of good manufacturing practices. So moving to the next slide, this slide says, what can pharmacists do for you? Your pharmacist, your medical expert. As we already talked, what pharmacist is doing now? He interpreted drug interaction, he managed chronic illness, he counseled the prescriptions, helps you to quit smoking, that is servicing and de-addiction services, make medication information understandable. As we all know, doctors is very important for our world. So this word doctors are very important. But no one can understand the language. I'm not saying one of my every doctor has not a good handwriting. Yes, some have very good handwriting, but yes, your medication information understandable made by your pharmacist. So it is necessary. He provides you vaccination, that OTC counseling he is giving, that over the counter. He has you to stay out of the hospital. He wellness screening, he will prepare and check medication. So these all things a pharmacist can do. So as we read what is pharmacist and what's the role of the pharmacist. So a day in the life of pharmacist. This presentation, this screening is all about pharmacist consults with clients about over-the-counter medication for common ailments, as we already read this. Instruct patients on how and when to take a prescribed medicine. He supervised and trained pharmacy technicians. He gave you preventive vaccination to provide advice on healthy living. And this is the role where he is contributing. Pharmacy is a dynamic, information-driven, patient-oriented profession. In the field of healthcare system education, they are providing. In the field of cost-effective therapy, he is providing. He is giving his best knowledge in essential care services. He advises on the safe and rational use of medicine. So at the last, I want to say that I'm not a doctor, but I serve humankind to make sure that they are relieved from pain because I am a pharmacist. So again, I'm saying a happy National Pharmacist, World Pharmacist Day to all of you. Thank you. It's been a pleasure being with all of you. Thank you for the patience. Thank you, everyone. Thank you, sir. Sir, can you hear me? Hello? 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 Am I
Yeah, I can
audible?
hear you. Yeah, you are audible. Thanks for a wonderful presentation.
Thank you so much,
And
sir.
yeah, wonderful, wonderful. So give me a second. Let me give some this. Just a minute.
Hello, Kuldeep.
So thank you, Yogita, for the insightful presentation. Thank you very much. Now, now let's move to the second student for today, Akshaya Chilwarwar. I'm unmuting you, Akshaya. Are you able to hear us, Akshaya?
Yes, sir. Yes, sir.
Thank you. So you can present your presentation. Please ask for sharing the screen, and I will give you the right for sharing the screen. Click on share screen.
Hello, sir.
Yes, Akshay.
Sir, I clicked.
You clicked on the share screen.
Yes, sir. Only.
Give me a minute.
Yes, sir. Hello. Is it visible, sir? Hello. Hello, sir. Is it visible to everyone? Am I audible? Hello. So can I start? Okay. Good morning, everyone. And myself, Akshaya Chilbarbar, and today I'm here to present about the roles of pharmacist in the healthcare system. First, I would like to wish all of you a very happy Pharmacist Day, as today is the World Pharmacist Day, and which is a very important day for all of us who work in a healthcare system. I would like to discuss about the introduction part of the health and the pharmacist. Then we will see the who is the pharmacist. Then we will see the roles of pharmacist in the healthcare system. There are different sectors where the pharmacist work, like in academic, in a community, or a industrial, hospital, and the pharmacist with a special interest. Here is the introduction part of the health and the pharmacist. As we all know, during the last few years, the pharmacy profession has expanded significantly in terms of professional services delivery, and now has been recognized as an important profession in multidisciplinary provision of the healthcare. There the basic needs like before there are the basic needs like water, food, and shelter, but nowadays medicine also an basic and important need for the everyone. So what is the health? Health is the central concept of the quality of life. Hence health is the worldwide social goal. To achieve this goal, every nation sets an professional person in the healthcare system. So who are these professional persons? These professionals include in the healthcare systems are the pharmacists, the physicians, the doctors, nurses, or the compounder or the dispenser. Pharmacist is the backbone that strengthen to the healthcare system. There are different roles of pharmacist in the different sector of a pharmacy profession, like industrial profession or academic or a community health or the clinical research or a drug design and discovery. This is the physician can give medicine to the patient, but the life to the medicine is given by the pharmacist only. We'll see the who is the pharmacist. A pharmacist is the person who can legally sell the drugs. Tools to trade include the paper and pen, who wears a white coat or the apron and understand what this means. Like if the doctor prescribes some medicine on a prescription, and like our normal people, we are not able to read it. But as gave this prescription to the pharmacist, he can easily understand what is written and what medicine has to given. A group of professionals who are extra special, who loves to give a people a dose of their own medicine. This is a kind of a definition of a pharmacist in an easy way. Then we will see, according to Pharmacy Act in 1948, a registered pharmacist is a person whose name for a time being is entered in the register of a pharmacist of the state in which he is for the time being residing or carrying on his profession or a business of a pharmacist. These are the some characteristics of the pharmacist, which name like a pharmacist. The P is stand for the patients throughout his study of the pharmacy. He's honest with his occupation, and he has a alertness. He has a very good contribution in research. He's a motivator. He's an administrator. He's a courageous and intelligent and studious and a thinker. Then we'll see the roles of pharmacist in the healthcare system. There are many phases of pharmacist, like there are very different sectors where the pharmacist work, like in academic, in a research, or in a community, or a hospital pharmacist, or in a marketing, or the regulation, or a manufacturing. From the formulation of the drug till its sales and marketing, the pharmacist has a different area where they work and contact and tell the importance of the drugs to the everyone, not only to the doctors and compounders, to the normal people also. Here we can see, we'll see the role of pharmacist in each each sector. First, academic pharmacists. Pharmacists, they process in-depth pharmaceutical knowledge, and they play a pivotal role in educating future generation of a pharmacist. They are the lecturers and the tutors who impact their invaluable knowledge to the pharmacy student in the universities or the colleges. Education training program helps to professional knowledge. The pharmacist gets drugs and the therapeutic action through their overall. We can say academic pharmacist is the preliminary second one is towns and villages across the nation. They work from their own pharmacy or out of the local healthcare center and the doctor surgeries. Commonly, pharmacists are, sir, can I add up? She's Janvi P. Hello. Sir, but there is no one waiting here.
Please, Akshaya, please continue your presentation if it is not completed. Please. Okay. Yeah.
Pharmacists, these were across the nation. They from one pharmacy. Hello.
Yes, we are able to hear you, Akshaya.
Hello.
We are able to hear you. Please continue.
Hello, sir. So can I continue? Hello, sir.
Yes, yes, please continue.
Sorry, sir. Hello. Sorry for the interruption. The community pharmacists are your friendly partners in the healthcare. They are the health professional most accessible to the public. In addition to ensuring an accurate supply of the appropriate medicine, they also provide a counseling for the patient and the drug information to the health professionals, patients, as well as the general public. The great example of this community pharmacists are the medical representative. Next are the industrial pharmacists. These pharmacists are work in a various part of the industry, like in a research and development for the development and the formulation of the new drug or the new drug or a new entity, in a manufacture and quality assurance, where the in an industry, the pharmacist broad knowledge and the pharmaceutical science ensures the integrated approach to the quality assurance, including with the good manufacturing practices through the validation of the various stages of the production and the testing of the products before it release. The drug information, where the pharmacist has the knowledge and expertise to provide the detailed information on the medicine to the member of the health profession and also to the public. Then the parent application and the drug registration, where the pharmacist is ideally qualified, and he is qualified to understand and collect the diverse information required for the patent and authorization and the submission of the drug. Then there are the sector like a clinical trials and post marketing surveillance, where the pharmacist work has pharmacist also works here, like he has the knowledge of the drug, and he has also the knowledge of the healthcare provision required to facilitate the collaboration between the companies, health professionals, and the government in the relation to the clinical trial and the surveillance, where the sales and the marketing. The pharmacist who's a professions ethics demand a concern for the interest. The patient can make a contribution to the proper marketing practice related to the healthcare and to the provision of the appropriate information to the health professional and to the public also. Then next sector is the hospital, where the pharmacists work. The hospital pharmacists are the vital part of the healthcare system. They are an integral part of the multidisciplinary team consisting of the doctor, nurses, and the other health professional, by rounding with the doctors, writing policies governing medication use, and the champion safe and effective use of a medication in the hospital setting. They provide a valuable advice and the drug information not only to the patient but to the other healthcare provider as well. Hospital pharmacists often deliver nurses and the doctors continuing education lectures. They manage the purchase, distribution, and investigatories of the medicine for the whole hospital. The pharmacist with the special interest. Pharmacists with the special interest are involved with the developing their skill and expertise in a specialist area such as a cancer or a diabetes. Most half of the all pharmacists, like 42%, offered additional clinical and educational services to the community resident, including blood pressure checks, screening for the cholesterol or the osteoporosis, the glucose screening, and the diabetes counseling, tobacco concession program like immunization. As per the government of India, now pharmacist is considered as the Arogya Doot, who can formulate, compound, and dispense the medicine in his pharmacy. Then the pharmacy is a complete profession. The pharmacy reflects on every sector of the society. In the pharma artist who is able to designing a drug dosage form, who is a lawyer, who can act as a lawyer, having their fair knowledge of laws and legislation about the drug. He can be an engineer also, having a sound technical knowledge of the pharmacy sector. It can be a entrepreneur with the sound knowledge of management, accounting, marketing, and the counseling of the drugs, and the health professional having the fair knowledge regarding the health. That's all with the roles of the pharmacist. Thank you everyone, and sorry for the interruption due to some connective issue. And I again wish all of you a very happy Pharmacist Day. Thank you, sir.
Thank you, Akshaya, for the presentation. Thank you very much. Now, guys, the next student is Amala.
Hi, sir.
Hi, good morning, good afternoon.
Good
Now,
morning.
Amala,
Good
I'm
afternoon.
giving you the host right. Then you can share
Okay,
your screen and then present.
sure, sir. Is my screen visible, sir?
Share it.
Hello?
No, it's not visible. You can try to share it again.
Okay, sir.
Yeah. Amala, please share your screen. We are not able to see it.
Sorry, sir. I think I'm having some technical issues.
Okay.
I'm trying to share it, but I don't know why it is not showing up.
So please check your connection till now. Then I think we can get to other next student. We will get back to you, Amla, after the next
Sure,
presentation.
sir.
Okay.
Sure, sir. Sorry for the
Uh,
interruption.
no problem. So next we have Dr. Anuj. Dr. Anuj, just 1 minute. I'm unmuting you.
Hello?
Hello. Yeah, Dr. Anuj.
Yes, sir.
Now I'm giving you the presenter right. You can present your presentation.
Thank you, sir.
You're welcome. Yeah, Dr. Anuj, you are the host now.
Yes, sir. Sir, is it visible?
Yeah, it is.
Uh,
Yes, you can
can
start,
anyone?
Dr. Anuj.
Yeah. Good afternoon, everyone. Myself, Dr. Anuj. I am working in a government setup in Ahmedabad, Gujarat. And first of all, would like to wish everyone happy Pharmacist Day. Everyone getting the voice? Hello?
Yes, yes, doctor. We are able to hear you. Please share your screen and then you can please continue.
Hello?
Yes,
Yeah.
doctor, we are able to
Okay.
hear you.
So, Okay, sir. Okay. So the today's healthcare system. First of all, who is a pharmacist? Well, according to the Pharmacy Act of 1948, which was published on 4th March 1948, a registered pharmacist is a person whose name for the time being is entered in the register of the pharmacies of the state in which he or she is practicing or residing for the time being and carrying on his profession for business of pharmacy. Now, the word pharmacist can be elaborated as the one person who is having a patience to deal with the patients, patients to deal with the patients. The one who is having is involved in the research and patients to deal with conditions and the various motivator because the patients are usually depressed and requires some kind of motivation. Who is a good administrator and can work for the store management and management of pharmacy. Who is a courageous person able to take risks. Who should be intelligent enough, should be studious and a good thinker. This is how you can summarize a pharmacist. The principal task of a pharmacist. The principal task of pharmacist is to identify, first of all, then resolve and prevent the drug-related problems that can happen to a patient. The focus should the focus of pharmacist is now shifting from technical product-oriented functions to more of a patient-oriented health outcomes counseling and information professional services. Medicines are today considered as the fourth basic need of modern man after food, cloth, and shelter. So, what should be a mission of the pharmacist? The mission of the pharmacist should be right drug to the right patient at the right time, in the right dose, to the right route, and in a right way. Right drug means the exact drug which is actually required by a patient depending upon his medical condition. At the right time means when he should take it in the morning, evening, afternoon, night. In the right dose means the exact milligram or the gram that is required. To the right route means the routes of administration, whether it is to be taken oral or through intramuscular route or intravenous route, and in the right way. By right way, it means maybe before meal, after meal, should be taken with milk, etc. So this is the mission of a pharmacist. Now, what are the traditional roles of pharmacists? As per earlier times, it included compounding and dispensing the medications and with safety and effectively. Then there should be a competence in non-prescription drugs like the over-the-counter drugs like paracetamol for fever or diclofenac for painkiller. Then medication devices and counseling with easy accessibility to the general public. And he should be encouraging the compliance of medication regimens, particularly in patients like TB. Now, the roles of pharmacists can be summarized in this cycle that includes education and training and medicine supplies, dispensary, information, quality assurance. Each of one we will taking in detail in the next slides. Primary care. The primary care includes the best use of medicines for resources where the pharmacy or you can say primary healthcare center is located, usually seen in a government setup. The same on a larger scale is at community healthcare centers where the role is restricted, not restricted to some smaller area, but an entire town, village, or even a taluka is involved, which offers advising and practical help on keeping the good health. And he is a highly respected person in a proper marketing of the drugs to the healthcare providers and selling of drugs to the public. Other roles include roles in academic, which focuses on teaching, then training of the junior pharmacist or the upcoming pharmacist, and being associated with academic institutes or as a instructors in training programs of different pharmaceutical companies. Another important role is in the research, and this includes research activities to expertise in formulation developments to ensure maximum biological availability of the drugs. Another one is quality assurance, where pharmacists can utilize his assurance and good manufacturing processes for the manufacturing of the drugs and also in testing. Other roles include clinical trials to utilize the knowledge of the drugs and various aspects of pharmacodynamics and pharmacokinetics to ensure that there is a coordination between the companies, healthcare professionals, governments in clinical trials, and also patients are aware about what is being given, and also in the post-marketing surveillance. Now, there is a special role for a pharmacist who is in some special interest in particular diseases like cancer and diabetes. They can have an expertise in such areas, and they can also carry out different other activities like blood pressure checking on a community level, diabetes counseling, and can play an important role in tobacco cessation programs. Overall, what can a pharmacist do? Well, your pharmacist is a total medication expert. He can provide medication to patients and it can interpret chronic diseases, help to provide vaccinations, then OTC, over-the-counter drugs counseling, and helps you to stay out of hospital, which is an important thing by promoting and giving you advices on and tips on maintaining your health. Stay up to date on the matters which are mattering to you, like latest science and knowledge about latest developments in the drugs and wellness screenings. To conclude, I would like to say that pharmacy is a complete profession because it reflects on the every sector, like in the form of lawyer, having a fair knowledge of the laws which are governing the drugs and their developments, also aware about the various legislations that can be applied if some wrong drug is given. Artist, because he is well aware of the dosage form and is designing it to the exact detail, micro detail. Third is an entrepreneur. He is in sound knowledge of management, bookkeeping, marketing, counseling, etc. Also engineer because having of technical knowledge, and a health professional because having knowledge about disease and its possible causes, maybe just less than the doctor, but having a good sound knowledge of diseases. So from the research to healthcare, your pharmacist is always at your service. And according to Government of India, pharmacist is now considered as Arogya Doot, the one who can formulate compounds and dispense medicines in the pharmacy. And the role of pharmacy in COVID has been duly appreciated by everyone today, including the Chief Minister of Gujarat, Vijay Rupani, in his public address today, called pharmacists as Arogya Doot. And as all of us are aware, there is one couple challenge going on Facebook. And I will like to say that the best couple is doctor and a pharmacist. With that, I would like to conclude, and thank you everyone for your time and patience.
Thank you. Thank you, Dr. Anuj, for the presentation. Thank you very much. Now, let's get back to Amla. Amla, I've unmuted you.
Yes, sir. Let me try sharing, sir.
Okay. I've just
So I,
unmuted you. I have not provided you host right now. You are
okay.
the host. Now you please try to share the screen.
No, sir, I have not received the access. It is again telling like only the host can share this meeting. Hello, sir.
Yeah.
Yeah. Um.
Now you are the host, Amla.
Yeah. Okay, sir. Sir, while I'm sharing it as okay,
Yeah, your
can
screen.
you?
Screen.
Okay.
Yeah.
Okay, sir.
Yeah.
Are you able to see my screen, sir?
Yes. Yes.
Okay, sir. So, good
Please start.
afternoon to
Please start.
everyone. So, I am here to perform a small presentation on the role of pharmacist in healthcare system. Before starting, first of all, I would like to share who is the pharmacist. So, everyone is having a thought like a pharmacist is a person who just dispense tablets or who runs a shop or whenever we have a doubt in the prescription that we got from the doctor, we can go to a pharmacist and ask, so what is this medicine for? How can I use it? What time I have to take this? So basically, more than that, pharmacist does something. So by WHO, it describes that a pharmacist is a person prepared to formulate, dispense, and provide clinical information on drug or medication to health professionals and patients. And also, pharmacist is one of the patient person in healthcare team, and he plays a key role in providing quality healthcare and pharmaceutical care to the public. So when we go deep into the responsibilities and roles of a pharmacist, we can identify a various field they are very proficient at. So um, when to enhance the role of a pharmacist in the healthcare system, the WHO, the World Health Organization, and FIP, the International Pharmaceutical Federation, published a handbook on developing pharmacy practices, a focus on patient care. So, which proposes a seven-star model of a pharmacist, which says that this diagram shows that seven-star model, which says that the pharmacist is a caregiver, a decision maker, a communicator, a manager, lifelong learner, teacher, and a leader. So, as a pharmacist, pharmacists provide caring services to the highest quality and must view their practice as integrated and continuous with those of their healthcare system and other health professional, which makes him a caregiver, and he is a decision maker. So the foundation of the pharmacist work must revolve around the accurate decision they make or taken regarding the appropriate, safe, and cost effective use of their resources. For example, like personals, medical, medicines, chemicals and equipments, procedures and practices. And next comes the communicator. They act like a bridge between the physicians, patients, and the healthcare professionals to have a better communications between them. They are always a manager. The pharmacist must have the ability to manage the natural and commercial resources, which include the manpower, physical and financial resources. And they are a lifelong learner. So anyway, everybody knows that with the pharmaceutical degree, we are not complete with all the information. So lifelong on during their experience, they are learning a lot of things. They are gaining more knowledge and wisdom on what they are doing. Work more hard. Pharmacist is the teacher who can teach. They are having the responsibility to assist with the education and training of future generation of pharmacists and the general public. So every time we can go ask them for more details. If you have any doubts, we can consult them for knowing more details about any medication that we are not aware of. And they are always a leader. The pharmacist plays a great leadership role in the health efficiently. This particular chart shows the roles of pharmacists in various sectors they work in: clinical survey, they act as industrial pharmacist, they can be a drug inspector or development wholesalers and retailers or hospital pharmacists, etc. As an academic pharmacist, they focus on teach. So in the industrial pharmacist sector, there are different categories which include the manufacture and quality assurance, sales and marketing. So in the manufacture and quality assurance team, pharmacist board knowledge of their pharmaceutical science ensure an integrated approach to the quality assurance, including the good manufacturing practices through the validation of the various stage of production and the testing of the products before release. In the sales and marketing, um, they make a contribution to proper marketing practices related to the healthcare and to the provision of appropriate information to healthcare professionals and public. They act as a community pharmacist. They work as community pharmacists, like bridge between a general physician, nurses, and other healthcare professionals and public. Uh, they also act as a hospital pharmacist. Actually, they work in hospital and institutional pharmacies, frequently interact with the prescribers and doctors, and they maintain the medical records, influence the selection of drugs and dosage regimens. They monitor the patient compliance and therapeutic response to drug, and they also recognize and reports the adverse drug reactions. Nowadays, they also work with the research and development industry. They contribute their expertise and their wisdom to the research and development industries to for the new for the innovation or discovery of new drugs, which the major a part of a pharmacist play nowadays in clinical pharmacy. Actually, a clinical pharmacist work directly with the physicians, other health professionals, and patients to ensure that the medication prescribed for the patients contribute to the best possible health outcomes. And there are a type of pharmacist with special interest, like the pharmacists with special interest are involved with developing their skills and expertise in specialist areas such as cancer or diabetes, like that. Finally, the pharmacist can efficiently contribute public by this manners, like patient counseling, national health programs, medicine management, health promotions, community awareness, screening services, professional dispensing, and de-addiction services. So these are all about the roles and responsibilities of a pharmacist in a healthcare system. So I'm concluding by this. Thank you, everyone.
Thank you, Amala.
Thank you,
So,
sir.
thank you very much. So next, Surya Ranjan, I'm unmuting you. Please confirm. Are you able to hear me?
Sir, can you hear me?
Yes, Surya, we are able to hear you. So I'm giving you the host right, Surya. You can present
Okay, sir.
your presentation then. You are the host now.
Sir, is it visible?
Yes, your slide is visible. You can go to the slideshow and then start the presentation. Thank you. And also you are audible. Okay.
Okay, sir.
Thank you. Start.
Good afternoon, everyone. I'm Surya Ranjan. I'm a PharmD graduate. I'm doing advanced postgraduate diploma in clinical research and pharmacovigilance in Cliniminds. As you all know, today is 25th September, and we are celebrating 10th World Pharmacist Day. And I'm here as a part of it to give a presentation on the topic, role of pharmacists in healthcare system. So let me start with the terms pharmacy and pharmacist. The word pharmacy was coined from the Greek word pharmakon, meaning medicine or drug. Therefore, pharmacist is a medicine or drug man. Pharmacists are also known as chemists or druggists. To start with the definition, in simple words, we can say that a pharmacist is a person who is professionally qualified to prepare, preserve, distribute, and dispense medicines. Or in an elaborated word, we can say pharmacist is a person who work in collaboration with other healthcare providers and identify, monitor, resolve, and prevent drug-related problems and act as medical counselors, educators, and advisors. Roles of pharmacists in different sectors of healthcare system. So community pharmacists, that is mainly related to the retail and wholesale pharmacies. Clinical pharmacist, that is the one who is related to hospitals or clinical side, or drug information pharmacist. And then hospital pharmacist, that is in hospitals, working in hospital setting. Industrial pharmacist, who is involved in research and development, manufacture and quality assurance, clinical trials, sales and marketing. Academic pharmacist, that is one who is involved in teaching, research and training to junior pharmacists. Regulatory pharmacist, that is someone who is involved in the rules and regulations, drug inspectors and government analysts. Research and development, medical representatives, and veterinary pharmacists. Duties of pharmacists in different areas of pharmacy practice. It is mainly divided into two categories, that is drug distribution services and clinical pharmacy services. In drug distribution services, we have non-clinical services and clinical services. In non-clinical services, that is mainly attributed to the retail or wholesale pharmacies. The pharmacists perform functions like compounding and dispensing, purchase, inventory control, counseling, and distribution. And in clinical services, the pharmacists are engaged in doing the rational use of medicines, essential medicines, pharmacovigilance and ADR, and health education. The WHO report on the role of pharmacists in the healthcare system states that the competence of the pharmacist is already proven in these terms, that is in health promotion and social responsibilities, that is involved in the prevention and management of chronic diseases, in the direction of pharmaceutical services, in drug regulation and control, in the formulation and quality control of pharmaceutical products, in the inspection and assessment of drug manufacturing facilities, in the assurance of product quality through the distribution chain, in drug procurement agencies, that is something related with the drug purchase, receiving, stocking, and payment. In national and institutional formulary and therapeutic committees, that is in formulary decision making, and also they are members in therapeutic committees. WHO also recommends a ratio of 1 pharmacist per 2,000 population for optimal healthcare to be delivered. Now let us see some of the contributions of pharmacists to the public health. These include community awareness, that is in case of some chronic diseases and infectious diseases, patient counseling, that is in terms of drug use, its dose, frequency, indication, the contraindications, and all that. De-addiction services, which is like the case of smoking and alcoholics. Screening services, that is attributed to screening of blood pressure, cholesterol, screening of blood glucose levels, etc. Professional dispensing, national health programs, medicine management, health education, that is in the prevention of diseases, and health promotion. Pharmacists have more opportunity to interact closely with the physician and the patient, and hence act as a bridge between them to minimize the untoward or adverse effects of the drug. That is, they are a bridge in between the prescriber and the patient. If well utilized, pharmacists can effectively help in achieving the goal of public health in India by overcoming the scarcity of healthcare professionals. Pharmacists, they are your partner in health, and pharmacists, we care no matter where. Well, on this special day, I would also like to remember some of the few pharmacists who had inspired us, like Alexander Fleming. As you know, he had contributed to the discovery of penicillin. Friedrich, who has discovered morphine. Mahadeva Lal Scroff, who is the father of Indian pharmacy education. David Jack, who has developed major drugs for asthma. And last but not the least, on this World Pharmacist Day, my hearty wishes to all the pharmacists over here, and thanks to all the others in the healthcare team for your support to the pharmacists. And let us all work together to promote optimal health to everyone. Thank you.
Thank you, Surya. Thank you very much for the presentation.
Thank you, sir.
Thank you. Uh, so, guys, next student that we have is Angel. Angel, I'm unmuting you. Please respond. Are you able to hear
Yes,
me?
sir. Yes, yes.
Okay. So, Angel, I'm giving you the presenter right.
Okay, sir.
So, you are the host now. You can share your screen.
Okay, sir. Sir, will you ask the other person to stop the share screening?
Surya, please stop the share screen from your side. Guys, whenever your presentation is completed, this is to everyone. After that, please stop the share screen from your side, and then you can, so that the other person can share the screen. Okay, Angel, please share your screen.
Okay, sir. Sir, I hope it's visible.
Yes, it is.
Okay.
And you are audible also. You can start the presentation. Thank you.
Okay. Good afternoon, everyone. I am Angel Marian Jacob, and my presentation topic is role of pharmacist in healthcare system. It is undoubtful that pharmacists play a key role in the healthcare system of a country. They have their role right from the development of a drug through the availability of the drug in the market, and even after that, that is, by monitoring the effectiveness and the safety of the drug among the population. So, first, let us see who is a pharmacist. A pharmacist is a healthcare professional who is licensed to engage in pharmacy with duties including dispensing of prescription drugs, monitoring of drug interactions, administering vaccines, and counseling patients regarding the effects and proper usage of drug and dietary supplements. They are uniquely qualified as they have technical information on the medicinal products, can educate other health professionals about the rational use of medicines, can monitor patient compliance, recognize and report adverse drug reaction. Pharmacists are the first as well as the most accessible healthcare professionals individuals seek for care, and many pharmacies are open 24 hours a day with no appointment necessary. So we can say that pharmacists provide care and advice across the community round the clock. Now let us see certain roles the pharmacist can play in the healthcare system. First is in preventing drug interaction. Due to people suffering from multiple ailments, they are prescribed with different medication. And this sometimes can cause serious drug interaction that can affect the safety of the patient consuming it and the effectiveness of the drug. But pharmacists are in a unique position. They can identify this early and bring it to the notice of the prescriber and educate and counsel the patient regarding the proper use of medication in order to avoid these drug interaction. Next is role in medication safety and quality assurance. We know that the medicines and health supplement should be of good quality. So this medicine and health supplement that reach the patient must be of good quality, and it must have the adequate ingredients that produce the desired effect. If it is substandard or falsified, it poses a significant health risk worldwide, because these poor quality medication that have wrong amount or lack of ingredients can lead to increased morbidity and mortality. Given their role in quality assurance across pharmaceutical system, pharmacists can contribute to the design of processes and programs to improve medication quality and improve health outcome across a variety of healthcare settings. Next one is a role of pharmacist in pharmacovigilance. We know that pharmacovigilance is the branch that deals with the detection, understanding, assessment, prevention of adverse effects of drugs. That is, they basically target safety of medicines. Since pharmacists are drug experts, as they are specifically trained in the field of medicine, with training in pharmacovigilance field, they can monitor the performance of drug and also identify adverse drug reaction, thereby protecting the health of patients and ensure safety of medicines. Next is the role of pharmacists in rational drug therapy. Nowadays, there is an increased tendency among people to undergo self-medication, which lead to serious threat like antimicrobial resistance. Pharmacists can address this by promoting rational use of medicine, by giving them the appropriate patient education regarding the adverse drug reaction, dose schedule of drug, and also warn them about the unwanted effects of drugs if not consumed as instructed. Next is role of pharmacist in nutrition counseling. Pharmacists are the healthcare professional who have an excellent communication with patients. So they can counsel patients on lifestyle modification and appropriate medical nutrition therapy to manage obesity, hypertension, diabetes, and liver disease. There's a special group of pharmacists. They are known as nutrition support pharmacists, and they are the specialists in providing and managing enteral and parenteral nutrition to diverse population, from pediatrics to geriatrics. So the role of pharmacists is not restricted to what I have mentioned. They have variety of roles. They have role in research and development, regulatory affairs, clinical safety, and also in the present scenario, that is fighting the pandemic. They are educating the patient regarding the use of masks, how to use it properly, the safe disposal, need of sanitization measures. So in all these fields, pharmacists have their hand. And the role of pharmacists is emerging continuously to meet the need of society. Now we can say that they are a coordinator between different members of healthcare team and the patients. And organizations such as WHO, CDC, they are encouraging community organization and other healthcare professionals to partner with pharmacists for the effective planning of public health service. Thus, we can say that the pharmacists play a key role in healthcare system, and their role is worth appreciable as it improves the quality of the healthcare and thereby transforming global health. Thank you for your patience. And before winding up, I would like to thank Cliniminds for giving this opportunity on World Pharmacist Day. Thank you everyone for listening. Thank you.
Thank you, Angel. Thank you very much for the presentation. It was a good one. So, guys, next we have is Archana Geet. Archana, I've
Okay, sir.
unmuted you.
Okay, sir.
So I'm giving you the presenter, right?
Sir, it is showing like host disabled screen sharing.
You are the host now. You can share the screen
Okay,
now.
okay, okay. Sir, is the screen visible?
Yes. Yes, Archana, your screen is visible. You can start the presentation. Thank you.
Good morning, everyone. First of all, I would like to thank every faculties who take initiative to conduct the presentation competition on this special day, the World Pharmacist Day, celebrated on 25th September. Myself, Archana Geet, and I am here to present the topic, the role of pharmacists in healthcare system. First of all, who is a pharmacist? We know that pharmacists are healthcare professionals who practice in pharmacy. Pharmacist is one who deals with all fields related to the medicine. Nowadays, food, clothes, and shelter are the basic needs of human being. But nowadays, medicines are also being a major basic need of human being. And these medicines can be manufactured only with the help of a pharmacist. A pharmacist is regarded as an expert on drugs. They should be qualified by education because they should have a understanding of the biochemical mechanisms of the drug uses, therapeutic roles, side effects, potential drug interactions, and monitoring parameters. Then what the word pharmacist stands for? They should be patient, they should be honest, and they should be alert in every situations, and they should be able to do research. They should be a motivator, and they should be administrator. They should be courage enough, and they should be intelligent, studious, and a thinker also. Then carrying on with the roles of the pharmacist, we can see pharmacists and as doing so many roles in the healthcare system. First one is the academic pharmacist. They focus on teaching, research, and training of the upcoming pharmacists. They produces the skilled pharmacists to fulfill for the future demands of the market. They give the future generation proper education and knowledge in pharmaceutical practices. Then the contribution of pharmacists in the research and development. Pharmacists contributes to research and their expertise in formulation development is of particular relevance to the biological availability of active ingredients. Then in the manufacture and quality assurance, the pharmacist's broad knowledge of the pharmaceutical sciences ensures an integrated approach to quality assurance throughout the validation of the various stages of production and the testing of products before it is released. Then we can see the pharmacists in the hospitals. In hospitals, the pharmacists are frequently interacting with prescribers and doctors. They act as a bridge between the doctors and the patients. They are the one responsible for maintaining the medical records, influence the selection of drugs and dosage regimens, monitor patient complaints and therapeutic response to the drugs. They should be able to educate other health professionals about the rational use of drugs, then procurement and inventory management of the drugs. Then in the health management organization, the pharmacist can play a role in the administrative sessions of the health maintenance organization. Then in the drug regulation and control, in drug regulation and control, regulating the quality of medications, price of the medications, applying the ethics and law about medications and industries. Then in the formulation and quality control of the pharmaceutical products. The control of quality is a continuous process throughout the compounding of the product. Testing of the finished product can only confirm the quality built into the product during its preparation, and this can be done by the pharmacist. In the inspection and assessment of drug manufacturing facilities, to inspect the pharmaceutical industries, the environment, quality of medications, facilities, and assess the medications. In the assurance of product quality throughout the distribution chain, that is from the industry to the market and from the hospital to the market, the pharmacist will be assured to check the quality of the product. In drug procurement agencies, to supply the medication and find out the possible customer in home and abroad. Then in the clinical trials and post-marketing surveillance, the pharmacist has the knowledge of drug and healthcare profession required to facilitate collaboration between companies, health professionals, and governments in relation to clinical trials and surveillance. Then the community pharmacists, they work from their own pharmacies or out of local healthcare center and doctor surgeries. They will be helping the public assessing their condition and making decision about which medicines they should take. Involved in dispensing medicine and offering patient advice and gives practical help on keeping health. And these are the various roles a pharmacist do in a healthcare system. To conclude, a pharmacist is the legally qualified and professionally competent person to handle drugs and allied supplies required for the patients within and outside the hospital. All pharmacists working in different fields of the profession are directly or indirectly related to nation's health. They are responsible for ensuring that the right drug to right patient at right time in right dose through right route in a right way. I would thank everyone for your kind attention and wishing everyone a happy Pharmacist Day. Hello,
Thank
sir.
you. Yeah, thank you very much. Archana, thank you for the presentation. Now, the
Thank you,
next
sir.
next student that we have is Ashwarya. Aishwarya, I've unmuted you. Hello, Aishwarya. Are you able to hear us? Hello. I think there is some network problem with her. Let's move to the next student. We can get back to Aishwarya again. Ashna.
Yes, sir.
Okay. Are you able to hear us?
Yes, sir.
So I'm giving you the host right, and then you can present your presentation.
Okay.
Ashna, you are the host now.
Yes, sir. Is it visible?
Yes. Yes, your presentation is visible and you are audible also. You can start.
Okay. So, good afternoon, everyone. I'm Dr. Ashna. I'm a BDS graduate. And today, on the behalf of World Pharmacist Day, I'm sharing my views on the topic examining the role of new technology in pharmacy now and future. So let's start with the introduction. Pharmacy is related to drug discovery, its safe and effective use, production, harmful effects, mechanism of action. The major role in pharmacy is played by our pharmacists, who are working with their great knowledge and understanding, taking into consideration the health perspective of patients. Responsibilities of a pharmacist include quality of medicine, supply with rules and regulations, medicines prescribed are suitable or not for the particular disease, advising how to take medicines and their side effects. Pharmacy, a place where medicines are dispensed, a practice of preparing and preserving of medicines to keep records of all prescriptions dispensed and prescription medicines supplied. In past decades, all medical records were kept on paper and in manual filing systems. Diagnosis, lab reports, visit notes, and medication directions were all written and maintained using sheets of paper, bound together in a patient's medical record. In today's scenario, pharmacies can communicate globally and work more efficiently through internet. Pharmacists are utilizing information technology management systems for dispensing, labeling, and recommending medications. IT, that is information technology, can enable the storage of patient records, facilitate electronic prescribing, automate the handling of medicines, and monitoring their efficacy and safety. Earlier, the data lost could not be retrieved, but today it's not the case anymore. Electronic prescribing. Electronic prescribing systems automate prescribing supply, administration of medicines in hospitals where they have been shown to reduce medication error and have a major impact on patient safety. However, these systems may have inadequate decision support functions as opposed to a healthcare professional who can make decisions based on his or her clinical judgment as our pharmacist do. So here is the question, what about the future? The future of the pharmacy, the future of the pharmacist, the automated process that can fill prescriptions, providing drug information, creates a fear that technology may one day replace many of the hospital pharmacists and pharmacy technicians. This will lead to less number of jobs. But on the positive aspect, we can see that pharmacists can rely on technology to help them do the tasks that are complicated. The next big thing for the pharmaceutical industry is artificial intelligence and machine learning, which help to reshape its future. For example, rather than taking months to see the effect of a particular drug on thousands of people, it will take seconds to see the effect of drug on millions of simulations of the human body physiology from the past Simulation here is a mechanistic model is in the a mechanistic model in which a mathematical modeling tool that can enhance process understanding, reduce experimentation cost, and improve the product quality. So, be it past, present, or future, pharmacy is always going to hold its significance. Thank you. Happy Pharmacist Day to everyone. We need to make technology work for us. We should not have to work for technology. Thank you. Have a nice day.
Thank you, Ashna. Thank you very much for the presentation. Guys, next we have is Benison. Benison, I've unmuted you.
Yes, sir.
And I'm giving you the rights also. Just give me a second. Yes, you are the host now. Benison, you can share your screen.
Okay, sir. Hello, sir.
Yes, Benison, we are able to see your screen and we are able to hear you also. Please start the presentation. Thank you.
Okay, sir. So, good afternoon to everyone here. And so, first of all, I would like to wish everyone the happy Pharmacist Day. And today, I'm Benson Roy, and I'm a BSc Biotech graduate. So, I will be presenting about the roles of pharmacist in healthcare system. Pharmacist, also known as chemist or druggist, are healthcare professionals who specialize in the use of medicines as they deal with the composition, effects, mechanism of action, and proper and effective use of drugs. So the pharmacist is a person who is dealing with the composition and effects, mechanism of the action, as well as the drug usage, and also who is in direct contact with the patient while distributing the medicines. And they'll be also having the contact with doctors who will be prescribing the medicines with the for the patients. So when we come to the roles of a pharmacist, there are basically four roles, which include the quality of medicines distributed, then ensuring that the supply of medicines is within the law. Then third is the ensuring that the medicine prescribed to the patient are suitable. Then the fourth is advising patients about medicines, including how to take them, what reactions may occur, and answering patients' questions. So when we come to the first one, that is the quality of the medicine supplied to the patient. It is a responsibility of the pharmacist to maintain the quality of the product, which is it is safe and effective for when it comes to the structural selection as well as the procurement methods. The procurement method is the contract or the agreement between the dealer and the pharmacy or the person who is distributing the medicines to the pharmacy. So the quality and the standards of these dealers should be taken into consideration. Then we maintaining quality products to appropriate storage, distribution, monitoring, and prescribing methods. So the pharmacist is responsible for maintaining a suitable storage area when it comes to the medicines, which include temperature sensitive medicines. So it would be right to maintain a storage temperature monitoring like that and all, so that medicine is kept within the quality standards. Then he is also responsible for selecting on the safety and efficacy of the medicine, and also while distributing to the patients, he should also take the dosage of the medicines into consideration. And when it then he's responsible to check the supplies, quality standards, and also the medicines which have been transported to the pharmacy, like the packings and all are should be taken consideration by the pharmacist. Also, that the repacking activity and dispensing activities are to be maintained. Like when medicine is being distributed to the patient, we should make sure that the medicine is well packed, and also the stock medicine which is present in the pharmacy is also well maintained by repacking or keeping it in a closed containers like that. Then when we come to the second responsibility is the law, ensuring that the supply of medicines is within the law. When we take this law responsibility from the pharmacist side, the pharmacist is responsible for dispensing the all pharmacies and doctors dispensaries should be contingency arranged in the place to so supply where stock is unobtainable for wholesalers. Then these arrangements should be documented and made available to all relevant staff, including locums. Locums are persons who will be present in pharmacy, res- uh, presenting the pharmacist, like or for a temporary time or like that. Then the third one is having reciprocal arrangements with neighboring pharmacies when required to meet urgent patient needs, and the use of manufacturers contingency order arrangements. Then pharmacies and doctors dispensary should have easy access to a current contact list of manufacturers, and other should designate a member of the pharmacy and or dispensary team as lead of on procurement. Then fifth one is additional new patient stock should be kept for a reasonable level. Like the pharmacist is responsible for maintaining the stocks of medicines in a pharmacy. Then the last one is where responsibility the responsibility is where appropriate pharmacies and doctors dispensary should discuss the problems of stock available directly with the local uh, practices. Then when we come to the responsibility, that is ensuring that the medicines prescribed to patients are suitable. The pharmacist is responsible for receiving and validating the prescription, and he should understand and interpret the prescription and also prepare and label items for use. And a final checking of the prescription as well as the selected medicine should be done before providing it to the patient. Then record the action taken so that the stock maintenance and all are recorded. Then issue the medicine to the patient with clear instructions and advice so that the patient can take the medicine appropriately. Then when we come to the last responsibility, that is the advising patients with medicines, including how to take them, what reactions may occur, and answering patients questions. When we come to this responsibility, here the communication between the patient as well as the pharmacist is mainly active. That is active listening. That pharmacist should be an active listener so that all the details which the patient is having can be cleared with him, and also he can record these details in such a way that the development of the drug or the information can be passed on to other personals, including doctors or the medical representatives. Then when we he should empathy should be taken into consideration. Like he should be thinking by being in the side of the patient. Like he should think from the side of patient such a way that he can clear all the doubts and all the problems related to that medicine or the disease is cleared. Then building rapport, like the tone should be maintained while distributing the medicines. Then open and closed end question, like open end questions is referred as the questions for which yes or no answer should be given when the pharmacist is asking any question to the patient. And closed end, opponent questions are like detailed explanation, explained answers are given, while closed end are questions for which yes or no are given. Then when we come to the leading questions, these are questions like, for example, when a pharmacist is asking, ph- when a pharmacist is asking the patient like, do you miss your medications and all, he will be responding like no. But the main intention of that question is like, he should make sure that the patient should make sure that he is taking all the medicines. Then the why questions are provided with, where when the pharmacist is asking any questions starting with why, um, defense answering will be done by the patient, that ensures that the patient is forced to listen to that question and do appropriate requirements. Then non-verbal communication, which is the expressions, tones, language like that it's given. These are the responsibilities of the pharmacist. Then where do pharmacists work? They work in community pharmacies, sometimes called retail or high street pharmacy and hospitals. Most pharmacists work in community and hospital pharmacy. Then pharmaceutical productions or sales in pharmaceutical industry, they also work there. Then pharmacists are present in prisons, primary health care organizations, universities in teaching and research, the military, veterinary pharmacy, and other pharmacy organizations. Then for a pharmacist to be legally called, like a person calling themselves a pharmacist must be registered with the PCI. PCI is known as Pharmacy Council of India, and he should be registered in that so that he can open a pharmacy or be a part of the pharmacy calling themselves pharmacists. Then for becoming a pharmacist, the person should be at least have a diploma in pharmacy, which is a 2-year duration course with a minimum requirement of 10+2 with science stream in India. So these are the responsibilities and roles of the pharmacist. And thank you everyone. And once again, I'm wishing you all happy Pharmacist Day. Thank you. Thank you, sir.
Thank you, Benison. Thank you very much for the presentation. As next we have Fire. Fire Bus. I'm unmuting you.
Hello, sir.
Yes, Fire, you are audible. I'm giving you the host right, then you can present your presentation. You are the host now, Fire. You can present.
Hello, sir. Are you able to? Hello, sir. Are you able to see my
No, Fire,
screen?
we are not able to. We are not able to see your screen, Fire.
Okay, sir.
Yes, now it is. Now we are able to see,
Okay, sir.
and also we are able to hear you. So you can start your presentation. Thank you.
Okay, sir. So, hello, everyone. Good afternoon to all. I am Faiha, and I am a BSc graduate. So today, on behalf of the World Pharmacist Day on September 25th, as mainly the purpose of the World Pharmacist Day is to encourage activities and promote and advocate for all the role of pharmacists in improving health in every corner of the world. So here is the objective and contents which is in the presentation. So my presentation is role of pharmacist in healthcare system. So objectives are who is pharmacist, role of pharmacist, pharmacist in healthcare system, pharmacists effectively contribute to health, public health, pharmacist services in disaster management. So first is who is pharmacist. Pharmacists are also known as chemists or druggists, are healthcare professionals who practice in pharmacy, the field of health science, focusing upon the safe and effective medication use. Apart from that, they also deal with all the fields related to medicine, from the cultivation of the medicinal plants, their extraction, synthesis, clinical and non-clinical experiments, dispensing of the drug, monitoring and pharmacovigilance. So here is the chart shows various roles of pharmacists in various sectors of healthcare system, like healthcare system, clinical survey, industrial pharmacist, drug inspector and government analyst, academic pharmacist, community pharmacist, medical representative, and research and development, that is wholesaler and retailers like druggist and chemist, and also the health hospital pharmacist. So in this, the role of pharmacist I have given in the bulletin points like clinical pharmacy, hospital pharmacy, community pharmacy, industrial pharmacy, academic pharmacy, herbal pharmacy, research and development, and many more. So the role of pharmacist, like I have given this in brief, like first is the community pharmacy. They mainly bridge between physician, nurse, other health professionals and public, responsibility of dispensing and distributing medicine in supermarkets, pharmacy shops, healthcare centers, and also checking dosage and ensuring that medicines are correctly and safely supplied and labeled. Second is the hospital pharmacy. They are mainly maintains records, influence the selection of the drug and dosage regimens, monitor patient compliance and therapeutic response of the drug, and also planning and implementation of clinical trials. Third is the herbal pharmacy. They are the identification of herbal product for the particular disease, even from the cultivation, harvesting, extraction, and purification of active ingredients, and formulation in dosage form. The fourth is the role in pharmacist as academic pharmacy. Both research and academic go hand in hand. Skilled pharmacists to fulfill the future demand of the market, as well as manpower produced from good institutions and good researchers give proper education and ethical knowledge in the pharmaceutical practices. And next is the regulatory pharmacy, which includes the health and drug policy, management, their administration, educational policy, regulatory and enforcement agencies. Next is the industrial pharmacy, formulation and manufacture development, their quality control and quality assurance, drug information, patient application, drug registration, sales and marketing. All these include in the industrial pharmacy. So next is the research, development and others in the pharmacy, like research like chemistry, pharmacology, toxicology, microbiologist and biopharmacist, and also in research like non-clinical and clinical research. And the development is like new drug application, generic medicine and patient compliance. Other pharmacy include like veterinary pharmacist, intellectual. These are the other roles which is by the pharmacist, like intellectual property rights, nuclear pharmacist, pharmacy marketing, pharmacist, clinical toxicologist. So these are the research, development and other factors which in the conducted by the pharmacist. So pharmacists can effectively contribute in public health too, like they can give counseling to the patients, by conducting national health programs, medicinal management, and also promoting or health promotion, giving community awareness, screening services, professional dispensing of the drug, and de-addiction services. So these are the effective contribution by the public health. And also the pharmacy services in disaster management, mainly mobile pharmacy and temporary pharmacy related services. So educate community by the health, sanitization, and hygiene by both the public and personal hygiene and nutrition, infectious disease and well-being, and also review of medicine supply. As the pharmacists are more access, they are having more access to medical records, so they are in the position to influence the selection of medicines, medicine regimen, dosage regimens, to monitor patients' compliance and therapeutics, and also recognize and report adverse drug reactions in pharmacovigilance. So these all are the services in disaster management by the pharmacovigilance, by the pharmacist. So pharmacists have more opportunity to interact closely with the prescriber and patient. Therefore, they can also promote the rational prescribing and do, also use of dosage. So from here, it comes to a conclusion. So I'm concluding that pharmacist is the first person of healthcare system by playing various roles like academic, industrial, community, clinical pharmacist, hospital, veterinary, etc. So all pharmacists working in different fields of the profession are directly or indirectly related to nation's health. So finally, pharmacists are responsible for ensuring that right drug to right patient at right time in right dose through right route in right way is given, so that the pharmacist is an integral part of the healthcare system. So thank you everyone. So here come to
Thank you,
an
Faiha.
end.
Thank you very much.
Thank you, sir.
Thank you very much, Faiha. Now,
Thank
the
you,
next
sir.
student for today is Famina.
Yes, sir. Hello,
Okay.
sir.
Hello. Yes, Famina, we are able to hear you.
Okay, sir.
Famina, I have given you the host rights. Please share your presentation.
Yes, sir. Hello, sir. Is it visible?
Yes, Famina, your screen is visible and you are also audible. Please start your presentation.
Hello. Good afternoon, everyone. I am Dr. Famina Ansar, and the topic of the day is role of new technology in pharmacy practices now and future. Now, the first question is why we need technology in pharmacy practice. According to the National Health and Nutrition Examination Survey, we have a graph here which shows the percentage of prescription drugs in patients over a month in US. And the graph suggests that 40% of the population of age group 60 and over were prescribed with 5 or more drugs, and in the age group of 0 to 11 years, 15% of the population were prescribed with at least one drug. This suggests that there are a huge number of prescriptions, and because of which there are a large number of chances of error. So, there is a need of technology in all the spheres of practice of pharmacy, that is, be it dispensing the drugs, be it monitoring the drug interactions, or administration of vaccines, or be it counseling the patients, or in case of research and development. In all the spheres of practice of pharmacy, there is a need of technology which is to be integrated with the healthcare system as a whole. So, the major goals of incorporating technology into the practice of pharmacy would be: it provides a pharmacist with more time to apply the pharmaceutical care and also patient counseling. It would rather improve the quality of life of the pharmacist as well as the technicians. It decreases the errors, the medication errors, all forms of errors, be it the prescribing, dispensing, or administration errors, and it also increases the number of prescriptions filled in a day. Now we have understood why we need technology. Now the second question would be, does community pharmacy currently have a system which makes meaningful and secure exchange of health information that allows all the healthcare practitioners in the region in good communication? Yes, we have an evolving pharmacy hit collaborative, which is the Pharmacy Healthcare Informative Technology. And this collaboration would focus on the clinical aspect of what the pharmacist does. For example, if you consider the automated dispensing cabinets, here the pharmacist would have more time to counsel the patients rather than giving the prescriptions. This means there is exchange of health information, and it would be a part of the medication therapy management. Now let's see how the health information technology works. To begin with, we have the prescription. The prescription utilizes the CPOE and the CDSS technology, where CPOE is computerized physician order information, the clinic decision support software. And using these technologies, that is CPOE order is transferred to the pharmacy information system where it is verified, and then we have the dispensing which occurs at the automated dispensing cabinets. Now the functionalities of the automated dispensing cabinets are: there is a barcode screening, the medication labeling is done, there is a tracking facility, and also there is controlled dispensing of the medication and automatic documentation occurs. Now, with the use of this technology, we have lesser errors, the dispensing would be safe, and the health administration would be quick, and the location is also flexible because we use after this dispensing, infusion of the medication is done, and following which an electronic health record is maintained where you document and at times review. Now we'll see each of these technologies It was in 2015, FDA approved the first drug product which was combined with a digital sensor. And here we have a Japanese pharmaceutical company together with Proteus Digital Health. They combined a digital sensor with a type of drug and it was used against mental illness. So, actually, what happens is the pill is taken together with a sensor, and that sensor would track the digestion and absorption of the drug after the drug is swallowed. And this ingestible sensor would then communicate with a wearable sensor, and from here, all the information would be transmitted to a smartphone or a tablet, either of the patient or the caretaker. And this is of immense importance in patients like schizophrenia patients in measuring the drug adherence. Next would be the use of technology where the testing is done on virtual organisms. Imagine a situation where the characteristics of the living organisms are very well simulated so that we can conduct the clinical trials in very less time with less money and also amazing results. Such trials are called silico trials. It is an individualized computer simulation which is used in the development or regulatory evaluation of a medicinal product or a device or an intervention. And with the understanding of our biology and also with our current technology, it is impossible to simulate the clinical trials as such. So, we can use this technology in the in vivo clinical trials. And we have evolved such a technology which is called as Hue mode. It simulates the human physiology works. It is a top down model of human physiology from whole organs to the individual molecule, and it features more than 1500 equations and 6500 variables such as body fluids, circulation, electrolytes, hormones, metabolism, and skin temperature. Next technology would be augmented reality. Now, with the help of augmented reality, the patient can see how the drug works in the body in 3 dimensions rather than reading the long descriptions on the bottle you get. They can actually see how the drug works in the body. A counterpart of augmented reality is medical visual reality, and it has found a successful application in the field of stress release as well as in the field of pain reduction. And this has been supported by the studies at Cedar Sinai Medical Center, where there was a significant drop in pain scores in the case of VR therapies. So the future would be of VR pharmacies where there will be specialists, they would be prescribing appropriate VR treatment to the patients. And now we have a new branch which is called as precision medicine, making use of pharmacogenomics. Here, according to the National Institute of Health, precision medicine means it would be an emerging approach to treat as well as to prevent diseases, and it is based on the variability in the genes, the variability in the environment, and also the lifestyle of each person. So, in fact, the traditional prescription of medicine was a standard dose of medicine would be made, and this were given to the subjects, and this would work for some patients. For some patients, it would create some side effects, and for the rest of the patients, it may not work. Now, with this precision medicine, what happens is a drug response testing is done, and this tells the doctor like which medicine would respond, like how you will respond to that medicine, and based on that, the standard dose, the lower dose, and higher doses are made, and the medicine that suits the subject is delivered. Here we have pharmacogenomics in clinical trials as well, where you integrate the pharmacogenomics into the clinical trial workflows. And at phase 1, we have the laboratory analysis of genotype. At phase 2, you create a composite phenotype. And at phase 3, there is an integration with the psychiatric pharmacology. And at phase 4, there is an interpretive report classification. And according to the classification, we have three categories where the green would say you have to use as it is directed. The yellow would say that you have to use it but with caution. And the red means that you have to use it with caution, but it would be more frequently or it requires more frequent monitoring. Next is the 3D printing drugs. Now, it was in 2015 August, FDA has approved an epilepsy drug which is called Spritam, and it was made using 3D printers. And because it is made using 3D printers, the powdered drug layer by layer, and it helps to dissolve the pills faster than the average pills. Then the scientists from a university in London are experimenting the 3D printing technology so as to create odd shapes which can be used to create shapes which would be easier for kids to take the medicine. And also a UK based company believes that it would be able to commercialize printed tablets in the next 5 to 10 years. And now comes the artificial intelligence. Artificial intelligence can be deployed in various fields, be it mining the medical records, drug discovery, clinical trial research, radiology, radiotherapy, disease identification, cybersecurity, designing the treatment plan, speeding the medical imaging. And in fact, we have an example that is in 2015, Atomwise has launched a virtual, and it was for a safe existing medicine that can be redesigned to treat the Ebola virus. And the artificial intelligence technology company found that two drugs can have a significant role in reducing the Ebola infectivity. And based on this analysis, further steps were taken. And without artificial intelligence, this step would have taken years or months, but it was completed in less than a day. So it is now the time to embrace what is crystal clear. That is, we have to incorporate technology into our pharmacy practices. The digital healthcare is changing care, the practice of medicine, and how the pharma innovations reach the patients. So thank you everyone, and also thanks to technology, and wish you a very happy Pharmacist Day, and let's all be a part of transforming the global health. Thank you.
Thank you very much, Famina. Thank you.
Thank you, sir.
Now you can unshare your screen, and our next candidate is Gauri Kamble. I've unmuted you, Gauri.
Hello, sir.
Hello, yeah.
Sir,
We are
am I
able to hear
audible?
you. Yes, you are.
Yes.
So just give me a second. I'm giving you the presenter right, and then you can
Yes, sir.
present. Gauri, you are the host now.
Yes,
you
sir.
can present.
Sir, is it visible?
Yes, your slide is visible, and also you are audible. You can start your presentation. Thank you.
Good afternoon, everyone. I wish you all a very happy Pharmacist Day. And my topic on the presentation is on role of pharmacist in healthcare system. First of all, I would like to explain who is a pharmacist. A pharmacist is also known as a chemist or druggist. These are the healthcare professionals who practice in the pharmacy. Pharmacy is the field of healthcare science that deals with developing of medicine, synthesis of drug, identification of the drug, selection, formulation of the drug, preservation techniques, and knowing the effects of the medicines which are being developed on the human body. So it basically focuses on the safety and effective use, medication use. Pharmacists are the one who deals with all fields related to medicine. He is the primary link between the physician and the patient. Then what does a pharmacist do? These are the 6 ways in which pharmacists play an important role in our community. First is prepare or supervise the dispensing of medicines. right from the pharmaceutical manufacturing to research, development, then distribution, and then the sale. Everything is attributed to the pharmacy, to the knowledge of the pharmacy. So by using this knowledge, he advised the patients on how medicine should be taken, what are the side effects, how should be the medicine should be taken, which medicines should not be taken. These all aspects are explained by the pharmacist. Then he can advise on government controls and regulations. He is trained to advise on regulations concerning the manufacture and supply of medicines. He is also involved in public healthcare education. Wherever there are public healthcare sessions and workshops, the pharmacist is the one who is firstly invited to call upon to educate the public on health matters. He is involved in patient education. He is also known as a counselor to the patients on how to use the prescribed drugs, when to do, and things to avoid when taking the drugs. Then pharmaceutical stores, it makes healthcare professions quite sustainable when reputable drug stores operated by certified pharmacists are located near us. So these are the things in which pharmacies plays an important role in our community. Then what is healthcare system? In an organization of hospitals, it involves various professionals like physicians, nurses, lab technicians, dietitians, pharmacists, and medical social workers. All these people who are involved in these professions, these are actually working for attaining, maintaining, and promoting health of the people. Totally, overall, these professionals are known as healthcare systems. As today we know, now in the current situation of COVID-19, all these professions play a very important role, and we can understand how they are important for the society and the community. These professionals are responsible for the overall health of the nation. Then role of pharmacist in healthcare system. The role of pharmacist has evolved from the provider of medicines to that of the provider of care. Then these are some of the sectors in which pharmacists play an important role. The first, we have academic pharmacist, then industrial pharmacist, community pharmacist, and hospital pharmacist. Let us see everything in detail. First are the academic pharmacists. Basically, these pharmacists are the lecturers or professors in the colleges. These are the pharmacists which mentors tomorrow's pharmacists. These pharmacists play a valuable role in healthcare systems. From their basic education, training, and programs, the students acquire broad knowledge in the understanding of pharmaceutical science and their development with the career in medicine and pharmacy. The pharmacists get a specialized knowledge regarding to all the drugs and all the practical knowledge in the field of pharmacy. So we can say that academic pharmacist is the preliminary part in the pharmacy profession. Then industrial pharmacist. That is our pharmaceutical industry. Pharmacists play a very important role in industries, that is in research and development. There, we all know that every company involved in research and development activities, because as we know, there are new diseases coming up, so there is a need to develop new medicines, and also pharmacists play a very important role to research, and their expertise in formulation of development of a drug, and also they are relevant to the biological availability of active ingredients. They have deep knowledge in research and development. Then second is in manufacturing quality assurance. Whenever there is a manufacturing of drug, pharmacists play a very important role that the drug is being manufactured according to the good clinical practices, and also the quality assurance is done, that the various tests are being carried out to ensure that the drug is safe and effective before the drug is released in the market. Then drug information. The pharmacist has a very deep knowledge and expertise to provide detailed information on medicines to the members of healthcare professionals and the public. Then in the clinical trials and post-marketing surveillance, the pharmacists play a very important role in clinical research field, that we all know that whenever there is a introduction of a new drug in the market, first it has to be gone to the stages of clinical trials, and through which we can actually say that the drug is safe and effective in the human use. So pharmacists also play the important role in the clinical research field and also in the post-marketing surveillance. Then we have sales and marketing. Here also pharmacists contribute many roles involved in the sales and marketing process. Then we have community pharmacists. Community pharmacists, which we all know, these are the drug shops or the chemist shops. These pharmacists work at the front line of healthcare in cities, towns, and villages. They are mostly accessible to public. They supply medicine according to the prescription. In addition that they are they are supplying the medicines according to the prescription. They are also ensuring the activities that counseling of patient is done. They are assessing their conditions and making decision about which medicines should be taken and not. It is a very responsible job, and community pharmacists tend to be the highly respected members of their communities. They also maintain their link with healthcare professionals in primary healthcare. Then hospital pharmacists, as we know, many hospitals, let it be a government hospital, a private hospital, and multi-speciality hospitals, these hospitals offer the services of hospital pharmacists for the distribution of drug to people. So we can say that hospital pharmacists play a vital role in the healthcare team in order to supply medicines to the people inside the patient, inside the hospital and outside the patients, and also to the ambulatory patients. And concluding overall the role of pharmacists, as pharmacists deal with every issue regarding health of the society, and he builds superior health system, constantly endeavor his knowledge with ethics. Pharmacists are the one and only well qualified practitioners that provide the backbone that strengthens the healthcare of the nation, and they are responsible for ensuring that the patient receives the right drug during a right time at a right dose throughout the right way. So the pharmacists are considered to be an integral part of the healthcare system. Thank you all of you, and I would wish you all a very happy Pharmacist Day, and also thank all the staff which has been given opportunity to present myself in this competition. Thank you, sir.
Thank you very much. Now we have our next student, Dr. G.S. Sinduja. I have unmuted you, Dr. Sinduja. Hello, Dr. Sinduja, are you there?
Yes, sir.
Okay, we are able to hear you. Uh, Let me give you the host right. Dr. Sinduja, you are the host now.
Yes, sir.
Please share your screen. Your voice is a little bit feeble, not coming clearly. Could you speak a little bit louder?
Hello.
Yeah, now it is.
Yes, sir.
Okay. Now share your screen and then you can start the presentation.
Yes, are you able to see the screen, sir?
Yes, yes,
Yes.
Dr. Sinduja, we are able to see the screen and also you are audible. You can start the presentation.
Okay, good afternoon to everyone. I am Dr. Sinduja. I'm glad to be here with you today. And today, okay, my topic for today's presentation is role of pharmacists in the healthcare system. Before we begin, I would like to share some points regarding this. During the last few years, the pharmacy profession has been expanded significantly in terms of professional services and delivery. And now it has been recognized as an important profession in the multidisciplinary provision of the healthcare. The focus of the profession of pharmacy has shifted from the technical, product oriented functions to the patient oriented health outcomes and counseling information, and also the professional services. Before we get into the roles of the pharmacist in the healthcare system, let's see who is a pharmacist. Pharmacist is a person prepared to formulate, dispense, and provide clinical information on drugs or medications to the health professionals and patients. They are responsible to ensure the quality of the medicine supplied to their patients as per the government policy and regulation, and the patient pharmaceutical education, including the counseling of the patient. They are the experts in medicine and use their clinical expertise together with the formulation, quality control, practical knowledge to ensure the safe supply and use of the medicines by the public. They are responsible to ensure the quality of the pharmaceuticals and medicines supplied to the patient as per the government regulation. Apart from this, pharmacist is the one who deals with all the field related to the medicine. It starts from the cultivation of the medicinal plant, extraction, synthesis, clinical and non-clinical experiments, and dispensing and monitoring it. And when we look into the word pharmacist, the word pharmacist stands for the patience, honesty, alertness, research, motivator, administrator, courageous, intelligent, and studious. And when we see into the mission of the pharmacist, it is the right drug to the patient at the right time in a right dose through the right route in a right way. From ancient days, it is clear that medicine was prepared by the specialized person that today we refer as pharmacist. Till today, medicine save life of human beings. And when we see that food, cloth, and shelter are the basic need of the human being, but nowadays medicine also plays a major role in it. Medicine is the major basic need of the human being. Without medicine, there is no life. Actually, it acts as a sanjeevani for the human being. And such medicines are manufactured by only pharmacists. Now let's look into the role of the pharmacist. Um, the pharmacists, they act as the community pharmacy, clinical pharmacy, hospital pharmacy, industrial pharmacy, academic pharmacy, regulatory pharmacy, research and development, herbal pharmacy, and many more. When we talk into the community pharmacy, they are the front line of the healthcare. They act as a bridge between the general physician, nurse, and other healthcare professionals and public. They work from pharmacies and with the responsibility of dispensing and distributing the medicine in supermarket, pharmacy, and healthcare centers. They also involved in checking dosage and ensuring that the medicines are correctly and safely supplied and labeled. And they are also involved in counseling, advising the public on the treatment of minor ailments. They also do monitoring blood pressure and cholesterol level. And then about the clinical pharmacy. It is the branch of pharmacy in which the clinical pharmacists provide direct patient care that optimizes the use of medication and promotes health, wellness, and disease prevention. The clinical pharmacists care for the patient in all healthcare settings, but the clinical pharmacy movement initially began inside the hospitals and the clinic. And now we look into the hospital pharmacy. They work in larger hospital and institutional pharmacies, frequently interact with the prescribers and the doctors. They maintain all the medical record and influence the selection of drugs and dosage regimens, and also monitor patient complaints and the therapeutic responses to the drug. And they are here to recognize and report the adverse drug reactions. They serve as a member of policy making committees, including those concerned with the drug selection, the use of the antibiotics, and the hospital infections. They educate the other health professionals about the rational use of the drugs. Then next is the industrial pharmacy. They help in the formulation and development of the new drug. They also help in manufacture, quality control, and the quality assurance of the drug. They provide the drug information, patent applications, and the drug registrations. And when we look into the academic pharmacy, the research and academic go hand in hand. A well skilled manpower can be produced from a good institute and a good researcher, and thus producing the skilled pharmacists to fulfill the future demand of the market. Only a good academician give the proper education and ethical knowledge in the pharmaceutical practice. And the regulatory pharmacy. Uh, they involve in the health and drug policy, management, administration of the educational policy, the regulatory and enforcement agencies, and also the international agencies and the professional bodies. when we talk about the research and development, they all be managing the research in the chemistry, pharmacology, toxicology, and microbiology, micropharmacy, clinical and non-clinical researchers of the drug, the new drug application, generic medicine development, and also the patient compliance. The herbal pharmacy. The current trend is shifting towards the herbal medicine. The identification of the herbal product for the particular disease can be only done by the herbal pharmacist. They also involve in the cultivation, harvesting, extraction, and purification of the active ingredient from the herbs, medicinal herbs. And the role of the pharmacist will be also be included in the pharmacy marketing, drug information pharmacist, and the nuclear pharmacy, the clinical toxicology, veterinary pharmacy. The pharmacist can effectively contribute to the healthcare system by patient counseling, national health programs, medicine management, health promotion, community awareness, screening services, professional dispensing, and de-addiction services. The seven-step pharmacy. To be the effective healthcare team member, pharmacists need some skills and attitudes enabling them to assume many different functions. The concept of the seven-step pharmacist was introduced by the WHO in March 2004. Those skills are caregiver, decision maker, communicator, manager, lifelong learner, teacher, and leader. However, pharmacists act as a caregiver. The pharmacists provide caring services, whether these services are clinical, analytical, technological, or regulatory. The pharmacist must be comfortable interacting with the individuals and the population. The pharmacist must view his practice as an integrated and continuous with those of the healthcare system and other pharmacists. As a decision maker, the appropriate and efficacious and cost-effective use of the resources and the practices must be at the foundation of the pharmacist. Achieving this goal is highly dependent on the ability to evaluate and synthesis and also decide on the most appropriate course of the action. As a communicator, the pharmacist is in an ideal position between his patient and the physician. As such, the pharmacist must be knowledgeable and confident while interacting with the other health professional and the public. The communication involves the verbal, non-verbal, and listening and writing skills. Uh, when we see about the leader quality, the pharmacists find themselves in a multidisciplinary caring situation or in an area where the other healthcare providers are in short supply or non-existent. They are obligated to assume a leadership position in overall interest of the community. And it involves the compassion and empathy as well as the ability to make decisions and communicate and manage everything effectively. How a pharmacist acts as a manager? The pharmacist must effectively manage resources like the human, physical, and information. They must also be comfortable being managed by others, whether an employee or the leader of the healthcare team. More and more, the information and its related technology will provide challenges to the pharmacist as they assume the greater responsibility for sharing the information about the medicine and the other related products. Yeah, to be a good pharmacist, they must be a lifelong learner. It's no longer possible to learn everything in school in order to practice a career as a pharmacist. The concepts, principle, and the commitment to the lifelong learning must begin while attending the pharmacy school and must be supported throughout the pharmacist career. How a pharmacist acts as a teacher? The pharmacist has a responsibility to assist with the education and training of the future generations of the pharmacists. They should be involved in participating as a teacher, not only imparts knowledge to the others, it also offers an opportunity for the practitioner to gain new knowledge and to find the tune of the existing skills. The role of the pharmacist in a changing healthcare environment. Over the past 50 years, the role of the pharmacist has evolved along with the healthcare needs of our population. In addition to dispensing medications and ensuring the patient's safety, today's pharmacists are taking a larger role as the medical counselors, educators, and the advocates. And there are several reasons for this. Advances in the technology have greatly expanded the prevention and the treatment option for dozens of conditions and enabled the coordination and collaboration across the healthcare providers and the institutions. As technology has become more sophisticated and patients have become more involved in their own care than ever before, and thus setting clear expectation for transparent and patient-centered care and increased access to the healthcare information. The patients are focused on the reducing cost and improving the health outcome, which has fostered the emergence of the pharmacy management strategies. Improving the consumer care experience and driving better health outcomes. Pharmacist-led programs can help ease care transitions by reducing the occurrence of adverse drug events, addressing the medication adherence, and lowering hospital readmission rates through services such as the bedside prescription transaction, counseling prior to the discharge, and the phone consultation. And in fact, a study in 2016 has found that the medication reconciliation programs in which pharmacists review patients' medication regimens and provide adherence counseling during the patient's transition from the hospital to home has reduced the risk of hospital readmission by 50%, and it also helped avoid unnecessary healthcare costs. And according to a survey in 2014, over 60% of the pharmacists provided medication therapy management, and 53% has performed the immunization. Where in the case 10 years earlier, only 13% of the pharmacists provided medication management and just 15% administered the vaccination. The medication management conducted by the pharmacist has also been shown to improve medication adherence, the clinical outcome for the patient with the chronic conditions such as the diabetes, hypertension, and also the cardiovascular diseases. This increase in adherence can have far-reaching effects on both personal and financial health. And finally, pharmacists play an important role in managing and improving the population health, particularly in areas such as the tobacco cessation and the diabetic management through counseling, monitoring, and the support. The pharmacists are the integral part of the healthcare system and are among the most trusted and accessible healthcare professionals. This accessibility allows them to perform essential care activities, including the counseling, medication management, and preventive care screenings. Thanks to their accessibility and the regular interaction with the patients, pharmacists are also in a unique position to identify potential drug interactions early on and to educate the patients on the proper use of the medication. These effects have had a significant impact on the patient satisfaction and the quality of care, and also it can help contain the healthcare cost. The recent evidence also suggests that the addition of a pharmacist in a
Dr. Sinduja, Dr. Sinduja, sorry to interrupt, but
yes, sir.
you are overshooting the time, so please close as soon as possible. Thank you.
Yes, sir. Yes, sir. Um, the recent evidence also suggests that the addition of pharmacists in a collaborative team-based setting can improve the performance against the quality indicators and the national health goals. In our ever-changing healthcare environment, pharmacists' roles will continue to evolve. All the pharmacists working in different fields of the profession are directly or indirectly related to the nation's health. Finally, pharmacists are responsible for ensuring that the right drug to the right patient at the right time in the right dose to the right route in the right way. So that pharmacist is an integral part of the healthcare system. Okay, as we have come to the end of the presentation, uh, let me give you some interesting fun fact about the pharmacist. As we all know, Coca-Cola was originally a cough syrup and invented by a pharmacist named John Pemberton. And on this day, on World's Pharmacist Day, I congratulate and I give a sincere thanks to all the pharmacists in the world for your daily great work, and especially in these times of pandemic. Thank you so much for your interest and attention. Thank you.
Thank you, Dr. Sinduja, for the presentation. Uh, so next we have Dr. Sharwani. Dr. Sharwani, I'm unmuting you. Hello, doctor. I think there's some network problem with her. Now we will get back to her. Next, let's move to the next student, Dr. Rudhya Patel.
Yeah. Hello. Uh, Good
Yes,
afternoon.
yes,
Yeah.
we are able to hear you.
Yeah, I'm sharing the screen.
Let me give you the rights first.
Okay.
Yes, you are the host now, Dr. Patel. You can share the screen.
Okay, sir. Yeah. Um, um, Good afternoon, everyone. My name is Dr. Udaya Patil, and I opted post-graduation diploma in clinical research and pharmacovigilance and data management weekend batch. And I would like to wish you all a happy World Pharmacist Day. As being physician at my clinical practice level, what I used to think is that pharmacist is that person that only dispenses the medicine according to the prescription and does this labeling and keeping records about the medicine, that is hospital pharmacist. But after selecting this topic, I was able to know what actually the pharmacist is. And now I would like to share with you all in my presentation my view and perspective regarding pharmacists and a role of pharmacist in the healthcare system. Let me be specific to this topic. Okay, the quick intro. Pharmacist is the healthcare professional licensed to engage in pharmacy with duties including dispensing prescription drugs, monitoring drug interaction, administering vaccines, and counseling patients on effects and proper usage of dietary supplements. Over the past 50 years, the role of pharmacists have evolved along with the healthcare need of our population. Then following reasons why pharmacists in the healthcare system is required. The greatly expanded advance in technology had enabled the collaboration across healthcare providers and institutions. Due to the increase in sophistication in the technology, complexity in the healthcare system have been increased that lead to the more concern in patients of taking their own care, thus setting clear expectation for transparent patient-centered care and increased access to healthcare information. Then both patients and payer are focused on cost effectivity that lead to foster the emergence of pharmacy management strategy. Then next is what is the contribution to the healthcare system by the pharmacist? Pharmacist serves patients by preparing medication, by reviewing and interpreting physician's order and detecting therapeutics incompatibilities. He or she provides pharmacological information to multidisciplinary healthcare team and monitoring patients' drug therapies. Then dispenses medicines by compounding, packaging, and labeling pharmaceuticals. Then also controls medication by monitoring drug therapies by advising intervention. Then provides pharmacological information by answering questions on the request of healthcare professionals. Then counseling patients on drug therapies. Then develops hospital staff in pharmacological knowledge by participating in clinical programs and training pharmacy staff, students, interns, and healthcare professionals. It complies with the state and federal drug law as regulated by the State Board of Pharmacy, the Drug Enforcement Administration, and the Food and Drug Administration by monitoring nursing unit inspection. Then he also maintains record for controlled substances and remove outdated and damaged medical products from the pharmacy. And it protects patients and technicians by adhering to the infection control protocol. I will give you the brief regarding the infection control protocol. This protocol was established for the infection control and prevention measures that have become more important than ever as facilities works towards it, providing a safe and healthy care environment for patient and staff. This protocol have been developed by CDC, Central of Disease Control and Prevention. You can see now active role as a Arogya Doot in India in this COVID situation. Then last but not the least, pharmacists maintain safe and clean working environment by complying with the procedures, rules, and regulation, and contributes to the team by accomplishing related results as needed. That in short, the pharmacists are the integral part of the healthcare system and are amongst most trusted and accessible healthcare professional. This accessibility allows them to perform more patient care activities, including counseling, medication management, and preventive care screening. Pharmacists are also unique position to identify potential drug interaction and also any adverse effect causing in the patient due to their accessibility and continuous interaction with them. They ensures the proper usage of medication in the patients, thus providing patient satisfaction and quality of care. Thank you.
Thank you, Dr. Patel. Thank you very much for the presentation. So guys, before we start our next candidate for the presentation, I would like to again reiterate the importance of sticking to the time limit for the presentation. Max, you can go to 10 minutes. I request to close it before 10, but request you all to do not exceed the time limit 10 minutes. Okay. And we are going well, guys. Everybody is presenting really well. Thank you all for your inputs and your presentations. So next we have Dr. Sharwani. I think she is here now. She has resolved the network problem. Dr. Sharwani, I have unmuted you.
Yes, sir. Thank you. Thank you so much.
Okay. Let me give you the rights for the presentation.
Yes, sure.
Yeah, doctor, you are the host now. You can present the screen and then start the presentation.
Yeah. Share screen, right?
Yes.
Okay, sir. Can you see my screen?
Not now.
Now?
No.
I've started.
Sorry, we are not able to see your screen, doctor.
Now, sir? Now?
Yes, it is coming. Yeah. Now we are able to see your screen. You can open the presentation.
Yeah. Now, sir, can you see
Doctor Shirley, you can open. Yeah, you can open the presentation now.
Yeah. Now, sir? Now you can see, right?
Yes, we are able to see your screen. Okay.
Yeah.
You
Good afternoon, everyone. Good afternoon, everyone. I am Dr. Lakshimi Sharwani. I am an orthodontist by profession. I am pursuing advanced diploma in clinical and medical writing and scientific writing from Cliniminds. I am presenting today in view of a doctor because I am not sure how much I can tell about pharmacists, because they are a profession that is undefined everywhere, and they have doing so much other than definition. So pharmacists are most important for professions in multidisciplinary field of healthcare, and pharmacists strengthen healthcare system with different roles, like in industry, in academia, in community health, clinical research, drug design and discovery, and developing novel drug delivery systems. And pharmacists are well qualified in understanding the rationale of prescriptions. Role of pharmacists in India and Western countries varies. However, role of pharmacists and physicians are well defined in Western countries. Typically, medicines are prescribed by physicians and dispensed by pharmacists. However, in India, pharmacists' role is not clearly defined, as majority of their tasks are handled by physicians themselves. As a result, Indian pharmacists majorly focus on commercial aspect of purchase or a distribution of the medicines. Their thorough knowledge about medicines is underutilized in India. And for the ease of access, India has pharmacies spread throughout every nook and corner of the country. In rural areas, there are a lot of challenges with healthcare, like poor and unreliable public sector, lack of private doctors, lack of basic knowledge about medicines. In such situations, pharmacists are first point of contact, like create a window of connectivity in medicine supply, link between community and health. And first line of defense in rural India is pharmacists, basically because ensure safe usage of medicines and optimize usage of limited resources, logistic procurement, storage, and distribution of medicines. Provide information on medicines and respond to symptoms. Redirect to appropriate healthcare providers. Social responsibility of pharmacists, carrying out seminars and consumer awareness programs, and distributing pamphlets, information leaflets, etc. Patient information and counseling, preliminary diagnostic checks like BP and weight, etc. Because in rural population, there are not much physicians available, so people depend on pharmacists. And public welfare programs like the National Family Welfare, alcohol de-addiction, tobacco de-addiction, etc. So in summary, I would like to say that pharmacists are important professionals in multidisciplinary field of healthcare, and they are well qualified in understanding the rationale of prescriptions and are spread throughout every nook and corner, and they are the first point of contact in rural India, and they are key players in implementation of public welfare programs. Thank you.
Thank you, doctor. Thank you very much. Thank you very much for the presentation. Thank you. So the next we have is Gopika Pratap. Gopika, I have unmuted you. Gopika, hello. She's not responding. We will get back to her after that. Next, Janvi, I have unmuted you. Are you there on the call? Janvi?
Hello, sir.
Yes, we are able to hear you, Janvi.
Yes, sir.
Just give me one second. I will give you the presenter, right?
Okay.
Yes, Janvi, you are the host now.
Okay, sir.
You can share the screen.
Yes. So 1 minute. Sir, is it visible, sir?
Not yet. Not yet visible, Janvi.
No, sir.
No.
Oh. No, sir.
No, no, Janvi.
Oh.
Yes, now it is coming.
Okay.
Now we are able to hear. We are able to see your screen. You
Okay.
can go to
Okay.
the presentation. Open the presentation.
Okay. Is it visible?
Yeah. Yes, visible. You can start the presentation. Thank you.
Okay. Good afternoon, everyone. My name is Jahnavi. Now I plan to speak out role of pharmacists in healthcare system. Firstly, I'm starting with introduction. A pharmacist is a person who is professionally qualified to prepare and dispense medicines or medical drugs. And next one, healthcare system. Healthcare system means it is the organization of people, institutions, and resources that deliver healthcare services to meet the health needs to target populations. And majority of citizens have limited access to high quality healthcare and have poor health indicators. Density of healthcare workers in the country is a little over 8 per 10,000 population, which is very low in comparison to developed countries. Moving to next one. Totally in India, there are around 10 lakh pharmacists working in various positions, applying their unique knowledge and skills, contributing to the health of the nation. Next, what are the pharmacy professions in healthcare system? Pharmacy profession is divided in research and development, industrial pharmacist, wholesalers and retailers, medical representative, community pharmacist, drug inspector and government analyst, hospital pharmacist, clinical pharmacist, and academic pharmacist. And next, we are heading to different roles of pharmacist in healthcare system. In this first one, all the pharmacists working in different fields of profession are directly or indirectly related to nation's health. Community pharmacists and hospital pharmacists are health professionals for the safe and effective use of drugs. And next, pharmacy occupies an important position in the healthcare system. So, the pharmacist should be well equipped with knowledge of drugs, their handling system, and legal aspects, as well as principles of quality assurance applied to medicine product. Fourth one, with the developing trend in science and technology, as well as in the potent and synthetic drugs, pharmacists' responsibilities increase to give information to the physician and the patients regarding the use, side effects, etc. Such drugs in the interest of public health, and they provide link between physician and patient. They are able to advise patients with minor illness. And next, pharmacists are involved in scientific procurement and distribution of medicines. Pharmacists help in achieving the goal of rational use of medicines. If you take some as examples, this particular one is among them. Pharmacists can effectively contribute to public health by services in disaster management, like mobile pharmacy and temporary pharmacy related services, and distribution of medicines and related medical care, and provide first aid treatment in cuts, burns, hypothermia, rashes, fractures, etc. And review of medicine supply and dosage used in specific situation like diabetes, cardiac problem, pediatric population, etc. And next, contribute to public health by service is the role of pharmacists in revised national TB control program. Like in this rational use of anti-TB medicines, early identification of TB suspects, avoiding diagnostic delays, and patient counseling and education and community awareness like that. And next one, pharmacies are located in very nook and corner of the country. In this, public sector involvement is poor and unreliable private sector facilities are beyond reach. And in rural areas, there are common issues of availability of medicines, doctor, prevention of ill health, promotion of good health and environment. These are the points are involved in public health by services and disaster, public health by services. And in such situations, pharmacists can act as first port of call and create window of connectivity in medicinal supply, advice on its proper use, and become a link between community and health. Finally, in conclusion, I would like to say that The pharmacist is responsible for ensuring that the right patient is receiving the right medicine in the right dose for the right condition in the right dosage form and at right frequency, and hence he is considered as an integral part of healthcare system. Thank you.
Thank you very much, Janvi. Thank you for the
Sir, thank
presentation.
you. Thank you.
Now you can unshare your screen.
Okay,
Next we have is Jerish. Jerish, you are unmuted.
Yes, sir. Yes, sir. 2 minutes.
Yeah, Jerish, I'm giving you the host right.
Yeah.
Janvi, please be on mute.
So is my slide visible?
Yes,
It's visible. Okay.
you can start.
All right. So good afternoon, everybody. So today I'll be talking to you about the examining role of new technology in pharmacy practice now and future. I'm Jerish Varghese and I'm doing an advanced PG diploma here for DRA, CR and PV. And I'm a clinical pharmacist trainee at the Bangalore Baptist Hospital. And as I'm into pharmacy practice, I can probably give you a more idea based on applications which I do on day-to-day basis. So out of all that, today I would like to talk about something really relevant, and it's probably catching up in the future. And so it's something called as precision medicine. All right. So what is precision medicine? How you can incorporate precision medicine and artificial intelligence? This is what we are going to look today in this session. Okay, so we know what is the conventional therapy, right? So there are a lot of factors which our therapy is being disturbed by. So we have a lot of factors such as biological factors, which is on your right. You can see the diagram over here. So here you have the biological factors where you have the age, gender, genetics, diseases affecting the drug therapy. Then you have cultural factors like the attitudes, beliefs, family influences, which affect the drug therapy. As in, cultural factors are self-explanatory, and biological factors, maybe in short, I can tell you probably about age. So the factors that affect drug distribution includes this gastric pH, or the gastric emptying time, intestinal motility, and blood flow. So what happens is, as you age, the amount of all the functioning of all these processes reduces. So when this reduces, obviously you have a chance of decreased or subtherapeutic drug action. Then you have the gender. All right. So in gender, when you see, as per the literature, you have, females have a gastric emptying time, which is increased, yeah, than the men. So, and we have a lot of so-called genetic indifferences between the receptor bindings, which is happening cellularly in male and female. So as such, we have a lot of things. So today we'll be discussing more about the genetics parts, that is called the pharmacogenetics. All right. So pharmacogenetics or pharmacogenomics, it involves the study of the role of genes and their genetic variations. All right. DNA, RNA level and all. So in the molecular base of disease, and therefore the resulting pharmacological impact of the drug on a genetic level. So for example, let's take about a drug called monoclonal antibody Herceptin. All right. So it was designed to create a subset of breast cancer patients who overexpresses a HER2 receptor. See, HER2 receptor is the human epidermal growth factor receptor. All right, it's a gene. So patients who lack HER2, they overexpress this gene and are considered to be non-responders to Herceptin therapy. See, we are not aware of all that. We still yet give the same therapy for everybody without even considering what their genetic makeup is. So in the past, such differences would be apparent only after trial and error method. But now the genetic knowledge improves our ability to select or design the proper drug for individuals suffering from a disease with a varying range of molecular defects. So then you have a lot of other influences on variations of drug disease and drug therapy. You have pharmacokinetic effects where the drug metabolism gets affected. You have the drug pharmacodynamics which get affected because variations in the receptor number, affinity or response to the drug, or pharmacokinetics like P-glycoprotein or other drug transport differences don't happen. All right. And then you have even environmental issues which affect the drug therapy, as in cigarette smoking, enzyme induction happens there. And then you think about exposure to mutagenic agents. So here, these are all the environmental hazards which cause a problem in drug binding. You have even climate change, like ultraviolet rays and all affecting your that sees the amount of vitamin D, or all these small things even has an impact on the drug therapy. All right. And so going forward, we find when you go forward in pharmacogenomics, you find something called as polymorphisms. That is when your gene as a specific or undergoes a lot of changes. All right, that is called as polymorphisms. Polymorphisms occur in a lot of drug transporters. We have CP2D6, CP2C19, CP2. All these are CYP450 enzymes. All right, they are subclassified into CYP450 chromosomes. So all these drugs have to go act on them. So based on this, I have put this picture over here, variations in enzymes of drug metabolism. So if you are a poor metabolizer of that enzyme, what happens? The gene, which is like, if the gene is deleted, it will lead to toxicity, because the drug keeps getting inside your body. And then what happens? The drug stays in your body for a long time and it does not get excreted out. All right. And then you have ultra metabolizers who keep metabolizing it at a very fast rate. So what happens? You get a subtherapeutic dose. Then you have people who have the right amount of these enzymes in your body. So for them, normal response. See, these are things which we never consider in our profession. So as pharmacists, we are given the knowledge of all these things. Just incorporating these things in a more advanced way, we can create a much big difference in life. Now coming to the actual topic, which is the precision or the personalized medicine. So let's talk about it. So let's talk about precision medicine and why we need a revolution in medicine now. So I would like to take you to a normal day at a hospital, maybe around 10 years back, where you find a young woman frequently, where you find a lot of young women frequently with breast and ovarian cancer. The problem with this, they're treated as the same, as in they're treated just for cancer. So, and it is really heartbreaking to know that for some people it acts and some people it does not act. So these things have to change. But even in 2020, we find that 90% of the top selling blockbuster drugs only work for 30 to 50% of patients. Okay, and then you find here you see the patient population that responds to a drug class. You have 57% people. Just this is as per literature, that 57% only people respond to the diabetes medicine properly as intended, and then you have 50% in arthritis, and you have only 25% in cancer. So we do need the revolution, and this revolution is precision medicine, because modern medicine, medical science has brought tests and ability to use the DNA modern medical imaging to subdivide almost every disease into variants or subcategories. And that allows us to do what we want to do. That is to use the right drug, that's to use the right drug for the right patient, for the right disease, at the right time, with the right dose. All right. And to achieve this, okay, we need something called as the triple helix, as you can see on the right side of this triangle, which is the academia, the National Health Service, that is in terms of the Western nation, and the industry. They have to work hand in hand. How? As in the academia, which brings fantastic clinical research, this being implemented as quickly as possible in our health science and industry, providing new tests and new drugs to the industry so that they can upscale it. So the promise of precision medicine is as illustrated here. We are able to remove all the shortcomings and then give a better therapeutic response to the drug. So here in precision medicine, we can see that we are actually focused only on the green people. All right. So all of us wish that me, you, and our friends, our family are the green people. That is how, like, this is the belief that we have when we take the drug. And those who don't respond well and don't develop adverse reaction, but you know, these are patients who they suspect that they won't get any adverse reactions. But here today we are talking about the people in the orange and the blue, as in they are the non-responders and toxic responders. We'll come back to them in the next slide or so. So it has been estimated that the World Economic Forum said that it will cost us around $47 trillion over the 20 years to deal with cancer. All right, that is cancer, diabetes, mental illness, heart disease, and respiratory system. I don't think even if the richest countries in the world can afford to practice medicine with the conventional way. So what we need is a change. As a global population, we do require a revolution, and medical science is ready for it now. And this is because in 2000, the first draft of the Code of Life, that is the Human Genome Project, was published, and it had taken 13 years that time. It had taken 13 years to do it, and it costed around $3 billion. But again, the science technology comes to a rescue, and over the subsequent years, the price and the time necessary to achieve has reduced exponentially. And now we can do this less than in $1,000. So $1,000 is around 73,000 rupees, and hopefully it will soon come to $100. That is like around 7,300 rupees. And in less than 24 hours, you can get your you can get your full genetic sequencing. From that, you can get to know what is your actual problem within you. So we
Jerish,
look. Yes, sir.
Jerish, sorry to interrupt you. You're shooting your time. Please close.
So how much
Please,
time do I have? Did I cross 10?
it's already crossed. So
All
please
right.
close it.
I'll conclude it. All right. So these are the ways how the drug trials are getting smarter right now. So we are now treating variant by variant, not by the old conventional way, as you can see in the picture. I'll not go into detail as the time does not permit. And now we have new advances coming up where we combine machine learning and combining precision medicine and machine learning to give a better therapy. So with artificial medicine, it just takes precision medicine to the next level. So now we are prepared for all that. In the forthcoming future, this is what will be running. And as pharmacists, we have the ability to incorporate both of this because we have the knowledge in medicine, and we are actually every day we are advancing ourselves. So we should take this up as this is a very growing field and get into it. So I thank you, and I wish you all a happy World Pharmacist Day. Thank you. Thank you for the opportunity.
Okay, thank you. Thank you, Jerish. Thank you for the presentation. Guys, next we have Kavya. Jerish, please unshare your screen. Kavya, I have unmuted you. Hello, Kavya. Yes, we are able to hear you. So I'm giving you the host rights. You can share the screen now.
Okay.
से आप संपर्क करना चाहते हैं वह अभी स्विच
Kavya, please share the screen.
Hello, sir. Is it visible?
No, not yet.
Trying, sir.
Okay, Kavya, if you're facing some network problem, we can get back to you after a few more presentations. Till then, you can check your network again. Okay. So I'm moving to the next student, Leah. Leah, I have unmuted you.
Yes, sir.
Yes, and I'm giving you the I'm making you the host. So please present. Kavya, please be on mute now. Yeah, thank you. Yes, we are able to see your screen, Leah. You can start the presentation. Thank you.
Afternoon to everyone. My topic is roles of a pharmacist in healthcare system. Who is a pharmacist? Pharmacists is medication experts and play critical role in helping people get the best result for their medications. Role of pharmacists: community pharmacy, clinical pharmacy, hospital pharmacy, industrial pharmacy, academic pharmacy, regulatory pharmacy, research and development, herbal pharmacy, and many more. Role in community pharmacy. A community pharmacist is responsible for dispensing and distributing medicines, buying of medicines, storage of medicines in appropriate condition, temperature, humidity, cleanliness, stock monitoring, dispensing of medicine, compounding and ensuring quality of compounded product, patient medication review, advise patient on use of medicine and participate in adverse drug reaction reporting, ensure rational and safe use of medicines by patients. Roles in clinical pharmacy. Taking the medical history of the patient, patient education, patient care, formulation and management of drug policies, drug information, teaching and training of medical and paramedical staff, patient counseling, therapeutic drug monitoring, adverse drug reaction reporting, pharmacoeconomics. Roles in hospital pharmacy, work in specialized fields such as oncology, cardiology, psychiatry, dialysis, infectious disease, critical care, pediatric and geriatric, working with the hospital team, monitoring, evaluating patient, drug therapy while in the hospital, counseling patient about their medication before discharge, educating physicians and other health care workers, overseeing the selection, purchase, and distribution of drugs used in the hospital, ensuring safe and efficient distribution of drug, development of best practice protocols. Roles in industrial pharmacy, work with researcher to develop, manufacture, and market prescription and non-prescription meds, provide quality control, act as liaison with government, or provide drug information, technical correspondence, or educational materials to the public and healthcare professionals. May also work as pharmaceutical sales representative. Roles in research: research in chemistry, pharmacology, toxicology, microbiologist, biopharmacist, non-clinical and clinical research, new drug application and generic medicine, patient compliance. Role in regulatory pharmacy, health and drug policy, management, administration, education policy, regulatory and enforcement agencies, professional registration authorities, international agencies, and professional bodies. Roles in academics. Education is an important function of modern hospital. Education as a hospital function has two major forms: education of the health professional and allied health professionals, physician, nurses, pharmacists, laboratory technologists. Allied health professionals, medical social service works, medical record librarian, dietitian, education program, formal program, medical nursing, pharmacy, laboratory, in service training, on job training, mainly for allied staff. Roles in herbal pharmacy. Current trend is shifted towards herbal medicine, identification of herbal product for particular disease, cultivation, harvesting, extraction, and purification of active ingredient, formulation in dose form, research in phytochemistry. Others: pharmacy marketing, drug information marketing, nuclear pharmacist, pharmacist clinical toxicologist, veterinary pharmacist. Thank you.
Thank you, Leah. Thank you for the presentation. Guys, next we have Kajal. Kajal, I'm unmuting you. Are you able to hear us, Kajal?
Yes, sir.
Okay. I'm giving you the host rights. You can share your presentation. You are the host now, Kajal. Share your presentation. Okay, you can start.
Good afternoon, everyone. I am Kajal Parmar. I am here to present my views on role of pharmacist in healthcare system. First of all, happy World Pharmacist Day to all. Who is pharmacist? In general, pharmacists, also known as chemists and druggists, are healthcare professionals who practice in pharmacy, the field of health sciences focusing on safe and effective medication use. Pharmacist is a professional qualified person to prepare and dispense medicinal drug to patient. He or she allow patient to safe and effective use of medicines. He gives right drug to right patient at right time in right dose through right route in right way. Apart from this, pharmacist is the one who deals with all the fields related to medicine, from cultivation of medicinal plant, extraction, synthesis, clinical and non-clinical experiments, dispensing, monitoring, pharmacovigilance. Role of pharmacist in healthcare system. There are various fields like clinical survey, industrial pharmacist, drug inspector and government analyst, academic pharmacist, community pharmacist, medical representative, research and development, wholesaler and retailer, druggist and chemist, hospital pharmacist, community pharmacist, frontline of healthcare bridge between general physician, nurses, and other healthcare professional and public, checking doses and ensuring that medicine are correctly and safely supplied and labeled. He checked patient compliance and monitored their therapeutic response to drug, counseling and advising the public on the treatment of minor ailment, monitoring blood pressure and cholesterol levels. It has also role in medicinal chemistry, like medicinal chemistry are focused on drug discovery and development and are concerned with the isolation of medicinal agent found in plant as well as creation of new synthetic drug compounds moieties. Theoretical chemistry, structural activity relationship, phytochemistry, computer aided drug design, identification, purification, identification, and analysis. Hospital pharmacy. Work in larger hospitals and institutional pharmacies frequently interact with the prescriber and doctors, maintain medical reports, influence the selection of drugs and doses regimen, monitor patient compliance and therapeutic response to drugs, and to recognize and report adverse drug reaction. Serves as a member of policy making committees including those concerned with the drug selection, the use of antibiotics, and hospital infection, drug and therapeutic committees, and thereby influences the preparation and communication of an essential drug list of formula. Educate other healthcare professionals about the rational use of drugs. Participates in studies to determine the beneficial for adverse effect of drugs and is involved in the analysis of drugs in body fluids, procurement and inventory management of drugs, planning and implementation of clinical trials. Academic pharmacy, research and academic go hand in hand. A well-skilled manpower produced from good institutes and reduces the skilled pharmacists to fulfill the future demand of the market. Give proper education and ethical knowledge in the pharmaceutical practices. Research and development. There are various fields research in chemistry, pharmacology, toxicologist, microbiologist, and biopharmacist, non-clinical and clinical research, patient compliance. Pharmacists in India. In India, there are around 10 lakh pharmacists working in various positions, applying their unique knowledge and skills, contributing to the health of nation. Pharmacists are involved in scientific procurement and distribution of medicines. Pharmacists help in achieving the goal of rational use of medicine, safe use of medicine. Pharmacists have thorough knowledge about medicine and their use and are in better position to educate other health professionals about the rational use of medicine. Thank you. Have a nice day.
Thank you, Kajal, for the presentation. Thank you very much. You can unshare your screen now. Okay, guys, so next we have Minakshi Panwar. Minakshi Panwar, I have unmuted you.
Hello.
Yes.
So can you hear me?
Yes, I'm able to hear you. I'm giving you the host right, Minakshi. Just a minute. Yes, you are the host now. Minakshi, you can share your screen.
So can you see?
Yes, I'm able to see your screen. You can start the presentation. Thank you.
So very good afternoon to all. My name is Minakshi and I am an MSc postgraduate, a biotech postgraduate. And the topic of my presentation is examining role of new technology in pharmacy practice now and future. So these are the contents. So these are the contents which I'm gonna brief about. The very first one is pharmacy practice, need and purpose of good pharmacy practice, technology trend in pharmacy practice, and the very last one is conclusion. So as Amit sir and Kuldeep sir have given a brief intro on this day, the World Pharmacist Day, why do we celebrate it and when did it start it? I will directly come to my topic. So the pharmacist, as we all know that the pharmacists play a very crucial role in the healthcare by compounding and dispensing medications, and also by reviewing medication for safety and efficacy. So what is the need? So the need and the purpose of good pharmacy practice is to avoid the ill health in the population. Okay. So what are the technology and trends in pharmacy practice? As we all know that technology is running behind, the entire world is running behind technology, and it has had a very major impact on our lives. So it is a bit hard to remember everything for the prescriber and pharmacist. So information technology can enable the storage of structured patient records, handling of medications, and to provide tools for monitoring the efficacy and safety in use. So what are the technology we are using these days? The very first one is internet. The power of internet has been widely adopted for business and social communications. As the use became universal, there may be an increase in the number of internet pharmacies. For example, NetMeds. You just upload your prescription there and you'll get the medicine at your doorsteps. And it is very secure web-based platform and support enhanced pharmacy services and public health initiatives. The next one is electronic prescribing and discharge. Electronic prescribing system automates. It is to minimize and to prevent errors which arise from miscommunication from the pharmacist to the patient. So it will just minimize that. The next one is barcode medicine identification. So the barcode medicine identification has been used with EP system. It is just like, I can say, whenever you go for shopping in the mall or somewhere in the shop, you just put one packet and they just scan the barcode. Same goes here. Whenever whenever the pharmacist hold the sheet, they just scan the what you call the barcode, and it will directly come like how to take it, when to take it, and at what dose. So as to avoid the errors. So a falsified medicine directive have been implemented in 2017 in order to combat counterfeiting. Okay. So the next one is medication therapy management. Medication therapy management include comprehensive medication reviews, medication reconciliation, drug dosage adjustment, and also the identification of gaps in care. Next one is waging the war against substance abuse. Prescription of drug abuse, especially the opioids. Opioids are well known for pain. So, and also they come under Schedule X. So, the drugs which come under Schedule X, they are, we cannot take them without prescription. So here is some data. In 2010, 38,300 people in the United States died because of drug overdose, 22,000 from drug overdose from medications, and 16,600 from opioid pains. So the state and federal government agencies have come to combat this problem, and they developed two technologies. The very first one is EPCS, the second one is PDMS, Electronic Prescribing Control Substance and Prescription Drug Monitoring Program. The next one is automated dispensing. So as we all know that robots have been widely used in the pharmacy. Now in pharmacy, because they can handle high volumes of high volume and to release pharmacists to develop and deliver patient-centered care. Uh, the next one is mobile technology. The use of mobile is wide in society, and it can develop for disease monitoring, for example, peak flow, glucose level, and to support health education. The next one is adherence monitoring and telecare. So in adherence monitoring, a smart pill have been developed where a microchip containing tablet where the patient intakes the microchip containing tablet, and it just give the doctor or the pharmacist to record the uh, to record the side effects monitoring, and it can be transmitted to a mobile telephone or tablet device. The last one is telecare. As we are facing this COVID situation, it is very hard to go out and to get our medicine at our doorsteps. So we can just audio and we can just call and our doctor, and they'll prescribe medicines for us, and which will improve the healthcare. And the by conclusion, and it can be concluded that these technologies help speed up the sorry, I stammer. So these technologies speed up drug preparation and verification, and automatically filling prescriptions. Pharmacists have more time to spend in patient counseling. Thank you. Hello.
Thank you very much,
Sorry,
Minakshi.
sir, I stutter. So,
No problem. Thank you, Minakshi.
okay.
It's a part of the presentation. No problem.
Okay.
You tried well. You gave your best. That's it. Thank you very much. Now next we have Priyanka Walekar. I unmuted you, Priyanka.
Yes.
I'm giving you the presenter, right? You are the host now, Priyanka. Yeah, please share the screen.
Hello everyone. Good afternoon to all of you. Myself Priyanka, and today my topic of presentation is role of pharmacist in healthcare system. Hello, sir.
Yes, yes, Priyanka, you can continue.
Yes. Yes. Then the pharmacist. The pharmacist is a healthcare professional licensed to engage in a pharmacy with duties including dispensing prescription drug, monitoring drug interaction, and counseling patients regarding the effect and proper uses of drug and dietary supplements. The mission of a pharmacy is right drug to patient at the right time, in the right dose, through right route, in the right way. So we can say without medicine, there is no life. It acts as a sanjeevani for human beings. Then role of pharmacist in healthcare system. Very much so many areas which pharmacists role includes and pharmacist in research development in hospital pharmacy, community pharmacist in representative in drug inspector and government analysis. So we can pharmacist which focus on teaching, research, and training of drug pharmacists, which include educational training program, helps professionals for the current knowledge. By arranging seminars, project, or system academic, pharmacists play valuable role in the system. So pharmacist gets specialized knowledge regarding drug and therapeutic action through their training. Which include research and development, pharmacists contribute to certain expertise in formulation development of a particular relevance to the biological availability of an active ingredient, which is known as a API, pharmaceutical ingredient, and then manufacturing and quality assurance, then quality assurance through the validation of various stages of a production and testing of product before release. In sale and marketing, which can make a contribution to proper marketing practices related to healthcare and to the provision of appropriate information to health professionals and the public. A community pharmacist which work at the front line of healthcare in this town and villages across the nation. They work from their own pharmacies or out of healthcare settings and after surgeries. Pharmacists helping public accessing their condition, making decisions about which medicine they should take. They involved in dispensing medicine and offering patient advice and practical help on keeping health. Then pharmacy, they are part of team which focus on the patient, like a doctor, which pharmacists regularly attend the ward and more involved in selecting the treatment for patients than ever before. Also involved in manufacturing of medicine, managing care of patients with all types of conditions, working in dispensary, providing information on medicine for the whole hospital. Some pharmacists specialize as a consultant in many areas like hematology, related to the blood, in nephrology, in the kidney, respiratory medicine, and cardiology related to heart. Then, and also as the drug inspector and drug analyst, the drug inspector can inspect the premises where drug manufactured, stored, or sales, and the government analyst analyzes test samples sent by inspector and furnish the result of test analysis, and this test result forwarded to government and then as my medical representative, which work as introducing a new market, new product in the market, farmer getting feedback on this product from the patient, then provide support and customer service. So we can see the pharmacy which reflects the sector of a society in the form of artists, designing, engineer with technical knowledge, sound knowledge, management, accounting, marketing, and sales, as a health professional having a fair knowledge regarding health. So we can conclude pharmacist is the first person of health by playing various roles like academic pharmacist, industrial pharmacist, community pharmacist, hospital pharmacist. All pharmacists work in different fields of a profession directly or indirectly related to the nation's health. So pharmacists are responsible for ensuring that right drug to right patient at the right time in right dose to right route in right. So in conclusion, pharmacists are one and only qualified and practitioner that provide backbone that strengthens the healthcare of the nation. Hello, sir.
Thank you. Thank you, Priyanka. Thank you very much for the presentation. Guys, next we have Minakshi Verma.
Thank you, sir.
And Minakshi, I have unmuted you.
Hello, sir.
Yes, Minakshi, we are able to hear you.
Yes, sir.
I have given you the host rights. Please share your screen. After Minakshi, we will have Mumtaz. So Mumtaz, be ready. After Minakshi, you have the presentation. Yes, Minakshi, we are able to see your screen. You can start the presentation. Thank you.
Good afternoon, everyone. First of all, I would like to wish a very happy 10th World Pharmacist Day. So, on this occasion of World Pharmacist Day, I would like to enlighten upon various roles of pharmacists in the current Indian healthcare system. So, before getting to the various roles of pharmacists, in order to create a clear understanding, we should definitely know who is pharmacist. So, apothecarists are the first pharmacists who were specialized in compounding, dispensing, and administration. So, pharmacists are very well qualified, holding diploma and degree in pharmacy from a recognized Indian university or from foreign university recognized by the authorities. So, to practice pharmacy in India, a qualified pharmacist is mandatorily required to register in PCI, that is Pharmacy Council in India. So, a pharmacist is the most eligible professional for handling the drug throughout the drug development and supply chain. Pharmacist is an independent multifunctional professional. So according to the nature of duties performed by the pharmacist and location, there are the following types of recognized pharmacists. That is number 1, compounding pharmacist or industrial pharmacist. Number 2, medical representative. So after compounding of any drug, we require medical representative for marketing and giving an information to subscriber and patients. After that, dispensing pharmacist. We need a dispensing pharmacist to dispense the medicines. And there is the 4th point is hospital pharmacist. 5th, clinical pharmacist or departmental pharmacist. And the 6th one is clinical research. The 4th one is pharmacovigilance, post-marketing surveillance. Now we'll discuss in a bit briefly about all these topics. So coming to the compounding pharmacist druggist is a very qualified professional who is responsible for compounding of the medicines. So he has a very powerful knowledge to prepare the medicines by mixing a calculated quantities of the ingredients. Okay, so they were like compounding syrups, lotions, talcs, and other mixtures, solutions, and emulsions, etc. Coming to the medical representative is responsible for explaining the uses of medicines to the prescriber and consumer. As I mentioned previously, that after compounding a drug, the medical representative is the person who is creating a market for a new medicines or an updated use of old medicines. The next one is dispensing pharmacist. Dispensing pharmacist is a fulfill a legal prescription by dispensing the medicines. So he is the person who dispenses the OTC medicines also. OTC medicines are those medicines which are not needed to be prescribed by the professionals, but the pharmacist will sell that medicines. They role as a keeping the records of purchase and sales of medicines in the pharmacy and storing medicines according to their storage requirements and legal requirements. Like narcotic drugs and chemotherapeutic drugs, they have to get a special permission to store these kind of medicines and to sell it. They are the lines between the customers and the prescribers, and they provide the patient counseling about the medicines prescribed. Means they will tell briefly, they will counsel the patients that what the disease is and how to how the medicine is useful and at what time it is to be taken. After that, the hospital pharmacist, they are responsible for continuing and uninterrupted follow and medicines inside the hospital and keep tracking of all the medicines inside the hospital and you're maintaining all the records of purchase and sales of the pharmacy items. And they are also like hospital pharmacy department is one of the most dynamic departments in the hospital that generates in revenue in the organization. So it is also part of a supply chain management. It predicts the future requirement of pharmacy items and maintain the stock accordingly. Hospital pharmacists work as a team with the other healthcare professionals. Coming to the point with the clinical pharmacist, modern pharmacist. So they are the bridge between the prescriber, hospital pharmacy, nursing staff, and patients. And their main role is like during drug interaction, dose calculation and dose adjustments, patient counseling about the disease and medicines related to the particular disease, and ensuring the patient compliances, monitoring of adverse drug reaction, etc. And they also contain the PTC meeting as a convener or at regular intervals. Coming to the clinical research, it's a drug development, means vital role in drug development process, starting from the discovery till the therapeutic outcome of the medicines. So in clinical research, CRA and CRC plays a very important role for maintaining all the important documents during the study trial. So they provide a patient counseling, and there's a liaison between the healthcare professionals and subject enrolled. And the documents related to the drug supply, consumption, and running of the pharmacies. And they also monitor an SAE monitoring and reporting. Coming to the pharmacovigilance, the post-marketing surveillance, which is considered as a fourth phase of clinical trial. So in this, the monitoring of adverse event of a drug after marketing approval. And in pharmacovigilance programming of India, NCC PPI, that is National Coordination Center for a Pharmacovigilance Program of India. So the main office is an Uppsala Monitoring Center at Sweden. Pharmacist plays a crucial role in pharmacovigilance as he or she is the person who stays in contact with the customers. So they will provide the feedbacks of the medicines using by various customers. In this pandemic situation, the latest role of pharmacist is online pharmacy and telemedicine. So the concept of online OPD means outdoor patients. Once the doctor has interacted with the patient through online OPD, he generate an online digitally signed prescription and send it to the pharmacist. When pharmacist reviews the prescription and if it found correct, receives the order and dispense the medicine. That's all about the roles of all the pharmacists. Thank you everyone, and happy World Pharmacist Day.
Thank you. Thank you, Minakshi.
Thank you, sir.
Thank you very much. Now you can unshare your screen. And next we have Mumtaz. Mumtaz, I have unmuted you.
Yes, sir.
Yes, so I am giving you the presenter right. Just give me a minute. Yeah, Mumtaz, you are the host now. You can share your screen. Then the next students after Mumtaz is Dr. Nitin Tomar. Please be ready. After Mumtaz, your presentation.
Hello. Good afternoon, everybody.
Mumtaz, we are not able to see your screen.
Just a minute, sir. Now, sir?
Yes, now you can start your presentation. Do the slideshow and then start the presentation. Yeah.
Good afternoon, everyone. First of all, I would like to wish everyone a happy World Pharmacist Day. And my name is Mumtaz Mohammed. and I have done my post-graduation in biotechnology and currently pursuing advanced PG diploma in clinical research, pharmacovigilance, and clinical data management. Today, my topic is role of pharmacists in healthcare system. Before I start the role of the pharmacist in healthcare system, I would like to tell about who is a pharmacist. A healthcare professional licensed to engage in pharmacy with duties including dispensing prescription drugs, monitoring drug interactions, administering vaccines, and counseling patients regarding the effects and proper usage of drugs and dietary supplements. Pharmacists work in collaboration with other healthcare providers, undertake responsibility for patient outcomes with respect to their drug therapy. The principal task of the modern pharmacist is to identify, resolve, and prevent drug-related problems. He is a person who provides right drug to the patient at right time in right dose through right route in the right way. So your pharmacist is your medical expert. He has complete knowledge about the medication you are taking. He can interpret drug interactions, counsel on prescriptions, make medication information understandable, provide vaccines, over-the-counter counseling, help you stay out of the hospital, manage chronic disease, help you quit smoking, make it easier to take your medication, stay up to date on what matters to you, verify, prepare, and check medication and wellness screening. So, coming to the role of the pharmacist in healthcare system, pharmacist is a backbone that strengthens the healthcare system. Different roles of pharmacists in different sectors of pharmacy profession like industrial, academics, community health, clinical research, drug design and discovery, developing NDDS, etc. Pharmacists play an integral part of healthcare system. Physician can give medicine to the patients, but life to the medicine is given by the pharmacist. They are the one who prepares the medicine. Pharmacists are employed in regulatory control and drug management, community pharmacy, hospital pharmacy, pharmaceutical industry, academic activities, training of other health workers and research. In all these fields, their aim is to ensure optimal drug therapy, both by contributing to the preparation, supply, and control of medicines and associated products, and by providing information and advice to those who prescribe or use pharmaceutical products. So this is a chart showing the different roles of the the pharmacists in all different sectors the pharmacists play. Like the industrial pharmacists, the academic pharmacists, research and development, hospital pharmacists, and the clinical surveys, and the community pharmacists as a medical representative, wholesaler or drug retailers and druggists and chemists, drug inspector and government analyst. So coming to what role these the pharmacists play in individually in each of these sectors is first coming to the community pharmacists. Community pharmacists offer a trusted environment which reduce medication errors and improve safety while reducing cost and improving the quality of care. They are specially trained to help manage side effects and counsel patients on taking multiple medication effectively and safely, and they're also more easily accessible than physicians. Community pharmacists act as information resources on lifestyle changes that can influence healthy outcome. They are involved in health screening, for example, like diabetes, cholesterol, and osteoporosis, immunizations, pain control, counseling, or health education. They also provide information on self-management. For example, like in rural areas, people do not know what sort of problem they are, like they do not know what is hypertension, they do not know like diabetes, asthma. So these community pharmacists help them, educate them, give them awareness of that problem, and help them in self-management with the medicines, And they also help people who want to quit smoking and alcohol and help in family planning also. So the next sector is hospital pharmacists. Hospital pharmacists are responsible for monitoring the supply of all medicines used in the hospital and in charge of purchasing, manufacturing, dispensing, and quality testing their medication stock. Hospital pharmacists are a vital part of the healthcare team, working in either the public or private hospitals and other institutions and facilities such as outpatient clinic, drug dependency treatment facilities, poison control center, drug information centers, and long-term care facilities. They have opportunity to interact with prescriber and promote prescribing and use of drug. Having access to medical records, they can influence the selection of drugs and dosage regimen to monitor patient compliance and therapeutic response to drug and recognize and report adverse drug reaction. They can take part in planning and implementation of clinical trials as well. So the next sector is industrial pharmacists. What role these industrial pharmacists do? The industrial pharmacists conduct research, testing, and analysis in the development of medicines and production of pharmaceuticals and related supplies. Industrial pharmacists use the latest methods, technologies, and process to develop new medications and may be involved in clinical drug trials. Their main activities include research and development, manufacture and quality assurance, drug information, patent applications and drug registration, clinical trials and post-marketing surveillance, sales and marketing management. The next comes the academic pharmacists. Academic pharmacists focus on teaching, research, and training of the upcoming pharmacists. Academic institutes are major source of pharmacists who add professionals into healthcare system. By arranging seminars, projects, or system academics, pharmacists play a valuable role in motivating professionals into the system. Students acquire a broad understanding of the scientific principles and techniques of the pharmaceutical sciences and the ability to keep pace throughout their careers with developments in medicine and pharmacy. So apart from this, the pharmacists also play important roles in different other sectors of healthcare system like veterinary pharmacists, toxicology, herbal pharmacy, disaster management, etc. In conclusion, a pharmacist is the lawfully qualified expert individual to deal with drugs and supplies required for the patients inside and outside the clinic. The improvement and strengthening of the pharmacists can happen if suitable advances are taken to guarantee that pharmacy licenses are granted just to the qualified pharmacy graduates and satisfactory educationals so pharmacists remain and are compensated for being the best wellsprings of data identified with medication use. Fruitful approaches in such manner and execution of proper control will guarantee the advancement of a more secure and progressively successful pharmaceutical health framework, which can enhance and guarantee the health administration for the prosperity of individuals of our nation. Thank you.
Thank you. Thank you, Mumtaz, for the presentation. Thank you very much. Again, I'm unmuting you.
Yes, sir.
Now I'm giving you the host right, and you are the host now, Nitin. You can present.
Sir, can you see this?
Yes, we are able to see the screen. You can start the presentation. Thank you.
Okay. So on the occasion of World Pharmacist Day, I would like to present my views on the role of pharmacist in the healthcare system. Being a pharmacist, a person has the patience to listen the patient's query, maintain its honesty and ethics when giving counseling to the patients. In this profession, a pharmacist should carry alertness in their work, in research, and also motivates others. Pharmacist administration, it provides leadership and support to the practicing pharmacist in any situations, and also have courage for engaging in a new experience in a healthcare system. A pharmacist should not intelligent by their knowledge, but also when they counseling, giving brief description of a drug, and also studious with his and her career, and also think positive even in a difficult situations. All these points carried out by a good pharmacist. A mission of a pharmacist is not only dispensing the drug but also take care of the patient's ethics by giving right drug to the right patients at the right time in a right dose through the right route in a right way. So these are the different roles as a pharmacist play in a healthcare system. That will be the community pharmacist, academic pharmacist, industrial pharmacist, and the hospital pharmacist. As a community pharmacist, a pharmacist's job would be all about helping patients and the public, and also assessing their conditions and make decisions about which medication should they take. As a pharmacist work as a front lines of healthcare in cities, towns, and villages across nations. As a community pharmacist, job they will be involved in dispensing medicines and offering patients advice and practical help on keeping health. As an academic pharmacist, it educates, train, assess, and develop pharmacy students, and also pharmacists and their healthcare professionals. As academic pharmacists, they use and apply their knowledge and skills to teach the next generation of pharmacists through a variety of teaching methods. And as a teacher practitioners have a example, he or she is spending on their average around 60% of their times in working in hospitals and 40% time as a lecturer. So as an industrial pharmacist, they use the latest methods, technologies, ideas, and process to develop new breaking medications. It is a field in which a pharmacist can make a real difference in lives of people who use medications to treat a variety of illness and conditions by monitoring of drug as per the guidelines. So there are different departments in industries where a pharmacist work. That is research and development, manufacturing and quality assurance, drug information, clinical trial and post-marketing surveillance, and pharmacovigilance. As in a hospital, a hospital pharmacist work as a clinical pharmacist, hospital pharmacist, or a pharmacologist. Work in a large hospital and institution, pharmacists frequently interact with the prescriber and doctors. In a hospital pharmacy department, there are many areas we can get involved in, like doctors. Pharmacists regularly attends ward rounds and more involved in selecting treatments for patients than ever before, and also serves as a member of policy-making committees, including those concerned with the drug selections, the use of antibiotics, and hospital infections, that is drug and therapeutic committee, and thereby influence the preparation and composition of an essential drug list or formularies. So the summary of is that the pharmacy is a complete profession within the healthcare professional. For example, a pharmacist play a role of artist to design a drug dosage form and a lawyer having fair knowledge of law and legislations about the drugs, an engineer having a sound technical knowledge, and an entrepreneur you have a sound knowledge of management, accounting, marketing and counseling, and in health professions. Thank you. Thank you, sir.
Thank you. Thank you, Dr. Nathan. Next, we have Priyanka K. Priyanka, I have unmuted you.
Yes, sir.
Yes, we are able to hear you. So, Priyanka, I am giving you the host rights. Priyanka, you are the host now, and you can share your screen. And after Priyanka K, we have next candidate Priyanka M for the presentation. Okay, so Priyanka M, please be ready after Priyanka K. So, yes, Priyanka, share your screen.
Yes, sir. Trying to. Share. Share. So is my screen visible?
Yes, it is coming. Just it is showing. Yes, now you are able to share, and we are able to see your screen. You can do the
Okay.
slideshow and then start the presentation.
Yes, sir. Shall I start?
Yes, Priyanka, please start.
Yes. Good afternoon, everyone. Myself, Priyanka Kauri, and I will be presenting on the role of pharmacist in the healthcare system. First of all, happy World Pharmacist Day to everyone. This special day was established by International Pharmaceuticals Federation, a global federation of pharmacists and pharmaceutical scientists. 25th September was suggested by Turkish members as it is the date when International Pharmaceutical Federation came into existence in 1912. The aim of World Pharmacist Day is to encourage activities that promote and advocate the role of pharmacists in improving health in all corners of the world. Pharmacists play a very vital role in the healthcare system as they act as a backbone to strengthen our healthcare system. A pharmacist, also known as chemist or druggist, are health professionals who specialize in the use of medicines as they deal with the composition, effects, mechanism of action, and proper and effective use of drugs. According to the Pharmacy Act 1948, registered pharmacist is a person whose name for time being is registered, who is entered in the register of pharmacists of the state in which he is for time being residing or carrying on his profession or business of pharmacy. The principal task of the modern pharmacist is to identify, resolve, and prevent drug related issues. Now, the word pharmacist stands for patience, honesty, alertness, research, motivator, administrator, courageous, intelligent, studious, and thinker. These are the qualities that a pharmacist possesses. A pharmacist can play various roles in the healthcare system, such as academic pharmacist, primary care pharmacist, community pharmacist, pharmacist with special interest, hospital pharmacist, and many more. Academic pharmacists are the pharmacists who focus on teaching, research, and training of the upcoming pharmacists. Academic institutes are major source of pharmacists who add professional into healthcare system. Education motivates the professionals in the healthcare system. Pharmacists gets a specialized knowledge regarding to drugs and therapeutic action through their practical training. Academic pharmacist is the preliminary part in pharmacy profession. Next one is industrial pharmacist. There are various fields in which the pharmacist can work in industrial pharmacist, such as research and development, manufacturing and quality service, drug information, parent application, drug registration, clinical trials and post-marketing surveillance, sales and marketing, and management. In research, there can be various roles. There can be various fields in which a pharmacist can play a role, such as research in pharmacology, toxicology, biopharmacist, non-clinical and clinical research, and new drug applications, and many more. Primary care and pharmacist or prescribing advisories. People work in national health service organizations that are in charge of range of local health services, such as doctors, surgeries, and community pharmacies. Their job is to ensure the best use of medicines and resources across the area. Community pharmacists are the pharmacists which are responsible to dispense medicines. Pharmacists work at the front. These pharmacists work at the front line of healthcare in cities, towns, and villages across the nation. They will be involved in dispensing medicines and offering patient advice and practical help on keeping health. As community pharmacists' job would be all about helping the public, assessing their conditions, and making decisions about which medicines they should take. The next one is pharmacists with special interest. Pharmacists with special interest are involved in developing their skills and expertise in special areas. As per Government of India, now pharmacist is considered as Arogya Doot who can formulate, compound and dispense medicines in his pharmacy. The next is hospital pharmacist. Hospital pharmacists are a vital part of healthcare team. In hospital pharmacy department, there are many areas we can get involved in, like doctors, pharmacists, attending ward rounds, and in selecting treatment for patients. There is also manufacturing of sterile medicines, managing the care of patients with all types of conditions, working in dispensary, providing information on medicines for the whole hospital. Thank you and wishing all of you happy World Pharmacist Day. I would also like to add that pharmacists reflect on every sector of society in the form of artists, lawyers, engineers, entrepreneurs, health professionals. As artists designing a drug dosage form, as lawyers having fair knowledge of laws and legislations about the drug, as engineers having sound technical knowledge, entrepreneurs with sound knowledge of management, accounting, marketing, counseling, and as health professionals having fair knowledge regarding health. Pharmacist is an integral part of healthcare system, and ensure they ensure you the right drug to right patient at right time in right dose through right route in the right way. Thank you.
Thank you, Priyanka.
Thank you, sir.
So next we have Priyanka M. So Priyanka M, I have unmuted you.
Hello, sir.
Hello. Yes, we are able to hear you.
Thank you, sir.
Just a minute, I am giving you the host rights. So you are the host now, Priyanka. You can share the screen. And after Priyanka, we have next student Rishika. So Rashika, sorry, not Rishika. My apologies. So Rashika, please be ready after Priyanka. Yes, Priyanka, we are able to see your screen. So please start the presentation.
Okay, sir. Good afternoon, everyone. I am Dr. Priyanka M. I am a dentist by profession. So today I am here to talk on the topic examining the role of new technology in pharmacy practice now and future. So first of all, I'll tell you that many of us have heard that what if the world would be like if doctors were not there? What will be the what will be the status of humankind? How will we survive? All these questions we have heard, especially during this pandemic situation. But many of us are forgetting the fact that doctors are never complete without pharmacists. Actually, the pharmacists and doctors are working hand in hand. And not only both of them, all the healthcare professionals should work hand in hand to bring out the healthcare profession a more flourishing one. So first into the topic, first is the basic definitions for pharmacy and a pharmacist. Many of them I have already described it, so I'm not going into the details of that. And so pharmacy industry is at a fast pace of growth and there are innumerable technologies coming up in the field. And why technologies are because there is a high proportion difference between the prescriptions that are being made and the pharmacists that are available. So it is natural to cause human error because of the large proportion difference. And as per a study, we have a lot of errors that is coming up. Example, there is 38% of administration error, 39% of prescription error, 11% in transcription error, and 12% in dispensing error. So to overcome these errors, we have improved new technologies that are coming up in the field. So the technologies used in the medication use process are as follows. In the area of prescribing, there is clinical decision support software, This is a software that enables a physician to take decisions on a case, that is, support the physician to arrive at conclusions. Then there is CPOE, which is computerized physician order entry, wherein the physician can enter like electronic prescriptions can be entered in the system, which will be transferred onto a transcription hub, where all the pharmacists, all the other members of the healthcare wing, and as well as the consumer have access to it. So it helps in reducing the error regarding medications. The next stage is preparation and dispensing, which has carousel technology, centralized robotic dispensing technology, pneumatic tube system, unit dose packaging, which will be discussed in the coming slides. Then in case of administering, there is barcode medication administration technology, in which there will be a barcode on the consumer's wrist, and also a barcode will be present in the medication, and by matching the two of it, the medicines will be delivered. Then there will be clinical based infusion pumps. Then the monitoring include electronic clinical documentation system, web-based compliance and disease management tracking systems. So the newer advance in the pharmacy field are, one is unit dose packaging. This is like the drug is dispensed in units, and the primary purpose of this is minimize the wastage of drugs. There is automatic dispensing systems, that is drug storage devices that electronically dispense medications in a controlled fashions. And now in this field, robotics are also coming up, but it is not established, but it's still in research form. But there are robotics coming up in this field. So it uses a barcode technology for pulling out of the drug. The next one is carousel technology. It is a medical storage device which uses rotating shelf used to automate medication dispensing. Like they use barcodes and also pick to light technology. And so this technology mainly helps to reduce the drugs like look alike or which may sound alike. So this technology mainly helps to reduce such kind of errors. Next one is pneumatic tube system. We have the cylindrical containers are propelled through a network of tubes by compressed air vacuum, and is usually used for the transport of physical objects and solid objects. Then we have already mentioned, I have already mentioned that is we have robotics and IV room for automating the preparation of IV syringes, bags, etc. Then we have outpatient pharmacy, which includes automatic counting, automatic fillers, automatic robotics, which all are coming into force. Now to the future goals. To discuss about the future goals, one of the main important aspect of pharmacology that is developing is genomics. It's one of the most promising fields, and likewise we need to know what is happening in the gene level for a better absorption of the drug. Like for example, we have a cytochrome P450 group of enzymes which are mainly responsible for the metabolization of most of the drugs, and we have genetic malformations occurring to most of them. Like one of its substrate is 2D substrate, which was demonstrated in a study that 6 to 10% of the people have this isoform which is defective. So we should know, like when a when a new drug is introduced in the body, we should know what is the condition of this cytochrome P450 at the genetic level, so that what will be the effect of the drug happening on humans. So like it will be a customization for each individual, and this is a very growing field, and only we are in the initials, and we have far to reach in this field, far more to reach in this field. The next one is artificial intelligence and machine learning. Artificial intelligence is used in mainly like in pharma industry. There are like we have a system, like we have many years to develop a particular drug, and to market it we are taking a plenty of years. So using artificial intelligence, we can do this like within seconds we know the effects of drugs. This will be based on billions of simulations of human body's physiology that was from the past records. So if this comes into being, our pharma industry, what will be like? It will be a very flourishing one. It will develop at a very faster pace. Then is the digitization of the medicine through healthcare mobile apps. Even now, the healthcare mobile apps are available. Many of the companies are offering the apps to know what is the condition of the patients, what are the reviews of the patients, if any concerns are there for the patients, and also fitness apps for chronic diseases, e-commerce apps, and also they are linking to the companies, so it's insurance companies, so that and document authentication of the patient will not take much time. So digitization of the medicine has come to almost, it is into the market now, but it's still developing. Next is augmented reality and virtual reality. We all know, we are familiar with augmented reality and virtual reality. And we can, the main goal is that we know the patient can experience how the drug will act on. Like we can see without reading a whole prescription, we can literally see how the drug is working on a patient. The patient himself can see it. And also in case of pharmacists, they have a chance to, not only pharmacists, even doctors, they have a chance to know what will be the experience of patients in certain conditions. Example, what will be the experience of a patient if he has migraine. The physician or the pharmacist will have a chance to experience this, so that we will ourselves develop an empathy towards the patient. So that's it about artificial audio reality and visual reality. Next is about blockchain. Blockchain is a system of recording information in a way that makes it difficult or impossible to change or hack or cheat the system. Like it's a very complicated system to bring into effect, but it's such a system so that mainly we don't have any counterfeit drugs. That is, fake drugs cannot be marketed, and if this system comes into being, like there will be no fraudulence in the field of pharmacy. Next is the 3D printing of drugs. This has also come into field in 2015, and the first drug which was 3D printed was Pritam, which was for epilepsy, and this is the first FDA approved drugs. And 3D printing is done such that these high dose medications will be rapidly disintegrated from the human body. Next is the organs on chips. Organs on chips are three-dimensional microfluidic cell structure chip. The main function of them is they simulate the activities, mechanics, and physiological response of the entire organ. So they act as an artificial organ that can do a variety of human functions, but it is still only in a phase of developing, so that we can do only these in vitro trials, and only we cannot do in vivo trials because the technology is not advanced far. So next, actually this is a grocery store. It's a solar power grocery store which works on artificial intelligence. It does not need any staff, and delivery is also by drone. So what if this is the future? Like future pharmacy will be like this. And yes, we all, not many pharmacists will have a problem that, or they will be in fear that will they just lose the job in future when such a thing is going to come up. But the answer is a big no. From the basic things that we are doing now, they will be more oriented for a patient-centric profession, and they will be more into research field. So the job opportunities for pharmacists will only increase if these technological advances come into being. And yes, let this be our future goal, and let this come to happen. And to conclude with the session, we are developing into a new era of pharmacy industry. We have all the technological advances along with the human intellectuals which can create miracles. So in future, there will be maybe a situation we can develop such that we have a customized product based on individual genome, health status of the patient, and the point of care. And also maybe once, maybe it's a dream come true, but we can develop a drug such as all in one pill, such that for all the medical conditions, patient will have to take only one pill. Let all this come to happen. And so that's about my presentation. Keep calm and become a pharmacist. So wish all the pharmacists out here a happy Pharmacist Day. Thank you.
Thank you very much for the presentation. Thank you. Next we have Rashika. Rashika, I have unmuted you.
Yes, sir.
Yeah, just give me a second. I will give you the presenter rights. You are the host now, Rashika. You can share the screen and then you can start the presentation. And after Rashika, the next student we have is Shruti Savant. Please be ready after Rashika. Yes, Rachika, you can share the screen.
Yes, sir. Hello, sir. So is it visible?
No, not yet, but it is processing, I think. It will be in few seconds. It is showing that you have started sharing the screen, but we are not able to see it. Yes, now we are able to see the screen. Now you can start the presentation.
Okay, sir. Sir, actually it's loading. It's showing loading.
Yeah.
Hello, sir. Sir, are you able to see my screen?
No, Rashika. It is showing loading round and round. Please unshare and then share again. Try once. If then also it not works, then we will move to the next student and you can check your network, please. Rashika, you can unshare once and then try to share again. Okay, I think we should move to the next student. So we have in line, so Kavya was there, who was not able to share the screen, and now Rashika. So we will get back to you, Rashika, again after we complete with the other students. Okay. So Shruti, uh, I'm unmuting you, and I'm giving you the
Yes, sir.
presenter, giving you the host.
Hello, sir.
Yes.
Sir, is it visible?
No, Rashika, it's not. Please
Sir,
unshare
this
your
is
screen.
Shruti.
Yes, Shruti, it's not visible. I think first, Rashika, you have to unshare your screen first. Please do that. It is still showing that you are viewing Rashika's screen. Yeah, Shruti, now you can share.
Sir, is it visible?
It is showing, yeah, it is visible, and you can start the presentation. Thank you.
Okay. Good afternoon, everyone. Myself Shruti Sawant, and I'm going to share my views on examining role of new technology in pharmacy practice now and future. To start with the basic definition of pharmacy and the basic roles and responsibilities of pharmacists. Pharmacy is clinical health science which consists of discovery, production, disposal, safe and effective use and control of medication and drugs. The basic responsibilities of pharmacists include to safeguard subjects by ensuring that the investigational medicine product is appropriate for use and is handled and stored properly. The basic supply and dispensing of medication medicines, the maintenance of stock, preparing periodic reports, and to ensure that all these trial procedures comply with relevant guidelines and regulations. All these medicine dispensing procedures sometimes can be tedious and sometimes can lead to error. Hence, the future of pharmacy is to start with the incorporation of new technologies such as electronic dispensing, robotic and internet use, automated monitoring apps, and software and reminder devices, which will help in minimizing errors and technology evolution in the near future. To start with, the major technology that is prevalent now and is supposed to increase over the years is the power of internet. In future, there may be an increase in the number of internet pharmacies which are present today. These pharma companies are offering digitalization. They are preparing digital health mobile apps, devices, or services. These apps or this digitalization comes with a wearable monitoring device and an automated app, which can be of help that the patients will receive positive personalized feedback from it. These monitoring apps can be used for patients with chronic diseases, some asthmatic patients to record the peak flow readings, in diabetic patients to monitor the blood glucose levels. Also, internet can be used to search free health clinics, order medicines online, which will have a greater impact for future pharma practice. The next technology is about electronic prescribing. This technology allows physicians to prescribe, supply, and administer medicines electronically instead of using handwritten notes or prescriptions, which are now prevalent. The need of electronic prescribing is it will lead in minimization of errors due to some illegible handwriting in some cases. Also, poor communication by phone will be limited. It will increase the uh, treatment in patients and improving patient safety. It will also improve the drug surveillance and recall ability, and the patient security and confidentiality will be protected by strict privacy measures in this electronic prescribing system. The next technology is barcode medicine medication administrations. BCMA technology has been shown to reduce medicine administration errors as well as improve the completeness of medication history. This BCMA was devised to bring in five rights of medication administration, which includes giving the right medication to the right patient in the right dose at the right time by the right route. The next technology is related to automated dispensing. Automated dispensing technology or robotics are having the high potential to handle high volumes of dispensing. They are more efficient, more reliable, and less expensive than technicians or pharmacists. As these newer, smaller, and more efficient machines are becoming available, robot use in all sectors, from filling the patient prescriptions to organizing medications and delivering the medicines to correct patients, is increasing. Similarly, these machines also offer accuracy and efficiency in the labor dispensing process otherwise, and it also provides opportunity to offer more services and to provide more drug safety. The next is the major breakthrough in pharma technology, which is yet to develop in a large scale, is artificial intelligence and machine learning. Artificial intelligence is increasing or will increase in the near future in healthcare industry for conducting tasks such as data entry, lab analysis, data management, medical consultations, and medication management. Also, machine learning can be used for disease identification and diagnosis, radiology and radiotherapy, clinical trial research, personalized medicines, rare disease identification, and new drug invention. The next is the technology and medication reminder devices. Augmented reality and virtual reality is a promising technology which is recently developed to meet the needs of pharma industry. In the present scenario, in regard to COVID-19, it has shown to increase for no risk and efficient patient care. It will emerge even more stronger in the near future as remote care and in-house care will become more prevalent. The technology for medication reminder devices will include that the device will log after taking the correct dose. It will create an alarm or it will create a flash when the patient requires a dose, and it will also display the next scheduled dose for patient's convenience. Hello, sir. Is a video playing? Hello, sir.
Yes, sir. Yes,
Hello, sir.
the video is playing. Yes.
Okay, sir. I will just explain in brief as the video will play.
Okay.
Uh, the role of pharmacy and pharmaceutics is evolving, and the technology like artificial intelligence, virtual health, environment, social, and regulatory factors help develop new reintegrated future of health. In the next 20 years, delivery system will be dramatically different. But as pharmacy capabilities, medical breakthrough advance, the role of pharmacy will evolve in terms of affordability, personalized consumer experience, and increased care coordination. Within the broader spectrum, the technology will augment and enhance tasks. Regardless of the future path, pharmacy technology will evolve in the next 5 years, all for the benefit of patient. In terms of the convenience, health insights, cost savings, and better outcomes. Like for example, this person is preparing for his annual physical health checkup. Before his visit, a digital care plan is created, including the medication that he will require. His doctor will diagnose him as type 2 diabetes. A drone delivery system will be created and it will be filled and packaged. He will It will be supplied to the patient. He will ask he will ask his digital care plan some information about his blood sugar, and this will trigger a escalation from the event to the live chat with his pharmacist. While he is adhering to the care, his glucose levels will rise based on a practice agreement. The pharmacist will increase the dose of this medication, and an automated notification will be sent to his physicians. This, due to this care team and the data-driven decision from the pharmacist, this person will live a healthier and happier life. So the future of pharmacy is the basic technologies that I have mentioned previously will be put into action in the near future with the help of such technologies. To summarize the presentation, technological advancements in pharma will help both the patient and pharmacy staff to create a better experience and improve synergy between every step of medication. As our world continues to advance and develop, more and more efforts will be made to improve patients' health and safety while making the process more simple and automated. Automation, robots, and software will dispense drugs faster and more accurately. Pharma industry will definitely transform from dispensing a project to providing personalized treatment in the near future. Thank you so much, everyone, for your kind attention and wishing you all a very happy World Pharmacist Day. Thank you.
Thank you, Shruti. Thank you for the incitement. So next we have Sneha. Sneha Bhakat. Sneha, I have unmuted you.
Yes, sir.
Yes. So Sneha, I have made you host. Now you are the host. Please share the screen and then you can continue with the presentation. After Sneha, we will have Steve. The next presentation after Sneha will be of Steve. Steve, please be ready. Yes, Sneha, you can share the screen. Yes, Sneha, we are able to see your screen. Please open the presentation and then start.
Good evening, everyone. Today,
We are
I
not able
joined.
to. Sneha, your presentation is not open yet.
Sir, are you able to see?
I'm able to see your screen, but your folders are. We are able to see your folders. Your presentation, we are not able to see.
So I'll try to share it again. Sir, now are you able to see the screen? Hello.
Sneha, we are able to see your screen. Please present your PPT. We are able to see your folder,
Sir,
not
my
the.
presentation is on.
So please go to the share screen from the option, select present the PPT. Okay. Yeah, when you share your screen, you will get the option what to present. So present your PPT.
So now, can you see the presentation?
Yes, we are able to see the presentation. You can start.
Good evening, everyone. The topic for my presentation is examining the role of technology in pharmacy. Yes, pharmacy has been known as a science of preparation and storing and dispensing of drugs. Mahadeva Lal Shroff was the father of Indian pharmacy education, and the ancient pharmacy was has its origin in Greece, ancient Middle East, and in Rome. And pharmacists were considered to be the people who used to assist the physician in medical care and were known as apothecaries. And the study of pharmacy evolved as a different part of medicine from 19th century. The need for technology in pharmacy due to location restrictions and due to other uh,
Sneha, we are not able to hear you clearly. Hello. Sorry, Sneha, we are not able to hear you. Hello.
hello.
Sneha, in between, we were not able to hear you. Now
Sir,
we are able
actually,
to.
here is a weather problem, so that's why some connectivity issues.
Okay, share your screen again and then you
Yes,
can
sir,
start.
sure. Are you able to see my screen?
Yes. Yes, Sneha, we are able to see your screen.
Sir, actually, I'm not able to navigate the slides. Just give me a second. Sorry for the connectivity issues. Technology in pharmacy now. Electronic prescribing and discharge. Electronic prescribing and discharge is a technology in which the doctors prescribe medicines through an helps to reduce the communication gap between patients and doctors, and it also helps to reduce errors that are due to illegible handwriting or any other communication issues that have been there between the doctor and the patients. Electronic automatic prescription was first discovered in USA in 1990, and it has with the time it has been proved very good method for prescription as the data transmission is very accurate and efficient. Barcode medicine identification. Barcode medicine identification means that the drugs are barcoded and you can scan for the barcodes for what drugs the patient has asked and whether if we are giving the same drugs to the patient. This will help reduce errors while distribution of drugs to the patients, and also it also cross check whether the medicines that we have prescribed and medicine to patients correctly. Automated dispensing. Automated dispensing is a computer controlled dispensing, storage and tracking of medicine. It is used to improve efficiency and control narcotics and other medications. It also improves patient safety as only the medicines that have been programmed in the machines only will be dispensed for certain patients. So there are less chances that there is misinterruptions in the medicines that the patient is taking. Digitization of medicine. There are many fitness apps nowadays which help to track the health of a patient, and doctors can also keep a track on patient health via sensing via mobile sensors or biosensors. And patients can also order drugs online via e-commerce apps that such as MedLife and app, and there are various apps that helps to connect patients to the and digitization of has also helped to has also helped the doctors and patients to not be restricted to location, and it also helps insurance companies to verify documents and prescription given to the patients. Adherence monitoring, smart pills that help the patients to record side effects of the investigational drug. The smart pills are kind of sensor pills that will produce a sense when taken by the patient, and they will produce a sensor, and then they will produce a signal or transmit a signal to a patch on the skin, which can be seen or displayed on the mobile or tablets if connected through that device. Telecare. Telecare is a digital communication between patients and doctors through audio-video calling. This will help doctors and patients. This will help patients who live far away from traveling so far to the doctors. Doctors can consult directly through video calling, and it will also help in internet pharmacy supply. Digital technology is now being developed for patient demographics. Technologists and pharmacy future. AI, that is intelligence, artificial intelligence and machine learning. Artificial intelligence basically focuses on the development of new drugs, and it also, with the help of artificial intelligence, we can also determine what kind of patient population will be suitable for the trials, and what will be the effect estimated drug. IoT integration, that is Internet of Things integration. Integration means combining networks or connecting devices towards monitoring sensors. This will help in locating the shipment of various products, and it will also give a signal about the various facility and data consistency from various places across the globe. With the help of IoT integration, nanorobots can be synthesized, or nanorobots can be made that will help in sensing what effect does the nanorobots have on human body. 3D printing drugs. 3D printing drugs are personalized drugs. This will help to design and develop drugs according to the patient needs. This may also help in severe cases where the patient needs high dosage drugs to control the disintegration form. The first 3D printing drug was approved by FDA, which was for which was for disease epilepsy, and the drug is Spritum. Nanorobots are small biomolecules that are programmed to perform specific tasks in living systems. This nanorobot have applications in drug delivery, and they can also be used in cancer treatment and various other deadly diseases. Organ on chips, 3D microfluidic cell culture that stimulates the activity as an organ. These are the organs that are developed on the chip or a cell, aggregated cell that function as an organ, and this will be an alternative for this will be alternative to traditional drug testing on animals. And with the multiple organ chips, we can also study the stimulated effect of organs and how the organs are interconnected in the human body. Thank you and happy World Pharmacist Day to all of you.
Thank you very much, Sneha. So next we have Steve. So Steve, I have unmuted you.
Yes, sir.
So now I am giving you the host rights. Yes, Steve, you are the host now. And after Steve, we have the next student is Sonu. So Sonu, please be ready. After Steve, you have the presentation. Yes, Steve, we are able
Just
to
think
see
about
you.
this one fact, ladies and gentlemen. Yes, sir.
Yeah, you can start.
Thank you. Think about this one fact, everyone. There are very few professions that actually have people where we have individuals sacrificing their own life, putting their life on the line, even though they know that tomorrow they might be their last. A few professions are like such. For example, doctors, we have soldiers, and we have the unsung heroes always, the being pharmacists. With this, we also need technology to help these unsung heroes to perform tasks to ensure that the world is free of pain and suffering. With this, my dear colleagues, this is Steve Brandon Wood, and I'm here to present on the topic examining the role of new technologies in pharmaceutical practice now and for the future. Now we know that today's world is a very fast-paced world. It's a world that is demanding a lot. And at the same time, we have diseases which is on the rise, and we are in need of many cures for many diseases. And yes, technology plays a very vital role in this scenario, being for us to be enable us to actually provide services to people in need, to relieve them of their suffering. And yes, technology has to be streamlined, efficient, and reliable. With pharmacists all over the world dedicating their lives, gadgets and technology, as I said, plays a very integral part in determining whether a patient could live the next day or live for an entire year. Hence, nowadays, talking especially in the part of clinical trials, we have various technologies and options which were not available decades ago, which have enabled us and would also enable us in the future to make the process much more streamlined, efficient, robust, and even more reliable for the patients to actually approach and for us to find cures and give them cures as they need it. So what actually started this entire phase of development? We have a very simple timeline of here. In the 1950s was when a system was actually brought into place for actually collecting all these data. Ensuring people that they have a record of whatever they did so that the correct drugs could be given to the right patient, or even new patients could be brought in and the data can be stored. In the 1970s, with the arrival of the floppy disk, paper and the data on it can be transferred to a floppy disk, which can store data in much larger volumes when you compare to paper type of storage. Then we have by the 1990s and the mid 2010s, we had the boom of internet. We had the capability now to reach people standing from one corner of the world to another. Because of this, telepharmacies, as many of my friends said, became on the rise. It started to develop. It started to get itself enhanced. And with much more efficient and much more capable software and hardware, this was made possible. And finally, from 2011 to the present day, we have artificial intelligence on the horizon, IoT, Internet of Things, which would not only now but shape the entire future and even the forthcoming days of our way of approaching clinical trials and delivering medicines to the patients. Next, we have the three edges of tech today. When we talk about the latest of technology, as many of my friends have already said, I do believe that these three principles are like the edge of what determines the technology for tomorrow. One being the Internet of Things. Second, we have the artificial intelligence. And then we have the various sensors which work hand in hand. The reason why I had put these three in this order is because it's a very logical explanation. When we have Internet of Things, when we have multiple devices which are connected and synchronized together, the work of collecting information becomes much, much more easier. For example, when we talk about a trial, when we have a particular source of data which is stored in a particular system, a particular instrument, but when it is a bit tedious when we have to individually go and collect the data. But when we talk about Internet of Things, we are all these devices contained in one single spot, and that actually enhances us to gather information much more faster. And Internet of Things works hand in glove when it comes to artificial intelligence. When Internet of Things is present, and with the power of artificial intelligence, processing power becomes much more easier. The time lag that exists in the existing processes can be completely removed. And when we talk about the sensing technologies, that also comes into the picture. When these three things form together into like a cogwheels of a clock, this enables for the entire scenario to become much more robust and much more streamlined. We have two important factors when we always take into consideration new technology to be used. One, especially when it comes to clinical trials, one is the robustness and the reliability of the data collected by these instruments by using their intelligence. And the second part is the speed of collection of these data, not just collecting and storing them, but the power of analyzing this data and also the interpretation and giving us results so that the next phases of implementation can be taken forward. A modern breakthrough that we can see these days as a result of these is actually the usage of tablet devices. Wearable tech has become such an important tool, especially when it comes to clinical trials. As many of my friends said, wearable tech, when it is applied together with IoT and artificial intelligence, helps us to collect data constantly from a patient. There is no need for a patient to actually come to a place and then collect a particular file data if we need the data at a particular time. That is when real world evidence comes into picture. Real world evidence is a very fascinating concept. It's a concept which is now being widely used around the world to collect data in real time from larger populations, which helps us to compare data sets from one point of a data set to another, one different data set with another different one, and actually examine the causes, the working of a medicine on different populations. And then we have M-Health systems. We have plenty of apps these days, which can give us the right medicine, provided we order it. Then we have teleprescribing, e-prescriptions given by doctors. We even have consulting sessions online these days. And now with the introduction of AI and IoT to enhance these processes, it is going to become even more, much more powerful and much more reliable in the future. What do we expect from the future if we are having so many developments? The next step is going to be applied AR. We have AR right now to experience certain phenomena. For example, there was a study where they used VR to experience how a person with migraine actually feels. Well, when it comes to applied VR in the future, it will even enlarge in scale with extended reality, where technologies are highly likely to become predominant in trial operations in the space. It will further facilitate daily operations, enhance compliance and assistance. Then, because we have the real world evidence scenario, harnessing the potential of continuous patient data will also enable us to produce even more better results for the upcoming generation to provide drugs for the next generation to come. And because of all these systems, now because we have these systems, we are only able to adapt certain trials to whatever changes we get. But because of these systems, We will be having flexible trials in the future, where it will be much more easier, much more enhanced to conduct trials. Last but not the least, fully virtual trials are projected to become standard in the future. Patients sitting at the comfort of their own home can be part of a trial. Drone technology can be used to deliver their medicines. The wearable watches on their hands can deliver constant data and also help the doctors to analyze them to pinpoint accuracy. So, with all these technologies in place, even though there are slight hiccups here and there, the pros outweigh the cons when we talk about the future of healthcare in general. Last but not the least, all the pharmacists, all the doctors, and all the trials in the world are working towards this one statement: to create a world free of pain and suffering. With this, my dear colleagues and dear staff members, I'd like to thank you for giving me this opportunity to present, and also like to wish you again a very happy day of pharmacy.
Thank you, Steve. Thank you very much.
Thank you, sir.
Thank you. Next, we have Sonu. Sonu, I have unmuted you.
Yes, sir.
And I made you host. Now you can present your screen, share your screen. And after Sonu, next student we have Swapnali. So please be ready. After Sonu, you have the presentation.
Sir, is it visible?
Yes, Sonu, your screen is visible. You can start. Thank you.
Good afternoon, everyone. First of all, wishing you all happy Pharmacist Day. And I'm here to present about the role of pharmacist in healthcare system. First of all, we will have a definition of pharmacist. In simple, a pharmacist is a person who is professionally qualified to prepare and dispense medicines and medicinal products. Then what is pharmaceutical care? Pharmaceutical care requires rational and safe drug use. In the new concept of pharmaceutical care, pharmacists directly interact with patient, and doctor takes direct responsibility of patient care with common goal improving the patient care. Different components of pharmaceutical care: assessment of the patient, then evaluation of medication therapy, development and implementation of a plan of care, follow-up evaluation, and medication monitoring. We have clinical pharmacy practice, and this is of hospitals and community-based. Clinical role of pharmacist in hospitals. You can see there is drug therapy selection in hospital, education program, right dose, provide patients with right medication, therapeutic drug monitoring, drug education, and drug use evaluation. Then next is community pharmacist. Healthcare professionals most accessible to public in community pharmacist. Major role of community pharmacist: processing of the prescription, patient care, monitoring of drug utilization, responding to systems of minor ailment, informing healthcare professionals and public. Role of clinical pharmacist in healthcare: ensure and advance rational drug therapy. They are drug therapy experts, objective evidence-based source of information, unique set of knowledge and skills, primary source of valid information, and best use of medication. Thank you. Wishing you again World Pharmacist Day.
Thank you, Sonu. Thank you for your presentation.
Thank you.
Next, Swapnali. I have unmuted you.
Yes, sir.
And now I have given you the host rights. You are the host now. and you can share the screen. After Swapnali, the next student we have is Sinopol. So Sinopol, please be ready. After Swapnali, you will be presenting.
Sir, I'm audible?
Yes, you are audible, but not your screen is not visible.
Um, One second. So now,
Yes,
so
it
now
is. It
it's
is.
on.
Yeah, it is showing that you have started sharing your
Okay.
screen, but it's not showing. Okay, now it is.
Okay.
Now your screen is visible. You are audible. You can start.
Okay. Uh, Good evening, all of you, and happy Pharmacy Day, World Pharmaceutical Day. I represent my topic, that role of pharmacist in healthcare system. So during the last few years, the pharmacy profession has expanded significantly in terms of professional services and and professional services delivery, and now has been recognized as an important profession in the multidisciplinary provision of healthcare. Pharmacist is the backbone that strengthens to healthcare system. So who is the pharmacy? The pharmacy, also known as the chemist or druggist, are healthcare professionals who practice in pharmacy, as they deal with the mechanism, effect, composition of the drug, and effective use of drugs. Pharmacists interpret and communicate this specialized knowledge of patients, physicians, and other healthcare providers. Pharmacists are often the first point of contact for patients with health inquiries. Then they are the different role of pharmacist in different sectors of pharmacy profession, like industrial, academics, community health, clinical research, drug designing and discovery. Some of them are I will discuss. That is a community pharmacist. Community pharmacists are work from their own pharmacies or local healthcare centers and doctor surgeries. They are the they are helping in the public, assessing their conditions and making a decision about medicine. They also play a clinical role, such as a management of asthma and diabetes and BP testing. And they also helping the peoples in the making a diet chart and advance on health matters. Then there are the clinical pharmaceuticals. Clinical pharmacist knowledge of the drugs and healthcare provisions required to collaboration between companies, health professionals, and government in relation to clinical trial surveillance. Then there is the hospital pharmacies, which are play the vital role in the healthcare system. They are manufactured offer sterile medicines. They also managing the care of a patient with all types of conditions. They also working in a dispensary. The pharmacist providing information on medicines. They also advise patients on how medicine should be taken. The pharmacist specializes as a consultant in many areas like hematology, nephrology, respiratory medicines, urology, diabetes, infectious diseases, etc. And they also they also play a role in a blood pressure check, screening of cholesterol, glucose screening, and diabetes counseling, etc. Then in industrial pharmacies, they also play in a research and developments. The research and developments, they show a uh, different areas in the chemistry, biotechnology, microbiology, etc. They contribute to research and development of drugs. They also play in a role in a quality assurance. They have a broad knowledge of pharmaceutical science, which used to quality assurance through validation of products before release. Then there are the academic pharmacist. The academic pharmacist produces a skilled pharmacist which are involved in teaching, research, and training to the upcoming pharmacists. The education training is also providing by the pharmacists, which helps to professionals their current team. They are arranging the seminar projects and educational training also. Then the pharmacist is a complete profession which reflects on every sector of society, as an artist, as a designing a drug dosage formation, as a lawyers having fair knowledge of laws and legislations about the drug. Then they are as an engineer having sound technical knowledge, and as a health professionals having fair knowledge regarding the health. So they are the pharmacist as an integral part of healthcare, which are responsible for ensuring that right drug to right patient at the right time, in the right dose, through right route, in the right way. Thank you, sir. Hello.
Yes,
Thank you, sir.
thank you. Thank you very much. So next we have Sino. Sino Paul, I have unmuted you. Are you able to hear me?
Yes, sir.
Okay. So I'm giving you the host rights. And you are the
Yes.
host now, Sino. You can present, share your screen. And after Sino Paul, the next student who is going to give the presentation is Dr. Taruna. So please be ready.
Is it visible, sir?
Yes, your screen, your PPT is visible. You can start. Thank you.
Good afternoon, everyone. First of all, wishing you all a very happy World Pharmacist Day. I am Shainu Paul, a student of Clinical Research and Clinical Data Management. Today, I am here to share you my ideas on the topic Role of Pharmacist in Healthcare System. Before moving on to the topic, first let's discuss on the term health. The term health means different ideas to different kind of people. In concept of a layman, we can say that health is merely the absence of disease. But the World Health Organization, that is the WHO, has set a standard definition for the term health as a state of complete physical, mental, and social well being, and not merely the absence of disease or infirmity. So, health is such an important factor. Health we can consider as an integral part of development. We are most familiar with the proverb which is related to health as health is wealth. Only if an individual of a particular nation is healthy, then only development will come to that nation. Development in terms of economic, in terms of social, infrastructure, or any other case of development. Then next, health is central to the concept of quality of life. Quality of life in terms of health, it is a multidisciplinary concept which includes physical health, mental health, social health, and even emotional health. So, taking all this into consideration, we can say that health is a worldwide social goal. And in order to maintain or in order to achieve this social goal, what the nations are doing is they are taking care of the healthcare system. Then what is this healthcare system? Suppose a doctor or a nurse, or in case of institutions, we can take in as a hospital as example, that alone cannot contribute to the healthcare system. So, in order to that, what we need is a sum total of all organizations, institutions, and even resources whose primary aim is to improve the health and to provide knowledge into the field of health. And these healthcare systems need many staff to perform the duties. They need fund, they need information, supplies are also needed, and in other arena, transport is needed, communication, and many other purposes are also needed. And WHO stated that a health system needs to provide services that are responsive and financially fair. Responsive means that should be efficient, and financially fair means that should be affordable to even the local people in a nation. Then there are certain professionals in the healthcare system that broad classification of them as direct professionals and indirect professionals. Direct professionals means those that are having a direct relationship with the patient in terms of patient care, and indirect professional means those that do not have this direct relationship. These direct professionals include pharmacists, physicians or doctors, nurses, compounders, dispensers, etc. While indirect professionals include engineers, teachers, and each and every person are involved or included in this indirect professional. Our major concern here is about the pharmacist. These pharmacists are the health professionals, also called as chemists or druggists, who are having specialization in the use of medicines. They even have the license to dispense drug and also to provide drug information. We know that in earlier days the role of pharmacists was only to dispense the drug. They were not having or not given any other role other than that. But that traditional role of pharmacists have now emerged into another field, like they are working now as patient oriented, and they are contributing to the public health function. They are now the most accessible member of today's healthcare team. That is, they are working 24 into 7 with no appointments. And also, they can work in any public setting. They don't need a hospital to work, they can work in any kind of public setting. As they are the first source of assistance, they give advice on many common ailments and healthcare matters. Then, why pharmacy? Pharmacy is actually a link between chemical sciences and life sciences. This link between chemistry and biology ensures us the effective use of drug and medication. Here, I have listed some of the roles that a pharmacist plays in a society. The first one is the advice and counsel of patients. Advice and counsel means they can give better healthcare tips to a patient. They can answer their specific questions and clarify their doubts. They can even make healthy life choices for them. And the next is change referral path. Suppose a person living in a locality has got some health issues, and he is then coming to a nearby pharmacist and asking him to which doctor he has to refer to. Then this pharmacist can guide him in a perfect way or in a right way, because this pharmacist have a better knowledge about all the hospitals, all the doctors, and all other institutions in that locality. And it is not limited to that locality. They are having the knowledge internationally, nationally, and locally also. That is why a pharmacist plays a role in changing the referral path. The third one is being there during an emergency. During an emergency situation, even a local pharmacist can help you with a medical emergency aid that can even save the life of many people. Next is he plays the role of an excellent guide. That means that pharmacist can guide a patient with best benefits, like he can give the correct dosage, he can give the best ways to have a product, and also he can say or tell about the potential side effects of the drug that is prescribed to the patient. Then the last is empowering patients. Empowering means they are impacting knowledge into them. They can even motivate and boost their confidence. Then the role of pharmacist is not limited to any field like academic community or something like that. But I have listed here 4 fields where the pharmacist plays a role. First is the academic, second is community, then hospital and industrial. Then we can take a glimpse on each sector. First is the academic pharmacy. Academic pharmacy means where the new generation of tomorrow's pharmacists are being mentored and taught by the professionally qualified pharmacists. They not only this teaching process is happening there, they are conducting researches, they are publishing articles, they are organizing seminars so that the knowledge in the field of pharmacy is being enlightened. Next is the community pharmacy. Community pharmacy include healthcare professionals that are most accessible to the public as our local medical shop or like that. These people can supply medicines either with prescription or without prescription. The next one is the hospital pharmacy, is the pharmacists which are working in a hospital setup, and they are the only professionals who are having a direct relationship between other healthcare professionals and patient. They plays a vital part in the health and their main focus is on the patient. Next is the industrial pharmacy. Industrial pharmacists are mainly involved in research. They help in designing, developing, and testing new medicines or treatments. All this they are doing is to ensure the safety and quality of the products that are being coming into the market. So, in conclusion, we can say that pharmacy is a complete position that reflects on every sector of the society. Each and every pharmacist working in their own respective field are contributing either directly or indirectly into a nation's health. So, the main mission of the pharmacist is to give a right drug to right patient at the right time, in right dose, through right route, in a right way. So, we can conclude that the pharmacist is an integral part of the healthcare system. These are some of the references which I look for. And thank you. I'm taking this opportunity to thank Team Cliniminds for giving me this opportunity, and thank you everyone for your patient listen. Thank you.
Thank you very much, Sainath. Thank you. Thank you
Thank
for
you,
the
sir.
presentation. Next, we have Dr. Taruna. Dr. Taruna, I have unmuted you.
Yes, sir.
Okay, and now you are the host. Now you can share the screen. And after Dr. Taruna, the next student we have is Tessy. So Tessy, please be ready after Dr. Taruna, okay? Dr. Taruna, you can
So
share the
is my
screen.
screen visible?
Not yet. Yes, now it is coming up.
Am I audible, sir?
You are audible, Taruna, but we are able to see only a blank. Uh, not able to see your screen, your PPT.
Is it up,
Now
sir?
we are. Okay.
Okay. So,
Okay, you can start.
okay. Thank you, sir. Good evening, everyone. I hope you all are well. Myself, Dr. Taruna Batra, and I've enrolled for the course Advanced Postgraduate Diploma in Clinical Research, Pharmacovigilance, and Clinical Data Management. So, you must have heard that not all the superheroes wear cape. And in the category of these superheroes, we have our pharmacists. So, from my side, I wish all the pharmacists a very happy World Pharmacists Day. My topic of presentation today is role of pharmacists in the healthcare system. So before that, may I know who is a pharmacist? Is it the only person to whom we go and ask for the prescribed medicine? No. The pharmacist is a person who is prepared to formulate, dispense, and provide clinical information on drugs and medications to health professionals and patients. A pharmacist is a one of the person in healthcare team and he plays a key role in providing quality healthcare and pharmaceutical care to the public. He has these categories also. He's patient, he's honest, he's alert all the time, plays a major role in research. He's a great motivator, an administrator. He's very courageous. have intelligence, he is studious, and he is a thinker. These all compile a good pharmacist. Now, whatever man asks from the nature has provided us. Let it be food, cloth, shelter, energy, and medicine also. But food, cloth, and shelter are the basic needs of human being. Are they nowadays too? No. Nowadays, medicine has become the major need of human being. Without medicine, there is no life. It acts as a sanjeevani for human being. Such medicines are manufactured by only pharmacists. These are the persons who play a very integral part in our healthcare system. As per the discussion held at British Pharmaceutical Conference in 1963, a pharmacist is regarded as an expert on drugs. What is the mission of a pharmacist? Just to give a drug, to formulate it and dispense it? No, it has the mission of giving right drug to the patient at right time in right dose through right route and in a right way. He cannot miss on any of the point from this. From ancient days, it is clear that medicine was prepared by a specialized person. That today we refer as pharmacist. Till today's date, medicine save life of human beings. Not one, but all. Now, what is healthcare system? Different countries have different healthcare systems working as different parts, but a healthcare system can be defined as a method by which a healthcare is financed, organized, and delivered to a population. It includes issues of access for whom and to which services, the expenditures, and the resources like healthcare workers and facilities. Now, what is the role of these pharmacists in healthcare system? It is not limited. It has clinical survey in clinical trials and post-marketing surveillance because the pharmacist has the knowledge of drug and healthcare provision which is required to facilitate collaboration between companies, healthcare professionals, and governments. As academic pharmacist, because he focuses on teaching, research, and training of the upcoming pharmacists. Academic institutes are the major source of pharmacists who add profession to the clinical healthcare system. In research and development, because pharmacists contributes to research and their expertise in formulation development is of particular relevance to the biological availability of active ingredients. In hospitals, because hospital pharmacists are a vital part of healthcare term. Working in either a PHC or private hospitals, being a hospital pharmacist means you are a part of team where the focus is firmly on patients only. Now, community pharmacists. Pharmacists work at the front line of healthcare in cities, towns, and villages across nation. They work from their own pharmacies or out of their local healthcare center. As a community pharmacist job, it would be all about helping the public assessing their condition and making decision about which medicines they should take. They will be involved in dispensing medicine and offering the patients advice and practical or help on keeping health. In sales and marketing, the pharmacist whose professional ethics demand a concern for the interest of patients, they can make a contribution to proper marketing practices which are related to healthcare and to the provision of appropriate information to health professionals as well as the public. Pharmacy is a complete profession. It reflects on every sector of the society in the form of artists because they know how to design a drug dosage form, as a lawyer because they have fair knowledge of laws and legislations about the drug, as an engineer because they have technical knowledge also, as entrepreneur because they have sound knowledge of management, accounting, marketing, and counseling, and healthcare professional because they have knowledge regarding health also. So, to conclude, I would say that the evolving healthcare landscape provides new opportunities for pharmacists to deliver services to enhance medication use and engage patients to improve their overall health. The evidence around pharmacists' impact on clinical and economic outcomes, it's very growing and overall points to remember to improving the therapeutic outcomes and reducing their costs. Moreover, we should maximize the utilization of pharmacists for better healthcare outcomes. Thank you so much for your patience and listening. Thank you.
Thank you, Dr. Taruna. And we have next
Thank you, sir.
Tessy. Dr. Taruna, you can be on mute now. Thank you. Tessy, I have unmuted you.
Yes, thank you, sir.
And You are now the host. You can share your screen. And after Tessy, the next student is Kavya. So Kavya, please ready. Please be ready after Tessy for the presentation. Yes, Tessy, we are able to see your screen and now you can start the presentation. Thank you.
Okay, sir. Good evening to one and all. The pharmacists are the health professionals who specialize in the use of medicines, that is, the composition, effects, mechanism of action, and proper and effective use of drugs. Today, that is the 25th September, we are celebrating the World Pharmacist Day. That is to promote awareness about the importance and role of a pharmacist. This is the 10th year, and this year's theme is Transforming Global Health, which is aimed to show how pharmacists contribute to a world where everyone benefits from access to safe, effective, quality, and affordable medicines and health technologies, as well as from pharmaceutical care services. This was quoted by the current FIP president, Dominic Jordan. And in this presentation, I would like to present the role of pharmacists in healthcare and their various specializations. We have the contents. Pharmacists, they are regarded as an expert of drugs because they deals with the composition, the effects, the mechanism of action, and proper and effective use of drugs. They can advise the patients and healthcare providers on the selection, dosages, interactions, and side effects of medications. Pharmacists can also monitor the health and progress of patients to ensure the safe and effective use of medication. With the knowledge about this mechanism of action of the drugs, the pharmacist can understand how the drugs should be used to achieve the maximum benefit with minimal side effects, and also how to avoid the drug interactions. Next, we will move on to the role of pharmacists. First is a clinical medication management, that is reviewing and monitoring of the medication regimens. Coming to the clinical assessment of patients, those patients with diagnosed and undiagnosed diseases. Next is a monitoring of disease states, that is the dosing of drugs in kidney and liver failures. Next is the providing of the pharmaceutical information, that is the drug information, which ranges from its identification, its cost, and the pharmacokinetics, that is to the dosage and till the adverse effects. Pharmacists also help in health monitoring and giving advice to the patients, including treatment of some common ailments and diseases, such as common cold. They also help in the correct dispensing of the correct doses of prescription medicines. The pharmacists, they educate and counsels the patients and other healthcare providers on the optimal use of medicines, that is proper usage and avoidance of the over medication. They also help in the pharmacokinetic evaluation, that is the absorption, distribution, metabolism, and excretion of the drug. The pharmacists promote public health by administering immunizations. The pharmacists can also construct drug formularies and they can do the compounding. Drug compounding is a process of combining, mixing, or altering the ingredients to create a medication which is tailored to the needs of the patient. The pharmacists, they help in ensuring the correctness of all the medication labels on the prescription medical containers. And these prescriptions or these medication labels, they contain the patient's name, the name of the medicine, dosage and instructions, and on how often to take the medicine. The pharmacists also give lifestyle advices for the community, which are based on health concerns like smoking cessation. And the pharmacists also work with the federal, state, or the local regulatory agencies to develop safe drug policies. Now moving on to the specializations for the pharmacists. For the academic, community, hospital, and industrial pharmacists, it will be dealt with in the coming slides. Let me tell you about the clinical pharmacists. The clinical pharmacists, they provide the direct patient care that optimizes the use of medication and promotes health, wellness, and disease prevention. Whereas a compounding pharmacist prepares a custom formulation of a medication to fit the unique need of a patient, which cannot be met with commercially available products. And a consultant pharmacist is the one who works as the consultant, providing expert advice regarding the safe use and production of medications. And an informatics pharmacist, he deals with the resources, devices, and methods which are required to optimize the acquisition, storage, retrieval, and use of information in health and biomedicine. Whereas a nuclear pharmacist is involved with the preparation of radioactive materials to improve and promote health through the safe and effective use of radioactive drugs to diagnose and treat specific disease states. And an oncology pharmacist ensures safety in compounding, preparing, and dispensing chemotherapy and are responsible for minimizing drug waste, managing drug shortages, and causing a decreased exposure to the hazardous drugs. And moving on to the regulatory affairs pharmacist, he acts as a link between the company and the local regulatory authority on matters relating to the quality, safety, and efficacy of the drugs. Now moving on to the academic pharmacist. The academic pharmacist, he focuses on teaching and training of the future generations of pharmacists and pharmaceutical scientists. And the main duties of academic pharmacists include administrative activities, scientific research, teaching professional student pharmacists, supervising research and teaching graduate students, speaking in scientific venues or publishing studies, student advising or counseling, as well as teaching student pharmacists through experimental practice sites. Now, the community pharmacist. The community pharmacists, they work at the front line of healthcare centers in cities, towns, and villages across the nation. And his job would be all about helping the public, assessing their condition, and making decisions about which medicines they should take. The community pharmacists are involved in dispensing medicine and offering patient advice and practical help on keeping good health. They also takes on more of the clinical roles that had traditionally been undertaken by the doctors, such as management of asthma, diabetes, as well as blood pressure monitoring. Now moving on to the hospital pharmacists. Hospital pharmacists makes up a vital part of the healthcare team. They would be working in either public health centers or private hospitals. And being a hospital pharmacist means that you are part of a team where the focus is firmly on the patients. And like doctors, this hospital pharmacists, they regularly attend the wards. They manages the care of patients with all types of conditions. They works in the dispensary and provides information on medicines for the whole hospital. And some hospital pharmacists, they specialize as consultants with special interests, like in the various specializations like cardiology, nephrology, etc. And moving on to the industrial pharmacists. Industrial pharmacists, there are many processes through which the industrial pharmacist takes up. First one will be the research and development. An industrial pharmacist contributes to the research and the expertise in formulation development and is of particular relevance to the biological availability of the active ingredients. And their research activities may include areas in new drugs discovery, in the manufacturing technology, formulation of drug products, improvement in the pharmacy practice, as well as enhancing therapeutic and health outcomes in patients. Next is the manufacturing and quality assurance. Broad knowledge of the pharmaceutical science ensures an integrated approach to quality assurance, thereby by including good manufacturing practices. Next is the clinical trials and post-marketing surveillance. An industrial pharmacist has a knowledge of the drug and healthcare provisions required to facilitate the collaborations between companies, health professionals, and governments in relation to the clinical trials and surveillance. And in sales and marketing, the industrial pharmacist can make a contribution to proper marketing practices which are related to healthcare and to the provision of appropriate information to health professionals and to the public. Also, there would be pharmacists with special interests who are involved in developing their skill and expertise in specialist areas such as cancer or diabetes or other research specific areas. Now, as a conclusion, I would like to say that the pharmacists help in every sector of the society. That is, by designing a drug dosage form, by having a knowledge about the laws and regulations about the drug, about the health of the patients, about the technical aspects, about marketing and counseling of the patients. In short, they are the key healthcare professionals who help people to achieve the best results. With this, I am concluding my session. Thank you so much, and a happy World Pharmacist Day.
Thank you. Thank you very much, Tessy. Next, we have Kavya. Kavya, I've unmuted you.
Yes, sir.
Now let's see if you are able to present or not. You are the host now, Kavya. Please try to share your screen. Yes, we are able to see now. Okay. Yes, you can start your presentation. We are able to see your screen.
Okay, sir. Sir, am I audible?
Yes, you are audible, Kavya. You can start.
Okay. Good evening, everyone. My name is Kavya. Today I am here to present on the topic role of pharmacist in healthcare system. As we all know, today, 25th September, globally this day is celebrated as World Pharmacist Day. I would like to express my gratitude to all pharmacists out there who are working in the middle of this pandemic. First of all, let's look at who is pharmacist and what do they do. Pharmacist is a frontline healthcare professional, also known as chemist. They are mainly focusing on giving safe and effective medications. They are the bridge between doctors and patients. They are always available to answer all the health related questions by the patient. One of their role is to promote health of the patients. They advise patient so how to make healthy lifestyle changes and also indicate you the prevention measures to take in order to improve your health and reduce the risk of diseases. They deal with all the fields related to medicine, from extraction, synthesis of medicine, clinical and non-clinical experiments, monitoring, pharmacovigilance, etc. Pharmacists, they mainly practice in pharmacy, the field of health science focusing on safe and effective medication. How they work? Like pharmacists work in many different work environments. There are community pharmacists, there are hospital pharmacists. Community pharmacists also called retail or high street pharmacy. Most of the pharmacists work in community and hospital pharmacy. Community pharmacy, which mainly include monitoring blood pressure, cholesterol, checking cholesterol levels, etc. In hospital pharmacy, they maintain some medical records. Getting into the role of pharmacist, the quality of medicine, they always check the quality of medicine that's supplied to patients, ensuring that the supply of medicines is within the law, ensuring that the medicine is prescribed to patients are suitable, and they also giving advice to the patients about medicine, how to take them, and reactions, what are the reactions may occur after the medication, and they are responsible for answering all the patients' questions. They're checking dosage, they can give general advice on diet, exercise, and managing stress, etc. They can advise other healthcare professionals about safe and effective medicines use and provide service to the patients, such as smoking cessation, blood pressure measurement, cholesterol management, etc. And they also play a bigger role in pharmaceutical industries. They supervise production and operation of medicines. They assess the quality of medicines before they are supplied to the patient. What are their roles? They gives you information about your prescription. When your pharmacist receives your prescription, they immediately analyze and start asking some questions. Is the prescription appropriate to treat the condition? Is the dosage is adequate? Are there any interaction with other medication you are taking, etc. Second important thing is they follow up on your treatment during or after the medication. Your pharmacist makes sure that you are not suffering from any of the side effects and that you are taking the appropriate dose and that the treatment is working or not. And some industrial pharmacists, they also contribute to the research and development process. And community pharmacists, they gives advice to the patients about basic food needs, helps in correcting improper food habits, and helps in suggesting diet plan for diabetic patients. Community pharmacists mainly do counseling process. Pharmacists manages our medication, whether these are taken in pill form, creams, syrup, patches, or injection. They give priority to the quality of medication and the service you receive. And he makes sure we make good use of our medication and make sure that how your how our treatment is working and how to take it to ensure maximum efficacy and safety. What I conclude is pharmacists play a bigger role in all our lives. They are the one who is responsible for giving safe and effective medication, and they're also responsible for ensure that right drug is given to the right patient at right time, in right dose, through right route, in right way. That's the end of presentation. Thank you.
Thank you very much. So next we have Rashika again. So Rashika has some network problems, so she requested that Archana will present the screen and Rashika will give the presentation. So Rashika, I am unmuting you and I am giving the host right to Archana.
Yeah, okay, sir.
So Archana, you have the host right now. You can present present Rashika's presentation, and then Rashika, you are unmuted. You can start with the presentation. Yes, screen is visible. Rashika, you
Yes.
can start.
Yes. Good evening, everyone. Firstly, I would like to wish all of you a very happy World Pharmacist Day. So today I'll be presenting on the topic, the role of a pharmacist in the healthcare system. Now, firstly, we'll be studying that who is a pharmacist. A pharmacist is a person who is licensed to prepare, compound, and dispense drugs upon written order, that is the prescription from a licensed practitioner such as a physician, dentist, or advanced practice nurse. A pharmacist is a healthcare professional who cooperates with, consults with, and sometimes advises the licensed practitioner concerning the drugs. So basically, a pharmacist is specialized in the use of medicines as they deal with the composition, effects, mechanism of action, proper and effective use of drugs. Next is the healthcare system. Now, what is a healthcare system? A healthcare system is the sum total of all organizations, institutions, and resources whose primary purpose is to improve health. It needs staff, funds, information, supplies, transport, communication, and overall guidance and direction. It needs to provide services that are responsive and financially fair while treating people decently. So basically, a healthcare system is an organization of people, institution, and resources that deliver the healthcare services to meet the health needs of the target population. Next is the role of pharmacists in various sectors. So, in various sectors of the healthcare system, the role of pharmacist is in clinical surveys as an industrial pharmacist, drug inspector, and government analyst, then academic pharmacist, community pharmacist as a medical representative, research and development, wholesaler and retailer. He is also known as a druggist and chemist, then the hospital pharmacist. Next is what can a pharmacist do for you? Basically, your pharmacist is your medication expert. So there are a few roles which are mentioned here. Like the pharmacist can interpret the drug interactions. He can counsel on prescriptions, make medication information understandable, provide vaccines, over-the-counter counseling, help you stay out of the hospital, manage chronic diseases, help you quit smoking, make it easier to make your medication, stay up to date on what matters to you, verify, prepare, and check medication, wellness, screenings. Next is about the academic pharmacist. So an academic pharmacist, he focuses on teaching, research and training of the upcoming pharmacists. So basically they are involved in the teaching and training of the future generation of pharmacists, and they are also engaged in the research within that institution. Next is the research and development, which comes under the industrial pharmacist. The pharmacist contributes to research, and their expertise in formulation development is of relevance to the biological availability of the active ingredient. So basically they are involved in the research and the development as they have the knowledge about the drug. Next is manufacture and quality assurance. Pharmacists' broad knowledge of pharmaceutical sciences ensures integrated approach to quality assurance, including good manufacturing practice through the validation of various stages of production and testing of products before release. Next is drug information. The pharmacist has the knowledge and expertise to have detailed information on medicines to members of the health profession and the public. Also, pharmacists provide an information service within the company. So they will let the public know about the side effects of the drug or their indications, their contraindications. Next is in the clinical trials and post-marketing surveillance. So the pharmacist has the knowledge of drug and healthcare provision required to facilitate collaboration between companies, health professionals, and governments in relation to clinical trials and surveillance. Then the community pharmacist. As community pharmacists, job would be all about helping the public assessing their condition and making decision about which medicine they should take. They will they will be involved in dispensing medicine and offering patient advice and practical help on keeping health. So basically, they are involved in supplying the prescription medicines. Now, the hospital pharmacist, they are responsible for monitoring the supply of all medicines used in hospital and are in charge of purchasing, manufacturing, dispensing, and quality testing their medication stock along with the help from pharmacy assistants and pharmacy technicians. So I would conclude this topic by saying that pharmacist is the first person of the healthcare system who is playing various roles like academic pharmacist, industrial pharmacist, community pharmacist, clinical pharmacist, and hospital pharmacist, etc. All pharmacists working in different fields of profession are directly or indirectly related to nation's health. Finally, pharmacists are responsible for ensuring that right drug to right patient at right time in right dose through right route is in right way. Hence, pharmacists are an integral part of the healthcare system. Thank you, everyone.
Thank you. Thank you very much, Rashika, and thank you, Archana, for helping out Rashika with the presentation, display, and sharing the screen. So, guys, we have one student who has joined now, Mehul. Mehul, I'm unmuting you. Please let me know if you are ready for with your presentation. Mehul, are you able to hear us? Oh, I don't think he is. That's why he has some network issue. That's why he's joining and again leaving and again joining. No problem. We can leave him. So that's the end of, we come to the end of the presentation competition, guys, and it is really a good experience to listen to all of your points and the thought process, the presentations, how you displayed it and how you presented that. Thank you very much. And now I request Amit sir to say a few words to all of us. Amit sir, let me unmute you.
Yeah, thank you, Kuldeep.
Thank you, sir.
And yeah, so once again, I'm back. So, team, how are you? It's a long way we have spoken since the morning. I can understand you're tired. Absolutely understand. I will again limiting my speech with a few words here. So first of all, I thank all of you as what we have the energy, the enthusiasm which we have shown in the participation and making this particular activity and interact will be a very kind of interesting one and energetic one. And this is one of the platform by which we are able to share our thoughts around the topics which we have been chosen as a part of the presentation. Part of the competition is separate, okay, part of the competition is separate, but we understood how is our experience, and likewise we are gaining this is an opportunity where we gain certain experiences surrounding, and everyone is trying, those who have utilized this opportunity of being sharing your thoughts, expressing yourself on a larger platform where we were close to 40 plus people around in this discussion. So everyone, all these innovative kind of or maybe searches which you have done, I'm sure in a given time of span, if you go back and prepare something, I'm sure you must have spent good amount of time with the searches, finding the facts, finding out the figures, we are finding out the references around and searching around, doing lot of creativity. I perfectly understand the entire amount of effort that you have put in this activity. So once again, appreciate all of you on this note. Now interesting part which comes up is all of you looking at since it's a competition, we have a mandatory part which comes is the sharing the results. Are you curious, yes or no? Okay, but little bit hold on that curiosity, because we at a judge panel we came across that the certain presentations where such a where with a or maybe majority of the some of the presentations, we are literally thinking us that we need some quality time again that we need to queue, and some of the very close kind of evaluations they are coming, and we are thinking we should spend little more time on the evaluation, and we are keeping this curiosity going on till Monday. By Monday we would be able to share the exact what is the result of this competition. Okay, apart from the competition, yes, everyone, please do not this is a part of a simple maybe learning, take it as a learning, and what we have gone through this particular experience. So this is just take a part of a journey of that learning. Do not those who wins, again, of course, they are going to be appreciated with a kind of certificate of the recognition on that part. But yes, those who have participated also, they will be also be issued with a participation certificate. And this is what I can conclude on this note, that we are so again thanking everyone, and to this is basically so we could contribute, or we could memorize, or we could revise our contribution till time or before to this time, or even what we are going to do in future with regard to the contributions in addressing the challenges, overall challenges which we are currently having. So that way we could celebrate uh, moments around the world's pharmacist day. So a good time we could uh, spend on this discussion. So I would thank all of you once again, and conclude this competition today. As mentioned, keep in mind the results should be shared on Monday. Okay, and the certificate part would be also, so the communication would be done via academics, so you will be just wait for that communication to come to you. And yes, definitely we will be again back to our sessions once we come back to our routine discussions. So that's all from my side, Kuldeep. So over to you. Just let me know with
Thank
what I
you.
have to do. Yeah.
Thank
So
you, Amit. Thank you very much
yeah.
for sharing your thoughts and appreciating the students for whatever. Uh,
And one more thing I forgot. Okay, because now Kuldeep would be in a he would be closing note, so I should not miss on that. Since the morning, one person is doing a lot of work coordinating this entire activity. Who is this? Anybody among the participant? Who is the person who is coordinating here since the morning? He's plenty of places. He is asking you unmute, mute, giving time instruction. Who is that person? So that person is nothing but Kuldeep. So I would thank him for taking all the and kind of efforts on this particular, making this activity as smooth as possible. So thank you, Kuldeep, on the way the coordination part of it. So thanks from my side. Yeah.
thank you, Amit sir, for those words, and thank you everyone for every student who have given the presentation and the student who are present here for listening all the presentations. This World Pharmacist Day is really a memorable one for me and also for all the faculties here. And I myself is a pharmacist, a postgraduate in a Masters of Pharmacy in Pharmacology. So this is really a special day for us, and you all have made it more special by these presentations and these enlightenment sessions, you can say. Well, very well done, guys. Thank you very much. And as Amit sir mentioned that you will be getting your results on Monday. So after the results, don't get disheartened. All of you have done good work. So this is a competition. So one will win and the others will have to lose. So that's a part of the competition parcel. So guys, I want to thank uh, the judges. So for your information, students, the judges for today's competition are Amit sir himself, a judge, was the judge, and Dr. Vipra was the judge. Soja ma'am was the judge, and myself was the judge. So we four were the judge here, and I really thankful to Dr. Vipra and Soja and Amit sir to uh, judge this competition and take out time from their schedule to available for this activity, for this competition. Thank you very much, Dr. Vipra, Soja, and Amit, for your availability. Thank you very much. And in between, I saw that Rahul sir, Rahul Malia sir was also joined the session. So thank you to him also that he has taken the time to uh, join the session. Uh, and I'm thankful to Mr. Kamal Sahani sir that he has allowed us basically to skip the sessions and schedule this activity on this World Pharmacist Day so that everybody can contribute. Uh, you all have contributed a lot. So special thanks to him for allowing us and providing us these technical facilities and other facilities to coordinate this particular session and complete it successfully. Thank you very much, sir, and to all marketing people and the admin people, technical people. Thank you very much for making this uh, program, a competition, a successful competition. Thank you, everyone. Thank you all. Now, guys, as Amit sir mentioned, wait for the results till Monday, and you all will be getting a participation certificate. Okay, and the winners will get the prizes at their home with the certificate. Okay. If you have any questions for Amit sir, me, Dr. Vipra, and Soja, you can ask me now, or else we can end the session. No, I think Amit sir, do you want to say something?
No,
No.
that's perfectly fine. Thank you, Kuldeep. Yeah.
Thank you very much, everyone. Thank you again. Thank you, Dr. Vipra, Soja, and Amit sir, for taking out time for judging this competition. Wait for the results and hope for the best. Thank you. Enjoy your day.
Yeah. Be happy and be safe. Thank you.
Enjoy your weekend, guys, and stay safe,
Thank you,
Correct.
stay
sir.
healthy.
Thank you, sir.
Thank you,
Thank
sir.
you. Thank you. Thank you.
Thank you, sir.
Thank
Thank you,
you.
ma'am.
Thank you. Thank
Thank you,
you.
sir. Thank you, ma'am.
Thank you.
Thank you.
Thank you.
Thank you,
Thank
ma'am.
you. Thank
Thank
you.
you, ma'am.
Thank you. Thank you.
Thank you, everyone.